signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland.
Members, at the commencement of our sitting, let us be still. Members, please take your seats. Yeah. Point of
Caoimhe, I note that yesterday Minister Poots made a statement outlining some additional funding for the fishing fleet here, and no doubt that is very welcome for the hard-pressed fishing industry, which has been hugely impacted by the COVID crisis. However, I did note that the statement was read as a written statement yesterday morning. I noted the Minister was available for media later on in the afternoon. Can I make the suggestion that in situations when this Assembly is actually convened and we are actually here, that on sitting days, that rather than issue a written statement for such announcements, that may be more appropriate for the Minister to attend the House in person and make that as an oral statement so that members can have asked some questions and make some comments in relation to it. And be grateful that could be brought to the attention of the Minister and his department. Thank you.
Well, thank you. I mean, obviously the member has made his point, and the member will know and that I have been engaged directly with the Executive over the last significant period of time, and that's been in response on a number of occasions to issues raised by members of the Business Committee, for example, and other party members and other representatives throughout the chamber. And obviously I'd always have pointed out to the Executive and all of the ministers indeed that it is appropriate when significant announcements are being made, particularly on plenary days, that it would be important to respect the conventions and the courtesies which need to be afforded to the members of the Assembly. There is, of course, a balance to be struck on all of these matters, and clearly what I very much welcome, as the member has done, this fact that the statement was made yesterday, that a written statement was provided to the House in a timely fashion. And I've no doubt that the recipients of the funding will obviously welcome the announcement as well. So there is a balance to be struck when members expect ministers to come to the House. And as I say, I have been on the record, I think, quite well in terms of dealing with that matter on behalf of members, on behalf of the House. But I don't want to lose sight of the fact that we are, I think, receiving a significant increase in statements and so on, interventions from the ministers of all the ministers across the Executive to this House in recent times, and I want to sort of acknowledge that and appreciate the fact that we are getting a significant increase in business from the Executive to this House, as is proper and appropriate. So the member's made his point, and obviously I will continue to engage and liaise with the Executive as and when the need occurs to make sure that this House does receive the courtesies and respect that it's entitled to have. Okay, member, thank you for that. Get this statement here now. I've received notice from the Minister of Finance that he wishes to make a statement. Before I call the Minister, I'd remind members that in light of social distancing being observed by the parties, the Speaker's ruling that members must be in the chamber to hear a statement if they wish to ask a question has been relaxed. Members do still have to make sure that their name is on the speaking list if they wish to be called, but they can do this by rising in their places as well as notifying the Business Office or Speaker's table directly. I remind members to be concise in asking their question. This is not an opportunity for debate per se, and long introductions would not be allowed. Minister.
I wish to make a short statement concerning the upcoming Chancellor Spending Review and the wider Westminster funding process. Together with my counterparts in Scotland and Wales, we are collectively making statements to our respective legislatures, setting out our expectations for more fiscal flexibility to manage the implications of COVID-19, proper involvement in the spending review so we can plan for our budgets, and a fair deal on EU funding. Members will be aware on the 23rd of September, Chancellor Rishi Sunak announced the cancellation of the autumn budget. This marks a departure from the normal convention of 2 fiscal statements a year, which provided a degree of certainty to the financial process. While this move in itself was concerning, what is of greater concern to the Executive is the continued lack of clarity over the upcoming spending review. Since the announcement of the spending review back on the 21st of July, I have been concerned about the omission of a date by which the process would be concluded. The Chancellor spoke about autumn, but going by previous Treasury statements, autumn can mean anything up to the second week in December. Caoimhe, I want to briefly outline why the spending review outcome date is so important to the Executive and to this House. The spending review outcome is the first time that we will get an idea of what the overarching budget envelope will be for the Executive for the coming years. Without that information, it is impossible to plan effectively. The delay in the spending review leads to a delay in the local budget process, making it harder for ministers to plan effectively for the years ahead. This is made all the more acute by the uncertainty around COVID-19. Today, we are collectively asking the British Government for urgent clarity around the timing and scope of the spending review. In a period where future implications of COVID-19 are uncertain, it is imperative that the Government provide as much clarity on the spending review process, the outcome and the flexibility that will be afforded to us and COVID-19 to respond to COVID-19 in the current year within our future budget envelope. This is not a situation unique to our executive. The Scottish and Welsh Governments are faced with similar problems in planning for the future. Today, we are collectively asking the British Government to provide a full suite of flexibilities we need to manage the unprecedented ongoing uncertainty that we are facing. I recognise for different devolved administrations this might mean different solutions. For the Executive, if we are able to respond effectively to the impacts of COVID-19 in this year and in future years, it will be necessary for us to have flexibility to transfer capital funding into resource budgets. This will allow the Executive the agility it needs to respond to changes that will materially impact public service provision. In addition, I am calling for the Treasury to loosen the restrictions around transferring funding from one year to the next. Under the current rules, any underspend over 0.6% of our resource DEL budget or 1.5% of our capital DEL budget is lost to the Executive. This restriction does not encourage good financial management and risks year-end surges of spend as departments seek to ensure budgets are maximised. A relaxation of the rules around year-end underspend would allow departments more flexibility to manage underspend. This is especially relevant in a period where the impact of COVID-19 can lead to disruption in projects, working practices and supply chains. These are limited and logical requests. Caoimhe, the concerns that I have outlined are further exacerbated by Brexit. Planning for 2021 will be challenging enough without the further uncertainty surrounding Brexit, uncertainty that is within the British Government's gift to clarify. Some 3 months before the end of the transition period, we do not have the clarity we need on key issues such as implementing the protocol and replacing EU funding. I have written to Treasury outlining the costs of implementing the protocol and have yet to receive confirmation that those costs will be met by the British Government as they had promised to do. I also await detail on the Shared Prosperity Fund, the much vaunted replacement for certain EU funding. The one significant piece of legislation that the British Government has produced recently, the Internal Market Bill, represents a power grab on areas of devolved responsibilities. Our devolution arrangements are underpinned by the Good Friday Agreement, an international treaty, so this is an extremely serious development. Today, we are collectively asking for assurances the British Government will provide full replacement funding of EU programmes without detriment to devolution. The issues I have raised today are integral to the Executive's future budget plans and are issues that urgently need resolved. Caoimhe, I call on the Chancellor to provide the much-needed certainty that this House requires and that our Scottish and Welsh counterparts need. As Finance Ministers, we represent over 10 million people, and today we speak with one voice. We are calling for more fiscal flexibility to manage the implications of COVID-19. We are calling for proper involvement in the spending review so we can plan our budgets. And we are calling for lost EU funding to be replaced in full and brought under local control. In normal times, this uncertainty would not be helpful, but the lack of clarity is further compounded as we deal with COVID and Brexit. The Treasury must urgently provide the clarity we need. I commend this statement to the House.
Thank you, Gordon. And I call Steve Aiken, the Chairperson for the Committee for Finance.
Thank you very much indeed, Mr. Speaker. And may I thank the Minister for his statement and also for meeting with me earlier today to talk about these issues. I think it's very clear that as COVID impacts on all of us in Northern Ireland, we need to understand how we have flexibility and we need to get clarity. The question I would like to ask the Minister, will he commit to be working very closely with the Finance Committee to look at the detail and the understanding of this information that's come through, particularly when it looks to moving and transferring of monies within budget, bearing in mind sort of the past record we have had in Northern Ireland on these transfers within budget, and also more details on the Shared Prosperity Fund. And finally, speaking as the leader of the Ulster Unionist Party, I welcome the fact that the Minister sees the benefit as being part of the Union and dealing directly with our Chancellor, who has been having to spend a considerable amount of resource in dealing with the challenges of COVID. Thank you.
Well, can I say I'm happy to cooperate as I have done with the Finance Committee and provide them with the information that they require and that we require. The problem is that we don't have that yet. We don't have that certainty around flexibility. Flexibility is always beneficial, but in the year that we're in, where we not only have the uncertainty around COVID and the ability of departments to spend money that we supplied to them in the budget, but we have an additional about £2.2 billion to date of COVID money to spend within the financial year. So that places a very significant pressure on departments to spend, and therefore that type of flexibility would be very helpful. We are not certain yet as to what the outcome may look like once we move into the new year, but we want to be prepared to manage any pressures that we have. In relation to the Shared Prosperity Fund, we have, as I say, quite a lot of good words and goodwill in relation to what it may look like, but no certainty around that at all. And we are particularly alarmed at the clause within the Internal Market Bill that looks as if it would rest with Whitehall in terms of allocating that funding to specific projects here. We have a very clear view, as is Scotland, as is Wales, and that's the view of our executive here, that the Shared Prosperity Fund would be administered and allocated by the executive through its various departments and partners that we have in terms of allocating currently EU funding, and that must be adhered to. I mean, I'm not going to rise to the point that he makes as the leader of the Ulster Unionist Party. When Sinn Féin get up and talk about these issues, we're accused of politicising COVID, but yet we were constantly lectured about the benefits of the precious union. Well, let's see how it works out in the time ahead.
I call Paul Frew.
The Minister makes several requests to the Government, none of which I could disagree with. But when he calls for proper involvement in the spending review, the same could be said of this Assembly and the Finance Committee, which when having proper involvement in the Executive's budget process. The Department has, over the last few months, showed how and proven how agile it can be in delivering and spending additional monies in year. Mr Speaker, there is no excuse for the current delay in the budget process and the lack of detail being provided to the committee and indeed this House. The Minister may be right when he says he has no idea what could be in the spending review, but he is always proving that he has no clue in bringing forward a budget to this place. When will the Minister publish details on the budget?
Well, I'm perhaps as confused as maybe most people are listening to you. On the one hand, I'm saying clearly we don't know what the fund envelope is. We're not absolutely certain whether we're into a 3-year resource budget and a 4-year capital budget. We've been told that's the case, but there are other signals that come out of Treasury to say it may not be the case. And so in that context, he wants me to provide a budget, and that's the reason I'm outlining to the House. If that's the sort of budget he wants, it will be a made-up one. We hope we know what we have. Or does he want us to pursue Treasury to get the certainty we need to allow us to plan, hopefully for the next 3 years in terms of resource and the next 4 years in terms of capital, and to get that as early as we possibly can, and in doing so then go out to consult with his committee and other committees and consult generally in relation to a draft budget and have one produced in legislation here in the springtime. That's the normal process for a budget. Our concern is that I'm not sure why the member doesn't understand that. He's been on the Finance Committee for long enough. Our process here is to get certainty around the funding envelope. That comes from London. If that certainty isn't there, then that makes it difficult for us to plan. That's not unique to us. That's the conversation I'm having with the Scottish Finance Minister and the Welsh Finance Minister. They're experiencing exactly the same problems in giving budget certainty to their own institutions, and that's why collectively today we're making this statement.
And I call on Maoliosa McHugh.
Corla agus bhhaid lomsa just buas a dhéanamh faithne do ratas fast. I'd like to thank you, Minister, for your statement as well. Minister, it is important that the Executive can plan its budget over a number of years. Is it your understanding that the Treasury still intends to set a multi-annual budget of 3 years resources and 4 years capital?
Well, that's certainly our hope, because in terms of our own budget spend, we have operated for the last number of years on annual budgets, and that doesn't give any long-term certainty, particularly in capital projects. And we have very significant capital projects here that the Executive want to get on with, that are flagship projects that will make a huge difference in terms of economic recovery and economic regeneration right across the region. And so the certainty that a 3-year resource budget and a 4-year capital budget gives us, and gives not only us but the industry, the construction, all of those sectors, then is very, very important. we had been operating on the basis that was the case. There were signals then came out of Treasury, because there's a confused picture there, that it may not be the case. I raised that directly the other week with the Chief Secretary of the Treasury. He said that's the basis on which they're operating, which is, I suppose, certainty of a type, but not the certainty that we want, and that's why we intend to engage directly with them to get that certainty. It's impossible for us to plan ahead if we don't know even the time frame, much less the funding envelope that we have.
I call Matthew O'Toole.
Thank you, Mr. Speaker. Thank the Minister for coming to the Assembly today. Could I ask him to be a little more specific about the two flexibilities he seems to be asking for? He's mentioned both in-year flexibility around capital resource switch and also carry forward to spending in the next financial year. Can he be slightly more specific about what he is actually specifically asking the Treasury for in relation to that? And secondly, can I ask what specific correspondence he has had with the Chancellor or anyone else in the UK Government about about mitigation costs and paying for the costs of EU exit?
Well, I can say what we want in the first instance is the principle of flexibility to be agreed, and we haven't had that agreed. We don't know because at the moment what level of flexibility we might need, and some of that is the conversion of capital to resource. And some of that is the flexibility to extend into the next financial year. Departments are very busy trying to spend out COVID money they have and to spend out their budgets. We have an October monitoring round exercise going on at the moment, and of course we have a January monitoring round scheduled as well. So when we get to those stages, we will know, I think, the degree of flexibility we might require in terms of transferring money between resource or capital and resource, and also carry over into the next financial year. We'll have greater clarity, but the principle in terms of flexibility is one that we need to establish with Treasury, and that's why we're pressing that very hard. I did send a cost to the Treasury in relation to the cost of the protocol and EU exit. They have said that they're going to look at the business case for that. I know DERA are providing additional figures in relation to some of the costs that they will have responsibility for. They have said they will meet those costs in full, but yet we have no firm commitment in relation to the costs that we have sent them.
I call Andrew Muir.
Thank you very much, Mr. Speaker, and I thank the Minister for his statement. I fully support all efforts that are being made to ensure that we have the necessary financial firepower here in this place to safeguard both lives and livelihoods. And the measures outlined, if we are granted them, will be welcome. But what efforts are being done to establish a fiscal council? It was a commitment to New Decade, New Approach, and it's important that there is oversight of their finances in Northern Ireland as we enter an even more difficult period over the winter.
Yeah, as I've told the House on a number of occasions, the Fiscal Council is a New Decade, New Approach commitment, which we will meet. As with a lot of departments and the commitments under New Decade, New Approach, things have slipped because of COVID and the necessity for all departments to focus entirely on meeting the challenges that COVID has presented. But we have already begun again the work in relation to Fiscal Council. I hope to be able to bring a proposition to the Executive very soon. I'm also looking at the idea of a Fiscal Commission, and I hope to bring proposals in relation to that in terms of looking at additional tax varying powers that this Assembly might have, as has happened in Wales and Scotland, and to bring a proposal on both matters in the very near future.
I call Paul Givan.
Can I welcome the announcement of the three ministers in our different component parts of the United Kingdom, Scotland, Wales and Northern Ireland, speaking with one voice on this issue, and I have some sympathy for the Minister in seeking certainty and more clarity around the budget. In doing that, the Minister is asking for more fiscal flexibility to manage the implications of COVID-19. How concerned is the Minister that in seeking greater flexibility to access more schemes, that effort is being undermined when Treasury can look at, for example, the SDLP Minister, who failed to access Treasury funding that would have furloughed staff in TransLink, saved the Executive millions of pounds, which has been starved from other businesses, not least in the North West, that could be accessing that financial support?
Well, I'm not going to involve myself in any critique of the Infrastructure Minister's responsibilities. That's a matter for herself and her department. I have to say that in terms of the arguments we are making, there are very general arguments in terms of budget planning, managing the finances that we currently have. I have consistently, and I'm talking again at lunchtime today to the finance ministers from Scotland and Wales, and we have consistently expressed these messages and others to the Treasury. Our concern in relation to that is heightened by the fact that there's now not going to be a budget in the autumn. Our concern is heightened in relation to EU funding by the clauses within the internal market bill, and that's why we felt we have had to speak today with one voice to reinforce the messages that we've been consistently given. So these are in relation to very high-level issues that face our administration here, but also Scotland and Wales, and we're trying to press home the need for a broad level of fiscal flexibility to assist us in managing our budgets.
I call Sean Lynch.
Can the Minister give us an indication of the scale of the EU funding and the parts he's trying to protect?
Yeah, I think the total scale, and this is between 2014 and 2020, is in the region of €4 billion. Now, some of that would fall in under what will our ongoing programme in terms of Peace Plus, which takes up what would have been the peace funding and the Interreg funding, and that currently sits about, the proposition for that is around 650 billion, and that is a fund which will continue to be delivered locally. The rest of that funding is made up of the placement of CAP, which goes on to next year, but also a range of other EU funding I'm sure the member will be very familiar with. And our concern is in relation to that the promise was that we would have full access to that amount of funding that we previously had, but also that we would have the ability to design the programmes for that, to allocate those, to work with our own local partners here in doing that. The intention of the internal market bill seems to take us in a different direction, which I think is very concerning, and we intend to press that point with the British Government.
Pam Cameron.
Thank you, Mr Speaker, and I thank the Finance Minister for his statement to the House this morning. Obviously, COVID-19 has created unprecedented challenges both to the budget and particularly health and economy. The Minister may be aware that the Royal College of Surgeons made a call asking for ring fencing of beds to allow essential surgery to continue through future waves of COVID-19. Can I ask the Minister what plans his department has in conjunction with the Health Department to ensure the necessary funds are in place to allow that essential surgery to continue and to address waiting lists going into the future?
Well, can I say to the member that she will know from previous statements I've made to the House that we have centrally held £600 million for the Health Department. They have been making their own assessments in relation to what they need in terms of response to the pandemic, and obviously that assessment will have increased given the resurgence in the prevalence of COVID in the community. And also an element of that was to try and assist in redeveloping and supporting other health services. So there's a significant amount of money. This £600 million is on top of, I think, in the region of £300 million of COVID money we've already given the Health Department, and on the budget that Health got at the end of March, which is obviously the largest departmental budget of all. So there is a significant amount of resource there, but I recognise, as she will, that Health is recovering from 9 years of austerity and is deeply under-resourced and has consistently been under-resourced, so we're trying to meet that challenge. So we have ring-fenced that money. The Health Department are going to come forward with their spending plans for that. That has to be spent within this financial year, that £600 million. If all of that is not required, then some will be returned to the centre for other distribution, but it is a significant amount of money on top of the budget that Health already had got.
I call Jemma Dolan.
Minister, one of the reasons it has been difficult to provide extra financial support for workers during the COVID crisis is the lack of tax data. Do you agree that if we had more taxpayers and more tax information, we could do more to help our constituents?
Well, I think we have been restricted by the fact that if we wanted to do specific tailored programmes for workers here in particular, then that data is held by HMRC. And so in order to devise any scheme to assist people with the employment costs, then we would have to have HMRC to work with us to verify any claim that was been put forward, and that's a very challenging exercise to get them to do that, specifically for a bespoke scheme for here. I know that other departments have looked specifically at schemes to support employees We obviously had the furlough scheme, which is now due to run out at the end of this month, and there's a further employment support scheme, which, in my view, is not anywhere in approaching the same level of support for employees and employers, and I think we'll see increased redundancies. But undoubtedly, the more data that we would have access in, the more levers we have in terms of raising our own finances, but also the more ability we have in setting programmes which are specifically tailored to the needs of people who live here.
I call Pat Catney.
Thank you, Mr. Speaker, and thank you, Minister, for coming. Minister, one area where there has been no guarantee of funding is around the employment and skills support in Northern Ireland, currently funded by the European Social Fund. As yet, there is no clarity on how and when this funding will be replaced. What exactly is the Department understanding to talk to affected sectors to understand the real pressures they are under?
Well, I think that in terms of that skills and employment, the propositions would be brought forward by the Department of the Economy, who have a responsibility there. My job on behalf of the Executive is to try and secure the funding. And that's why it's not only important that we secure the amount of funding that would have come here through, in other circumstances through Europe, but obviously as we've been taken out of Europe against our wishes, we have to try and secure that funding. The British Government have promised to replace it in full. But we also have our own unique circumstances, which I think he has recognised in terms of the levels of support and where we want to target those levels of support in terms of skills, particularly with younger people, training, apprenticeships, all of those things. And we therefore need to have the ability to, I think, manage our own schemes, to allocate and administer our own schemes and make sure they go where they're most needed. And so those are key principles. But the level of support and the engagement with that sector in terms of devising those plans would be a matter for the Department of the Economy.
I call Meg Nesbitt.
Speaker, in terms of lost EU funding, I'd be grateful if the Minister could clarify exactly who he envisages taking local control. Is it, son of SEUPB? Is it the SIB? Is it himself? And in terms of replacing it in full, were we not told we'd be better off outside of the European Union? So would he accept his position lacks a certain ambition?
Well, I'm going on the statement that was provided in terms of replacement and full. And of course, we were told, perhaps sold a pup, not those of us who voted to remain, that it would be a net gain for the British state in terms of the contribution it's making to the EU, that it would be able to give back into, we saw the writing on the side of the bus, that it would be able to give back into public services here. And if there's to be more than replacement in full, then I'd be very happy with that. But that's the statement that has been given in terms of replacement in full. Who administers that? I think what we want to make sure that we have the shared Prosperity Fund, and then I think it will be up to the Executive to design programmes around that and give it to the appropriate department, of course, to administer. Of course, Finance have a role, and we have a role in relation to SEUPB, but that's a cross-border body, as you will know. Irish Government, through the Department of Finance and the other departments there, have a role in that as well, and that's a specific programme which relates to the 6 counties here and the 6 border counties. The Shared Prosperity Fund, I would imagine, will probably be more internal to the north, and what we want to do in the first instance is ensure the replacement in full of funding, but also that principle that the devolved administrations are responsible for the design of the programmes and the allocation of that funding and the partnerships. And I would look forward to as broad a range of partnerships from my own perspective as we can with councils and with other social partners in terms of designing and administering those programmes.
Caoimhe Archibald.
And I welcome the Minister's statement today. The Minister has referenced the Internal Market Bill, and I know he and the Scottish and Welsh Finance Ministers have already raised their concerns in relation to it providing financial powers to Westminster over and above the Assembly and Executive. But what impact does the Minister assess the Internal Market Bill will have on our ability to control our spending?
Well, the concerns are in relation to, as I say, there is a principle attached in terms of the level of funding, because we've been told that we would receive it in full. The Internal Market Bill has given the British Government powers to administer those schemes, and that seems to contradict directly the commitment which was understood by ourselves and by Wales and Scotland, that the devolved administrations would get that share of the funding and that we would have responsibility for designing and administering those programmes and involving whatever partners that we would choose to, and obviously targeting that money in to match executive priorities and government priorities here. So those powers that are now being put through a clause in that Westminster bill seem to contradict that. And that, I think, is very worrying for not just ourselves, but clearly in my ongoing dialogue with the finance ministers of Scotland and Wales, very worrying for them also. So we want to ensure that that understanding which we have, that commitment, that principle that we have in relation to the devolved administrations is met by the British Government, and that the power to decide these programmes and to allocate that fund is not something that's done from Whitehall. That's clearly in contravention of what we have agreed.
I call Paula Bradshaw.
Thank you, Mr. Speaker. Minister, can you give us an assessment of your assessment of the current situation and how it impacts on the Department of Health's ability to deliver services, importantly in this second wave of COVID, and if you've started any conversations with Whitehall in regards to funding for the next financial year?
Well, the conversations with Whitehall in terms of the spending review would lead you into that conversation of not only the next financial year, but hopefully the next 3 years in terms of resource and the next 4 years in terms of capital. And that's why I think we want as much clarity. Traditionally, the devolved administrations haven't been involved in the spending review conversations, but the fact that there isn't an autumn budget, I think, then increases the importance of early sight of what the spending plans are and the time frame for those spending plans and the funding envelope that we'll be operating for. And that will give us the kind of clarity to plan in the way that you're alluding to. I can't make the assessment because that's an assessment for the Health Department. What I do know is that the Executive have prioritised health even before COVID became a factor in terms of our dealing, even in the discussions we're having around the reinstitution of the Executive. There was an agreement among all the parties that health would be a priority for us all. So we have done that in terms of the budget allocation, and in terms of the COVID allocations, we have added a significant amount of money to health. And as I said in an answer earlier, we had some 600 million held centrally for health, that they are making an assessment in relation to COVID response, but ongoing support for other health services, and that we expect to be able to announce fairly soon what they require of that, and if anything then is able to be returned to the centre for further allocation.
I call John O'Dowd.
It actually follows on from Mr Nesbitt's question, this elusive savings which were associated with Brexit, and what is clear now is actually going to cost public administration money to deal with Brexit. How is the Minister's Department going to have to deal or are dealing with the additional costs associated with this Brexit?
We have done our business plan in relation to what we are estimating our costs of implementing the protocol, and there are costs implementing the protocol. The Treasury have said they will meet those costs, but they have not yet committed to agreeing the figures that we sent to them. I know DAERA are doing further work in relation to the figures associated with their particular element of that. But you're right, there is a cost to implementing the protocol. There will be a cost undoubtedly on this island economically in terms of Brexit itself, which is very hard to quantify until we see what the final outcome of those negotiations are. It could be a very severe cost, it might be less severe, but it's going to be a cost one way or the other. And clearly the promise, I think, that Mr Nesbitt alluded to, of not only would we have that funding returned, but there'll be much more funding to spend across public services here, hasn't seemed to have materialised in any dialogue that we've been having with Treasury.
And I call Jim Allister.
Thank you. I suppose the Treasury is always an easy target for devolved institutions, maybe not always a matching acknowledgement of the scale, particularly during COVID, of financial assistance. But on the point about the capacity to transfer from capital to resource, is the Minister looking for that only during the COVID emergency or as a long-term change? And if it's a long-term change, would that require any legislative change?
Well, I think it would be more beneficial to have a long-term change, because he will know from his experience here, and most members will know who've been here long enough, we do get into a situation from January to March where there's a kind of spending surge. And the question is, of course, the dynamic behind that is we don't want to surrender money back to Treasury, because we're always criticised, departments are criticised for not spending out money. And so you quite right to get asked the question, are we spending on the right things? Are we planning sufficiently? Are we just spending to get rid of the money? because we've been criticised for not spending it? And does that have the proper positive outcome in terms of long-term outcome they have? So I think a longer-term flexibility in relation to all of that would be beneficial. I think we will have that discussion with Treasury whether that requires legislation or not. I'm happy to do that in terms of taking that forward. But I do think it would be more beneficial to us in the long term rather than just, we have a particular situation this year because we have additional money from COVID. And I have acknowledged in this chamber from an Irish Republican perspective how I feel the COVID allocations from Treasury have been beneficial. I felt the furlough scheme was very beneficial. The loan scheme that we have to business was very beneficial. But we are taxpayers. So if Treasury is distributing its largesse around those who pay into the British Treasury, then we're entitled to some of that as well. But I think it would be much more beneficial for us in the long term because we are in a cycle, and we have been particularly with annual budgets, where we end up in a spending splurge at the end of the year. And I don't think that's good for long-term planning. I don't think it's good for the best use out of limited public funding, which we have, and I think it would be much better done in the long term. Whether that requires legislation or not will be a matter that we'll explore with Treasury.
Members, that concludes questions on the statement, and could I ask members just to take a raise to be prepare the chamber of the next item on the order paper. Thank you. We make a start. I have received notice from the Minister of Health that he wishes to make a statement. Minister.
Thank you very much, Mr. Speaker, and thank you for the opportunity to update the House on my department's surge planning agenda. Today I am publishing a new surge planning strategic framework intended to set the overarching context for individual trust, surge and winter planning. Alongside that framework, I am also publishing individual trust surge plans. The coming period is highly uncertain, and the recent increase in COVID-19 cases is deeply concerning and shows that further waves is a continuing threat. How the virus develops in the coming weeks and months will depend on a range of factors, including the future approach to social distancing, population adherence to these measures, which include washing hands often and well, good respiratory practice, and the appropriate use of face coverings. Given the sheer scale of the unknown, I do believe that the health and social care system coped well through the first COVID-19 wave. That was largely because of the public's strong adherence to the measures put in place to counter the spread of the virus, meaning that the impact on services was not as severe as initially feared. Another important factor was the attendances at emergency departments reduced significantly during that period, which released capacity to assist with managing the pandemic. This may not be the case in the coming months, particularly as we move into the winter period. While the future path of the pandemic is unclear, as I've already indicated, a second wave will likely coincide with winter pressures. This means that we are very likely to face the most challenging winter ever experienced by our HSC system. The planning for the initial surge was carried out at a time when there was limited data available on the pandemic's trajectory. In this context, plans were put in place to deal with an extreme level of surge. As a result of this planning, every patient requiring treatment for COVID-19 was able to receive it. However, the creation of so much additional capacity had a significant impact on our other HSC services. The scale of this impact is outlined in the Rebuilding HSC Services Strategic Framework. Mr. Speaker, sadly, as of yesterday, 584 of our fellow citizens have passed away with COVID-19. No matter how long the pandemic continues, we must never forget that behind every figure was a person who was loved and who is now sorely missed. Mr. Speaker, my sincere condolences go out to the families and loved ones of those who have tragically passed away. Our tribute to them as a community must be to ensure we take all necessary action to minimise the rate of infection and future loss of life. This starts with us all taking personal responsibility for our behaviour and actions in fighting this dreadful virus. Our nurses, doctors, paramedics, other allied health professionals, community pharmacists, care workers, primary care, other frontline health and social care workers and carers have bravely and tirelessly put themselves at risk to save the lives of others. Amongst them were also those who volunteered to return to work on a temporary leave, training to provide much help and support. I cannot thank our workers enough for that, and I know that I can rely upon continued commitment from all staff as we begin the task of managing future COVID-19 waves. Having said that, Mr. Speaker, I appreciate that the efforts to date have taken their toll. We must put staff welfare along with patient safety at the heart of our efforts to manage services. As I said in my opening remarks, I am deeply concerned about the increase in the number of infections in recent days and weeks. In parallel to preparing our health and social care services for future COVID-19 waves, I will not hesitate to bring recommendations to the Executive, as I did last week, for a tightening of social distancing measures, should these be necessary. We all have an important role to play in stopping the spread of the virus. I ask the people of Northern Ireland to maintain adherence to the social distancing rules, continue to wash your hands often and practice good respiratory hygiene. I know that the vast majority do, and I cannot overstate the importance of this. I would also urge all Northern Ireland residents who have not already done so to download the Stop COVID NI app. Well in excess of 415,000 people have downloaded the app as of yesterday, and over 5,700 people have received exposure notifications asking them to self-isolate. This is a key plank of our Test, Trace and Protect strategy and a valuable source of up-to-date information. If we all play our part, I am confident that we can defeat this pandemic. In the meantime, my job is to ensure that our health and social care services are prepared to care for anyone who needs treatment or contacts the virus. The publication of the Surge Plan Strategic Framework is a key step in ensuring just that. I would now like to highlight key aspects of the Surge Planning Strategic Framework that I am publishing today. The Surge Planning Strategic Framework provides the overall structure and parameters within the HSC trusts, where they have developed their individual plans for managing the response to COVID-19 in the event of future waves. The framework highlights important learning from the first wave, sets out the approach to surveillance and modelling, reviews actions to minimise COVID-19 transmission and impact, summarises key regional initiatives to organise health and social care services to facilitate effective service delivery, highlights actions around the key issues of workforce, medicines and testing, and confirms a number of principles for our health and social care trusts to adopt when developing their individual surge plans. It is important to recognise that Northern Ireland-specific data and modelling will continue to be used to enable efficient planning and ensure there is early warning of any impact on health and social care services. Using the available data combined with surveillance of influenza and other winter diseases, the Chief Medical Officer and Chief Scientific Advisor will continue to advise the Executive as it considers measures to reduce the hour number in the event of a significant and sustained increase in the epidemic. With this approach, the intention is to ensure that the system is equipped to deal with a significant increase in demand, but also to keep the level of demand manageable in order to prevent our health and care services becoming overwhelmed. In order to manage future COVID-19 surges, HSE must be organised and ready to respond. To ensure that services are delivered most effectively in the COVID-19 context, the Department has taken a number of initiatives adopting regional approaches to service delivery. There are a number of key regional initiatives outlined in the Surge Planning Strategic Framework. These include establishing dedicated centres for day case and orthopaedic procedures, the establishment of a regional cancer reset cell to oversee the resumption of screening, diagnosis and treatment of cancer patients in clinically safe environments as quickly as possible, and to protect these services as much as possible in the event of future potential surges of COVID-19. It also includes action to capture learning in relation to care homes to mitigate future transmission of the virus in those settings, and the continued availability of the critical care capacity at our first Nightingale facility at the Belfast City Hospital. It includes the additional step-down capacity at our second Nightingale facility at White Abbey Hospital, the much expanded testing capacity and the publication of our Test, Trace, Protect strategy. The Nightingale facilities are particularly relevant for surge planning, and I will say more about my plans next. The Belfast City Hospital Tower Block was designated Northern Ireland's first Nightingale and will maintain additional ICU capacity for future COVID-19 waves. It should be noted that this additional ICU capacity will only be needed in the event of an extreme surge in demand for intensive care. The Belfast City Hospital Tower will remain a protected site for cancer and other specialist surgeries for as long as is possible. The experience of the first surge identified a role for additional step-down capacity to support flow through hospitals and ease pressures on the system. Therefore, as members will know, I have already commissioned work to begin on an additional Nightingale facility on the White Abbey Hospital site. This will be an immediate care facility providing 100 additional step-down beds to be operational by December 2020. Mr. Speaker, some members will have heard of the latest report published by the Royal College of Surgeons, focusing on delivery of surgery through a second wave. Whilst the report may be largely focused on England, it does also importantly contain the views of surgeons from here in Northern Ireland. The report is an important contribution at this time, especially as it is coming from clinicians working on the very front line. I'm meeting the Royal College tomorrow morning, just as I've done on a number of occasions before, and I'm quite certain the report will be discussed then. I've also asked that the report and the recommendations in it are discussed at tomorrow's meeting of the Regional Management Board. A point in particular that I fully expect will be discussed tomorrow, and one which is referenced on page 22 of the report, is the relation to staffing. The responses from our surgeons highlight the significant impact workforce shortages are having on the capacity to deliver planned care. This was a problem before COVID and will remain so after COVID. However, the pandemic has only exacerbated it. Almost all of the surgeons responding to the survey specifically mentioned the need for more nursing staff to increase surgical capacity. It is clear that there are no quick fixes and sustainable multi-year funding is required. Earlier this year, I was pleased to secure funding to deliver an additional 300 nursing and midwifery undergraduate places in Northern Ireland this year, bringing the total to a new all-time high of 1,325. In the meantime, I will continue to do everything I can to train, attract and entice nurses to work in our HSC systems. I recognise that it may be difficult to find any positives in the situation that we find ourselves in, but we must recognise that the emergency response across primary, community and secondary care services have involved innovative new service delivery approaches. Our health and social care providers have adopted the use of technology like never before. Whilst face-to-face consultations will always be necessary in some cases, and indeed are valued by both clinicians and patients, I'm also reassured that virtual clinics and telephone triage are widely embedded both in primary and secondary care services. Mr Speaker, we cannot go back to the way we delivered services before COVID-19. There is now an opportunity to mainstream these recent innovations, and I am determined that we take that opportunity. Of course, we must recognise that the use of technology will not be appropriate in all circumstances, and we must continue to offer face-to-face services where that makes sense for patients and staff alike. Our primary and secondary care providers have also stepped up to collaborate in ways not previously seen. This is best exemplified in the 11 COVID-19 centres established as a response to the crisis. We must now build on these experiences to further encourage that collaboration. Mr Speaker, I can confirm to the House that innovation, transformation and collaboration will be at the very heart of my approach to managing a second wave. Before I move on to the Trust surge plans, I think it is important not to forget to pay tribute to all those carers who supported their loved ones through this very difficult time. To them, I say you've done a fantastic job in a very challenging environment, and we must continue to support carers through this coming period, which will likely be at least as difficult as the last 6 months. Carers will have a crucial role to play in continuing to provide support, not only to those they care for, but also in terms of taking pressure off our hospitals and healthcare workers. Mr Speaker, I am also announcing today the publication of 5 individual Trust surge plans and the Northern Ireland Ambulance Service surge plan. These plans all outline initiatives required to respond to additional demand pressures arising during the winter and through any subsequent COVID-19 waves. Each plan covers a number of themes to support the HSE system to deliver increased resilience through this challenging winter period. The themes include positive patient, service user and carers experience, protecting HSE staff, maximising capacity and promoting safety for patients and staff alike. Mr Speaker, I have highlighted the key aspects of the surge planning strategic framework and the individual surge plans that I am publishing today. This will ensure that comprehensive plans are in place to address both future COVID-19 surges and winter pressures. Our waiting times, Mr Speaker, were appalling before COVID-19, and regrettably they will be even worse after COVID-19. That is why I made it clear to my officials and to the trusts that restarting services was to be considered a key priority for them. COVID can cause real harm, but so too can delayed diagnosis or treatment. Thankfully, through the Herculean efforts of our clinicians and the administrative staff working across our trusts, much progress was made. I can inform the House, for instance, that from the 1st of July to the 31st of August this year, trusts had committed under their planning to deliver 130,419 outpatient consultations, where in fact they delivered 152,941. Similarly, they aim to deliver 61,678 diagnostics, whereas instead they delivered 81,874. I don't underestimate for one moment, however, the damage that COVID-19 has inflicted. That is why I said I wanted any and all possible sources of additional capacity to be utilised. This included capacity within the independent sector, and from the outset of the pandemic, trusts have been using theatre sessions, including for both general anaesthetic lists and local anaesthetic lists, to allow many hundreds of the most urgent and time-critical patients to proceed as quickly as possible. When I established the Management Board for rebuilding HSE services in June, I also tasked it with incrementally increasing HSE service capacity as quickly as possible across all programmes of care. The Management Board is currently overseeing 28 work streams, and it is clear that huge efforts are underway to rebuild services. I do not underestimate either the scale of the challenge or the needs of patients who unfortunately have had their treatment delayed. The next set of Trust 3-month rebuild plans were originally intended to be published at this time, covering the period October to December. However, given the perilous and developing situation we now find ourselves in, I feel we have no choice but to hold back on the publication of these latest plans. However, let me reassure members, just because the publications of the plans may be paused, That does not for one moment suggest the efforts of our clinicians to support patients has been paused, because even with the prevailing COVID situation, I expect that the rebuilding effort will of course continue as far as that is possible. I will also keep the publication of the rebuild plans under ongoing review, and that said, it must be recognised that the recent rapid increase in COVID-19 infections is likely to unavoidably impact on the capacity of our health system to maintain delivery of mainstream services. Finally, I intend tomorrow to publish a policy statement setting out important plans for rebuilding and stabilising cancer services. While we have greatly improved our cancer treatment services with increasing numbers of patients surviving cancer for longer periods, regretfully our waiting times for diagnosis and treatment have been deteriorating in recent years. HSE cancer services, primarily oncology, have been under pressure for some years. There are a number of reasons for the existing pressures, including staff vacancies and sickness absence. In addition, the service is being supported by single-handed practitioners and locums, which makes it vulnerable. Unfortunately, the impact of COVID-19 on the health and social care system has also been profound. The continued need to adhere to social distancing and the level of use of PPE not required before the pandemic have all contributed. While every effort has been made by the HSE Trust to prioritise both red flag and urgent patient referrals, it will require some time to return these services to delivering the full available capacity. Alongside the development of the new cancer strategy, healthcare commissioners, professional staff and the trusts have been working to produce short and medium-term plans to rebuild and stabilise cancer services. Both oncology and haematology services are under unprecedented pressure as a result of the continued growth in demand for services and the adverse impact of the COVID-19 pandemic. It is essential that we invest now to create sustainable teams that can provide high quality and timely care. The aim of these plans is to take immediate action to increase capacity and ensure that the services are sustained over the weeks and months ahead as we face the potential for a second wave of COVID-19. The rebuilding plan for cancer services contains 17 actions to maximise available capacity across all cancer services. The immediate need is to rebuild services following the COVID-19 first wave and maintain service delivery for red flag and urgent referrals for the year ahead. The estimated investment for the rebuilding plan is £2.5 million revenue, recurrent for the rebuilding plan, and £151,000 capital. The oncology and haematology stabilisation plans are focused on filling medical, nursing and allied health professional vacancies, investing in new ways of working and creating new navigator posts to support the continued delivery of virtual clinics. The overall estimated cost of the oncology stabilisation plan is £8.73 million over 2 years. The overall estimated cost of the haematology stabilisation plan is £3.63 million, also over 2 years. Whilst this work will initially be supported through COVID funding, it is important to note that these are not short-term actions. The Executive has agreed that this investment will be rolled out across 2 years through to March 2022 and will be recurrently funded from 2022-23. There is an urgent need to rebuild cancer services, and these plans complement each other by providing a strong base for the long-term implementation plan to underpin the cancer strategy called for in the New Decade, New Approach document. Mr Speaker, in conclusion, being no doubt that we are confronted with a huge and daunting challenge. We must as a system try to rebuild services, manage the ongoing COVID-19 pandemic, embed innovation and transformation, address winter pressures and plan for the future, all at the same time. We demonstrated during the first COVID-19 wave, and despite the limited time to prepare, that we are up for the challenge. It is due to the dedication of all our health and social care staff that anyone who has contracted this terrible virus has had access to the best possible care. I am determined that this will continue to be the case. I am immensely proud of all our health and social care staff. You responded selflessly and with conviction to the first COVID-19 wave. The period we are now facing is likely to be hugely challenging, but I have no doubt that our HSE staff will again respond positively to the challenge. It will be critically important to adopt a flexible approach to ensure that mainstream health and social care services delivery is maximised as far as possible. Our ability to protect mainstream health and social care services will, at least in part, be determined by everyone responding positively to control the spread of the virus. I urge everyone across the community to go that extra mile this winter by following the guidance on infection prevention and not to let our guard slip. Mr. Speaker, I can assure the House that I will bring to bear all the leadership and encouragement that I can offer as we move through what will undoubtedly be an increasingly testing period for health and social care. Mr. Speaker, I commend the surge planning strategic framework and trust surge plans to the House.
Iram Sir Colm Gildennew le Keshtaker. I call Colm Gildennew to ask.
Goramayagat, Last Can Corlia, and Goramayagat Minister for coming to the Assembly this morning to make this statement, and also for taking time to meet with myself and the Deputy Chair earlier to discuss issues around health. Also, I would like to join in your remarks in terms of your condolences to all who have suffered the loss of loved ones as a result of this horrible virus, and to recognise that we are in a different place. Hopefully this time, while it's a very worrying situation that faces us, we have an active testing and tracing system in place, and it's crucial that that keeps pace with demand in the time ahead and meets the challenges that it's facing. And also in terms of PPE, we're hopefully in a different place. I also welcome the ongoing work on the dedicated day case and orthopaedic centres and the commitment to protect services as much as possible from shutdown, while recognising there are issues with orthopaedic in the Western Trust. But, Minister, the committee has heard that one of the key differences in places that have fared better in suppressing the virus than here has been the availability of isolation facilities to provide people with support where they find it difficult to isolate at home or to return home to isolate, high multiple occupancy houses, younger people, issues like that. Can the Minister tell us if he is willing to look into this area, that may be something that we could improve upon? And also, can the Minister tell us more about what is different in respect of care homes this time around, and what plans there are in place, for example, to ensure safe discharge from hospital into what we recognise as a very vulnerable setting of care homes?
And I thank the Chair of the committee again for his support and his committee's support through what has been a challenging time. In regards to the self-isolation facilities, we don't have bespoke provision here in Northern Ireland for anyone who has to self-isolate. But as I said when we met earlier on, when we did have that conversation, it's a conversation I'm willing to have with the Communities Minister to see what can be done. One of the provisions at our step-down facility in White Abbey, our Nightingale facility, when it is opened, will allow those transferring from hospital settings actually another facility to go to that will separate them from mainstream hospital provision, but also prevent them having to go into care home settings. In regards to the specifics of the transfer from hospitals from hospitals and to care homes, as per paragraph 27 in the plan of the latest version of the care homes guidance, all patients being discharged from hospital to a care home should be tested for COVID-19. Ideally, this test will be done 48 hours prior to discharge. In addition, those patients and residents who are entering a care home through another route, even from home or from a supported living service, should be tested in advance of their entry into that care home. And ideally, as I said, this test will be done 48 hours prior to the entry to make sure that anybody entering a care home has been tested and that the self-isolation does then take place as suggested. But the member asks the question of what have we learned in regards to care homes. I think the piece of work that the Chief Nursing Officer led in regards to the Rapid Learning Initiative into care homes has identified quite a number of issues that we have learned from. We've picked up in regards to PPE, bringing GPs into care homes, the virtual assessment, the virtual wards. There's been a lot of good work there. But one of the strengthening tools that we have had is our testing of care homes, not just the residents, but also the staff as well. The Chair will be aware, I think yesterday's figures showed we had 28 care homes where we had positive supported patients. Of those 28, 24 of them were identified through our testing programme. So they actually picked up either residents or staff who may have been asymptomatic that wouldn't have been displaying symptoms that we wouldn't have known about. So by that testing programme, we've been able to identify those staff members and those residents quickly and get them isolated. So that provides that added protection to ensure that we don't see the outbreaks at the number or the intensity that we actually did in the first surge.
I call Pam Cameron.
Deputy Speaker, and I thank the Minister of Health for his statement to the House this morning. Minister, you've mentioned workforce shortages as a key problem. Can you update the House on the retention of those recruited from retirement, etc., earlier in the year, and any further plans to address recruitment in the short term?
And again, the member hits the crucial issue that it is. We can open as many beds, as many wards, as many facilities as we want, but if we don't have the trained, available staff actually to facilitate the delivery and the care, that bit's pointless. It was a challenge, if the member remembers back, when this place came back on the 11th of January, one of our first achievements was to bring our nurses and our healthcare workers off the picket line. At that point, we thought an additional 300 nursing and midwifery places per year for the next 3 years was a big achievement. We already know now that we have in excess of 2,000 nursing vacancies alone in our current healthcare system. So there's a lot of work to be done, and a lot of work has been done in investing in the staff that we currently have, but making sure that we can attract staff from elsewhere, but also encourage the staff that we have to stay. And it's been one of my challenges as Minister is to make the HSC as an employer for choice. It's a challenge at this time of year. It's a challenge at any time of year, and during the COVID pandemic it has been particularly challenging. But as I said in my opening statements, the dedication, the commitment that I've seen from our healthcare workforce, from nurses, doctors, community pharmacy, porters, healthcare workers, cleaners, canteen workers, is above I think any commitment that we could possibly ask, but the dedication that they've delivered is something that I think we should be proud of, and it's definitely as Minister that I'm proud of.
Éireann Sir Justin McNulty for your cash. I call Justin McNulty for.
Can I thank you, Minister, for your statement today, and can I thank you for your steady leadership throughout this pandemic, Minister. I think everybody in the Health and Social Care Service and all the people out there recognise the confidence that you give them to your steady guidance through this pandemic. Can I ask you for your comments, Minister, in terms of the recommendation from the Royal College of Surgeons in relation to ring fencing beds, and can you confirm that emergency surgery will be returning to Daisy Hill on the resumption of the ED department in the coming weeks? Thank you very much, Minister.
I welcome the proposal from the Royal College of Surgeons in relation to the ring fencing beds and staff for elective surgery. When I first took up this post, long before COVID, one of the challenges was actually for theatre nurses because of the specific skill set that they bring and they are needed, and that still is a challenge. And again, as I said in the statement, I'm looking forward again to discussing the proposals in more detail when I meet with the Royal College tomorrow, because I have had regular engagement with them. The decisions I've already taken to implement day cases and orthopaedic surgery centres and manage these services on a regional basis are actually entirely consistent with the direction of the Royal College proposals. And as I said, I'll be asking the Rebuild Management Board to consider the Royal College of Surgeons proposals tomorrow. And as I said earlier on, during July and August, our trust exceeded the planned inpatient and day case procedures set out in their Phase 2 rebuild plans. A total of just over 7,500 procedures were planned, and in fact almost 10,400 procedures were delivered, whereas these were above what was planned and what was estimated we could do, and that increase is welcome. It only starts to eat into our waiting lists. In regards to the specifics of Daisy Hill, I don't have that detail in front of me, but if the member refers to the rebuilding plans and the surge plans for the trust, I'm sure he'll find that included there. If it's not, I'll get the member an update.
Call Alan Chambers.
My thoughts today are with all the families affected by this dreadful virus. Can the Minister comment on whether there was any engagement with the key stakeholders in advance of today's framework, and can he give a commitment that the framework, as well as the individual trust surge plans, will be kept under constant review, and that all decisions will be heavily informed by the views of clinicians working on the ground?
I can give the member those reassurances that these are living documents. They're not tablets of stone because of what we've seen over the past few months. And I think what we've also seen in the ability for our health and social care system to react and change, something that I think many in this House or many outside had never thought was possible, that it could be so flexible. But one of the things, and I've been asked and challenged in previous documents when we reached it, was about the level of engagement. Given the speed at which this virus is currently spreading, it's imperative that we plan now for the surges and the winter pressures. But despite the need to move swiftly, I felt it was important to engage with key stakeholders on the surge planning strategic framework. I therefore initiated a very short engagement exercise with key stakeholders, which included our trade union colleagues, professional colleges and bodies, the HSC arm's length body chairs, and the voluntary and community sector and service users. And that was done through our Transformation Advisory Board members. And I thank all the stakeholders for their valuable input, which has informed and changed some of our initial surge planning strategic framework, which was published today. So in total, 18 responses were received as part of that exercise. I gave commitments to this House in the past and to the committee that I would engage. We have engaged, and I'm thankful for the productive engagement that those stakeholders had with us in preparing this strategic framework.
Thank you. Paula Bradshaw.
Speaker, Minister, in regards to the 600 million allocated for dealing with the additional pressures and needs in dealing with COVID, are you confident that this will be enough to deal with this new surge plan? And what new treatments are to be introduced now that we know more about how the virus affects the body? Thank you.
And I thank the member for her question, and I caught some of the commitment from the Finance Minister earlier on. In regards to the 600 million, because it has to be spent in this financial year, I'm content that it actually does cover all our financial asks that we know we are able to deliver, because there's no point in me overbidding and not being able to spend in this financial year. Sorry, what was the last part, Paula?
That are going to be introduced, like allied health professionals, because now we know more about how the virus affects the body?
Yeah. Look, I think the member raises that point, which is now even a new medical definition, which has been called long COVID, or, and that's the after effects, because what we're seeing, this virus just isn't solely respiratory. It affects the blood circulation system. It can even affect some other mobility issues as well. So the more we learn about this virus, the more challenge we have across our entire health and social care system. Our allied health professionals are taking a lead in how we get that recovery, that recuperation, get people back on their feet, get their muscles strength built up as well. But also the need that we also have identified through the support from our mental health facilities and practitioners as well. Because what we know is now this will have a long-term detrimental impact on the mental health of anyone who either contracts it, but also of the populace of Northern Ireland. And that's why I was extremely keen that we built in that section of COVID-19 into our mental health strategic plan as well, because that will lead to a 10-year plan, because I think the mental health challenges that COVID will present in our general population won't be sorted in a short-term plan. It will be a long-term commitment and a long-term dedication. So that's where we're looking to in regards to what learnings are we having from where this virus actually affects the general well-being and physical and mental well-being of our population.
Paul Givan.
Speaker, the Minister's statement makes reference to the appropriate use of face coverings. Is that an indication that the Minister is concerned that face masks have provided a false sense of security for some people, which has undermined the social distancing message and the regular hand washing message, and that there needs to be the appropriate use of them for it to be effective? And furthermore, the Minister will be aware of what happened in the Republic of Ireland and the breakdown between the Government and the Chief Medical Officer. Observers have commented on the number of occasions when our Chief Medical Officer and Chief Scientific Officer have recommended or made recommendations publicly that they would then want the Executive to implement. What measures is he taking to ensure that we don't have a repeat in the Northern Ireland Executive of what has happened in the Republic of Ireland, which is damaging to everybody involved?
Can I just say, and I'll take the member's second point first, I think whenever the Chief Medical Officer and Chief Scientific Advisor speak, they speak with the authority of their offices and their experience and their medical medical experience, but they're always caveated, and I think they're always managed and measured. And in fact, they always refer to that any decision will be a decision that is taken by the executive. So they make recommendations. Those recommendations are made to me and to all the executive colleagues as well. And we have a very good working relationship and understanding as to what needs to be done and what is done for the best interests of Northern Ireland across the entire piece. Our Chief Medical Officer, Chief Scientific Advisor also bring to the table an understanding of the economic and societal impacts that the health recommendations that they bring forward actually will have, and they do take a balanced and professional approach, and I think their input is something that we in Northern Ireland should actually value. I can't see at any stage where we will end up in the divergence that we seem to see between some within the Irish Republic's government and their medical professionals, because I think we have a truly exceptionally team in our Chief Medical Officer and Chief Scientific Advisor, and the way they carry out their professional posts and providing that advice and guidance to the executive as a whole. In regards to the appropriate use of face coverings, what I mean in that is for those who have reasons not to wear them. Should it be medical? Should it be psychological? What I would like to see is actually an increased use of face coverings in the appropriate settings and in all settings. And I think we should actually encourage and regulate more in those areas where we don't see compliance with face coverings where they should be worn, and I mean specifically in the retail sector, because as we go into this second wave, we need to be doing all that we can to support those who are most vulnerable and need that extra bit of protection that we can give to other individuals, and we do that by wearing those face coverings in the appropriate settings.
Sir, Liz Kimmins for your case. I call Liz Kimmins for a
question. And I thank the Minister for coming this morning. And it's a very comprehensive statement. It's very welcome, and commend the significant amount of work that has been done thus far. And it's gone back, I suppose, around the issue of the response to COVID, and you'll be well aware at this stage, Minister, the concerns that had been there in terms of the relocation of Daisy Hill's Emergency Department. And it's very welcome and very positive that it's now coming back on the 19th, and there's been a lot of work done around that. And my experience as a representative for Newry for almost 7 years now, we've always had to fight for the retention of services in Daisy Hill. So naturally enough, any moves to make changes causes concern within the community. And we work very, very hard to ensure that we can allay those fears. But as the member for Newry Armagh alluded to, there has been concerns around the future of emergency surgery for Daisy Hill. And I'm fresh out of a meeting this morning with the Chief Executive of the Southern Trust, and I suppose I can answer the member's question that emergency surgeries are returning on the 19th of October.
Excuse me, does the member have a question, please?
Yes, I'm just getting to it.
Yep.
But I suppose one of the issues around that was a correspondence had been issued on the 22nd of September stating that there wouldn't be. So that's where the concerns come from. However, this is a short-term plan, and I just want to ask the Minister, can your department give assurances that on a longer-term basis that they are committed to ensuring that the downgrading of Daisy Hill will not happen in terms of acute surgeries?
I've given previous, and I'm glad you were able to give that date. I didn't have it. It is a welcome commitment, but I think what we're seeing in regards to the surge planning and the 3-month building plans, if that commitment, that emergency surgery has started, it will be there in that step phase. We can provide that long-term commitment, I think, to any service at this minute in time, until we get through COVID. It's one of the things I've always done as Minister, should it be in regards to the supplies of PPE. I've never give a commitment that I cannot stand over when I'm saying it. So I can't give the member that commitment, but I'll ensure that we do all that we can to retain those services where they are safe to retain and where they are needed to retain as well. So I hope the member takes me at my word. I'll not give any other commitments that I can't stand over, and I won't do that to the member, but I will give her the commitment. Look, one of the things that we do know is that no matter where we are now, I don't have a large enough footprint for hospital provision in Northern Ireland to do what we need to do on a safe basis when you take into social distancing and the need for distancing for people who are waiting, for people who are getting surgeries and all the rest of it. So every footprint that I have within my health and social care system, I'm using. That's why we've used the White Abbey facility as the second Nightingale facilities, because it's something that's already it's already in our ownership and already in our care as well. So it made sense to redevelop that as our second Nightingale.
Call George Robinson.
Thank you, Mr Deputy Speaker, and thank the Minister for his statement as well. And could I ask the Minister what is the importance of hands, face, space in order to help keep health services open moving through this horrible pandemic? And could I ask him as well, as we are now in the second horrific wave of this virus, could a testing centre be set up somewhere in East Londonderry?
I thank the member for his question. You know, and hands, face, space is that message that we've been putting through every member of the Health Committee, ourselves in the Department of Health. Every healthcare professional has been pushing and has been asking every member of the population in Northern Ireland to maintain and observe hands, good hand hygiene, face coverings, which I see the member is wearing, and space, which is the social distancing that we should be maintaining at all times, which is the recommended 2 metres. By following those simple steps, we prevent the spread of COVID-19. COVID-19 does not spread itself, we spread it. So by observing the hands, face and space, those simple stages, we can prevent the spread of COVID-19. In regards to the establishment of a testing centre in East Londonderry, we have a number of fixed-base testing centres. We also have a number of mobile testing units that we can move around Northern Ireland where we see large-scale incidences of positive COVID-19 outbreaks. One of the things, and I know the member will be aware of, representing that area, one of our lowest local districts for the expansion of positive cases in Northern Ireland is actually Causeway Coast and Glens, part of the council area that the member represents. I would rather maintain a low number of COVID outbreaks by the members of that area and the residents of that area following hands, face and space. I think I got that right, rather than having to need to put in a testing facility. So the members of the residents of the members' constituency are doing what they're meant to do. I would encourage them to do more, and in that way will not need a testing facility in East Londonderry.
Iram Sir Pachihan Fanya Cash, I call Pachihan.
Grandma little last count Corla, August Buegas Lesionara, Soctor Righteous Armagin, August Agoj Fragri, Armagin Comai. I thank the Minister for this statement this morning and for his answers so far. I wonder, could the Minister commit to supporting health and social care staff, particularly those staff who may be absent from work while ill with COVID-related illness, and can he ensure that they will get their full wages rather than just statutory sick pay?
I thank the member for his ask. It's something we have looked at in the past, and I think the member will also be aware it's one of the steps that we put in regards to care home staff and domiciliary staff. It's part of that package of support that we provided through those providers, even through the independence providers, so that we could ensure that it wasn't necessary for someone in a care home or domiciliary care setting who did contact COVID, that financial pressures made them go back to work, that ability to supplement their statutory sick pay, so that there wasn't that financial incentive or need for them to turn to work, but they actually took the time to self-isolate and took that 14 days to make sure that they weren't spreading COVID if they did receive a positive case. So that supplementary, that support measure is still there. I think it expires at the end of this month, but as we go into the second phase, it's definitely something that I'll be seeking to continue in receiving financial support and ask for financial support to do, because it is an important and vital tool in our box to prevent the spread of COVID-19 within what is a very critical workforce, but a very undervalued workforce.
Iram Sir Pat Catney for your cash. I call Pat Catney.
Thank you, Mr Deputy Speaker. Thank you, Minister, for coming to the House today. Can the Minister confirm that our track and trace system runs on something a little bit more robust than Microsoft Excel, so as to avoid, Minister, any recorded mistakes?
I think the member's slightly confusing two different scenarios. I think that it's the number of positive cases that were recorded and how it was being recorded through a testing system, which across the water was then being manually transferred onto another system, and I didn't know Excel actually ran out when you got to a certain number of cells. Our test, trace and protect system, which is held within the public health system, has developed and is developing a very bespoke software package originally. And if I'm not correct in this, I'll get back to the member, but I'm originally led to believe that the initial software package was actually one that was used for a hotel booking system, because it allowed our test, trace and protect staff to follow through contacts and the use of contacts as well. But I think it has moved on a wee bit from that, and I don't think our test, trace and protect system actually relies on Excel Word or Excel spreadsheets, but I'm sure it's a pretty robust system for anybody that needs to use it.
I call Mike Nesbitt.
Thank you, Deputy Speaker. The Minister concluded his statement by urging everyone in the community to go the extra mile with regard to the pandemic. I'm sure I'm not the only MLA whose inbox has seen a recent spike in correspondence from what we might call pandemic deniers. What is the Minister's message to those people?
Again, I think I've rehearsed my message to those individuals many times, to think about their message, not just the message that they put out, but the damage that it does by undermining the health message that we put out, the health message that comes out from this place. For everyone that hears that message and doesn't wear a face covering, doesn't wash their hands, doesn't practice good respiratory hygiene, has the ability, has the chance of contracting COVID-19, spreading COVID-19, and putting additional pressures on our health and social care system. Putting pressures which sees another nurse having to wear additional PPE, puts pressures on our ICU beds, put pressures on our doctors, and then starts to challenge the delivery of our health service across the whole system. So what I would say to those individuals who think it is smart, who think it is clever to put out that denial, is to think of the adverse implications that their actions are actually having on the general public of Northern Ireland, but those who are most vulnerable, and those who, like me, are also asking everyone who can follow that guidance of good respiratory hygiene, good hand hygiene and social distancing to actually practice it.
Call Alex Easton.
Mr Deputy Speaker, thank the Minister for his statement. Minister, in your statement you mentioned about the Stop COVID app, and over 400,000 people have downloaded it. What more do you think you can do to try and encourage more people to download that? Because I think it's an essential tool to tackling the COVID-19 pandemic.
I thank the member for his question. And I suppose it is the ongoing development of that app, of what it contains and the additional information that is actually contained on it. One of the biggest steps that we've taken recently was in the last week, working with the Children and Young People's Commissioner, was we were able to facilitate it being downloaded by those under 18. So it opened it up to a completely different tranche of people in Northern Ireland, and that's why we went from 380,000 downloads at the end of last week to over 415 at the start of this week. So we're seeing a new generation actually downloading it and seeing the advantage that it does bring. It's not a new innovation for the app, but one of its key abilities is that ability to work across the border. And we've seen that actually come to fruition and come to real benefit in the recent weeks, where we've actually seen in the region of 1,300 downloads going from the Republic, or identification keys coming from the Republic into Northern Ireland, and 1,200 from Northern Ireland going to Republic of Ireland residents as well. So that interoperability that our app has, that enables it to work in both jurisdictions, is a key strength to it that really stands us in good stead here in Northern Ireland.
Sir Emma Rogan for Newcastle. I call Emma Rogan.
I too want to thank the Minister for his statement here this morning. But can I ask the Minister, can he list the local groups, staff, trade unions and other organisations that his department consulted with when the decision was made to downgrade the A&E department of the Down Hospital in my own constituency of South Down?
It's not something that I prepared for, Mr Deputy Speaker, as it is move away. But what I will say in regards to the emergency department in the Down, I do know there was an issue, a statement actually released last night by the Trust that says since the end of July 2020, they made clear that in their statement they have had further staffing challenges. Therefore, it's now clear that they are no longer able to fully restore the emergency services provided pre-COVID at this time. However, the Trust recognises the need to improve access to urgent and emergency care services for the local population in the Down area. So from the 19th of October, as the next phase of rebuilding urgent and emergency care services, a consultant-led urgent care centre will open in the Downs Hospital's emergency department, and this will operate from 8 a.m. to 6 p.m. Monday to Friday on an appointment-only basis, and there will be a nurse-led minor injury service continuing at weekend from 9 a.m. to 5 p.m, and there will be a contact number. Those contacting the service will be triaged and offered an appointment within the urgent care service or directed to the most appropriate service. So it's not that it's being removed, it's being the next step is actually being taken in rebuilding it by initiating that consultant-led urgent care centre, which will be operating on a Monday to Friday.
Emma Sheeran, for I call Emma Sheeran.
I thank the Minister for his statement this morning and for his answers thus far. Can I ask the Minister what steps you're going to be taking to work with counterparts in the South to ensure that this COVID surge plan will work to prevent spread of the virus, particularly in border regions?
I thank the member may not be aware, but our party colleague, the Junior Minister, Declan McAleer, and myself met on the North-South Ministerial Council in Health format on Friday, and that was one of the issues that we did cover, how, not only in regards to this surge plan, but how in regards that there is an understanding on both sides of the border of where and how we counter and challenge COVID, should that be through, as I said earlier on, the interoperability of our app, but also the understanding as we see the spread of the virus on both sides of the border, like in Derry City and Strabane Council area and Donegal as well, where we are seeing the same rates of increase and the same incidence of spread, should that be from community transmission as well. So there has been a good working knowledge, not just between myself and my ministerial counterpart in the Republic of Ireland, but also by our chief medical officers, our chief scientific advisors and our public health agencies. So there is a good understanding of what we are doing. There's a memorandum of understanding which formalises that engagement of information, and now there's a request that our public health agencies actually work closer together in regards to identifying outbreaks and causes of outbreaks, as we've seen along a number of the border regions.
Mayor Matthew Toole, for I call Matthew Toole.
Thank you, Mr Deputy Speaker. I'm pleased to see my colleagues back next to me. Daniel McCross, I'm sure will be asking a question in a second. I would echo what Emma Rogan said actually about South Down. First of all, I think people there will be keen to hear clarity about whether it moves back to emergency department. But I had two specific questions, Minister. Thank you for your update today. One is, it's referred to in the surge plan, but are you completely confident that we have adequate supply of ventilators, both in and outside Nightingale, for the months to come? And secondly, can you give some clarity on provision of flu jabs and how that's going? Is he confident of supply across Northern Ireland for vulnerable people, but also particularly for HSE staff?
In regards to the 2 points, Deputy Speaker, since March 2020, the Critical Care Network has procured 180 intensive care ventilators and 24 advanced patient transport ventilators to supplementing our existing devices in treating our sick patients. Of these orders, 124 ventilators have been received, allocated and commissioned for use in HSE trusts, and the remaining 80 ventilators are awaited from the supplier, and they're expected in completion at the end of this month. In addition to that, 145 non-invasive ventilators devices have been procured for use by respiratory services in the region, as well as 300 high-flow oxygen devices. Each trust has identified local surge plans to meet additional surge demand for both COVID-19 and non-COVID-19 patients, and the regional inventory of 348 invasive ventilation devices, which includes the 80 expected by the end of October, exceeds the current anticipated demand. While equipment will not be a limiting factor in the provision of critical care to patients in Northern Ireland, there is considerable stress on limited staff resources, and there's no room for complacency. In regards to the flu vaccine, last year, 2019-2020, 670,000 flu vaccine doses were administered in Northern Ireland. I can inform the member that over 1 million doses have been procured for this year's programme in order to meet anticipated increased demand for eligible groups and allow for the vaccination of additional priority groups. And the amount procured for Northern Ireland this year is the maximum amount available to order to date, given global demand for the flu vaccines. The target groups, the current groups eligible for free flu vaccination, are everyone aged 65 and over, pregnant women, those aged under 65 years of age in clinical at-risk groups, those who are in receipt of a carer's allowance, or those who are a main carer or the carer of an elderly or disabled person whose welfare may be at risk if the carer falls ill, all children aged 2 to 4, all primary school pupils, and frontline health and social care workers. In regards to the delivery of the flu vaccine to your health and care system, that has already started, and a number of peer vaccinators have been trained, have already started delivering the flu vaccine across the health and social care system.
Sir Daniel McCrossan for Newcastle. I call Daniel McCrossan, and I would just wish the member well. It's good to see him back.
Thank you, Mr Deputy Speaker, and it is good to be back. It's been a long few weeks. Minister, as you'll know, in the wider community there's some speculation from those who have difficulty with the testing system. Can you provide any reassurance or assurances to the public and to this House, Minister, as to how accurate the tests are?
I'll start by welcoming the member back. Mr Nesbitt, in an earlier answer, asked what could I say to those people who deny that COVID's real, that it's a hoax, that it's a mythology. I'll ask the member to maybe update later on in some shape or form that if what he went through felt like a hoax or a conspiracy or a mythology, because anybody that I've spoken to that has come through COVID-19, or any family who has lost someone due to COVID-19, or any member of our health and social care staff system who has treated somebody with COVID-19, knows it's not a hoax, and I welcome the member back to his place. There's a number of tests that we use. I don't have the specificity or the reproducibility of those tests with me, but I can provide them to the member because I know it has been something that has been asked on a number of occasions. So there's different tests used in different locations. I'll get that to the member in writing, but I wish him well and welcome him back to the House.
I call Jim Allister.
Thank you. I join in the welcome back to Mr McCrossan. I don't for a moment downplay the threat of COVID, nor do I diminish the fact that 584 people have died. But I'm also conscious that in the first 6 months of this year, 2,302 people died from cancer, and who knows how many deaths have been hastened by the delays in cancer treatments. So when we reach a point when, for those last 6 months, the department basically has been caught in the headlights of COVID, when we reach a point where the Royal College of Surgeons has to say that we need to ring-fence staff and facilities for necessary surgical procedures, etc., does that at all suggest to the Minister that the medical advice he's been relying on that has caused the Royal College of Surgeons to have to make that point, that medical advice has been somewhat flawed?
No, I don't, because the Royal College of Surgeons have been part of that medical advice that we have received. The Royal College of Surgeons actually sit on the rebuilding board as well. I meet with them regularly. The point they make in regards to ring-fencing beds and ring-fencing staff is to protect those staff and those beds and those facilities from COVID as well, and to ensure that we can continue with the surgery that we have started. So the Royal College of Surgeons, in their ask of ring-fencing beds and ring-fencing staff, has been an ask that has been made for a long time. The member will know that our health and social care system is already badly bruised. and scarred by COVID, but it is picking itself up and once again is ready to care for all of us, despite the immense pressures on the staff. So when I hear the call from the Royal College of Surgeons, it's not a surprise to me. It's an engagement I've had with them, and it's a message that they've carried forward about the protection, and that's why we've looked to the elective day care centres in Lagan Valley. That's why we've established the orthopaedic centres as well, so that we can create those facilities that are COVID neutral. They'll never be COVID free, we can never guarantee that, but that's why we're taking those steps. And in regards to my statement earlier on, he'll note the announcement that's coming forward tomorrow when I publish that concert strategy as well in regards to haematology and oncology as well, because that is something that we know we have to address and get on top of as well on a regional basis, no longer the way we were looking at it across trusts.
I call Claire Sugden.
Deputy Speaker, the recent rise in the rate of infection should give us all cause for concern, not least so that we don't overwhelm the NHS, thereby preventing the quality of care to the most vulnerable suffering from the effects of COVID-19 or indeed any other illness. And Minister, I do appreciate your attention regarding access to other health and social care services for other illnesses, but I do think it's a lesson that we learned from the first wave, and you yourself had expressed concern about the limited number of people accessing services that they should be accessing. I'm concerned that this will be compounded in a second wave. I have constituents coming into my office begging me for appointments and telling me that they're going to pay private for their child to see a doctor that they should be able to access on the NHS at a time when they can't afford to do that because there is a chance they are at risk of losing their jobs. How do we genuinely address this? I don't think it's good enough to say that you call your GP, wait on the phone all day long to be told go to A&E if it's an emergency, because that's the experience my constituents are having. And I suppose to kind of follow on from Mr Allister's point, we do need to be looking after those who are suffering the effects of COVID-19, of course we do, but we also need to be looking after those who are suffering the effects of other illnesses, because they are ruining people's lives just as much as this virus.
I thank the member for her comment. As I said earlier, I listened to the Finance Minister statement before I came into the House, and he spoke of 9 years underinvestment in the health service. It's a line that I used in this House previously when I took over. We are now reaping the shock of that underinvestment, where we don't have the number of beds, where we don't have the number of staff, and where we don't have the access to the health service that I think we, as a population in Northern Ireland, deserve, that we don't have a health service that our staff working in it deserve because of that structural long-term underinvestment. And, this place has a place to bear in that and a responsibility to bear as well. So when we talk about access to other services, it's because we currently have, I think, in the region of over 2,000 nursing vacancies. We have a number of GP vacancies that we can't fill. Now we're looking to invest in them in McGee, in the medical centre, and the nurse training places that we're bringing forward. But there is no doubt that we do not have the number of people within our health service that we need there to be able and readily accessible. So to the members' constituents, when they do say it's not a service that I want them to experience. I want their GPs to be as open and as accessible as possible. And working with the Royal College of General Practitioners, the British Medical Association Committee of General Practitioners, they have issued statements. They've encouraged their members to be more open than as open as they can and to access as many patients as they can. But on the counter of that, I've also heard of the example where a mother phoned the GP about her child, and the GP referred them to a COVID centre because they were expressing COVID symptoms, and the mother didn't want to take the child to a COVID centre in case they caught COVID. So we need that education as well of while we go through this pandemic, of the different avenues that are being opened up, and to make sure that people access health care provision when they need it, but where they need it as well. There's a large job of work to be done, I think, by ourselves and by the medical professions, just to make sure that people do get access. It's not good enough, and it needs to be better, and it's one of the things that, as Minister, I've tried to do. This pandemic has set us back quite a bit, but I think it's through the support of this House, through the support of the Executive, that we can get a health service that has been invested in and a health service that we can and should be proud of.
Members, that concludes questions on the statement. If you would please take your ease while we prepare for the next item of business. Thank you.
Okay, members, we'll resume business. I have received notice from the First Minister and Deputy First Minister that they wish to make a statement. Minister.
And today, the First Minister and I are pleased to announce that we have appointed Fiona Ryan as Commissioner for Survivors of Institutional Childhood Abuse. The appointment is for a 5-year term, and Fiona Ryan will take up the position from the 14th of December. COSAGA is established under the Historical Institutional Abuse Act 2019. The principal aim of COSAGA is exercising functions under the Act is to promote the interests of any person who suffered abuse whilst a child and whilst resident in an institution at some time between 1922 and 1995. Fiona Ryan brings a wealth of experience in working with and understanding the needs of victims and survivors of trauma. She is currently the Chief Executive of Sonos Domestic Violence Charity and is also a member of the Monitoring Committee of the National Strategy for Domestic, Sexual and Gender-Based Violence in the South. The appointment of a Statutory Commissioner for Survivors of Institutional Childhood Abuse is a hugely significant day for all those that have been so terribly impacted, and our thoughts are with those that have suffered greatly. As members will be aware, the Historical Institutional Abuse Act was enacted in November 2019. Prompt action was taken to establish the HIA Redress Board, which opened for applications on the 31st of March. Some 7 weeks later, the first compensation payments were made within the timescales set out by the President of the Redress Board. This was a significant milestone for victims and survivors who are now starting to receive the compensation that they are long overdue. As at the 30th of September, 579 applications have been received, 156 of them from people who participated in the Hart inquiry. Panels have made determinations totalling £4.144 million and paid out a total of £2.55 million. We want to acknowledge Brenton McAllister's important work in promoting the interests of victims and survivors as interim advocate, including putting forward the views of victims on improvements to the legislation and advising on procedures for the Redress Board. The pain and the suffering of victims and survivors of historical institutional abuse can never be erased. However, this appointment is one further critical step in the implementation of the Hart inquiry recommendations. There is still further important work remaining in the form of an apology and memorial, as well as important steps such as the implementation of support services for victims and survivors, as well as raising awareness of the redress scheme. We look forward to working with Fiona as she takes up this critical and sensitive role. I
call Doug Beattie, Deputy Chair of the Executive Office Committee.
Thank you, Mr. Speaker. And I thank the Ministers for their statement on an extremely important issue which we have to move forward. And I thank them for the detail within that statement, in particular about where we have progressed those cases in regards to redress. I think it's important that we know that this is going forward. I note that Fiona Ryan will be taking over on the 14th of December, and yet correspondence with Brendan McAllister said he's leaving in mid-October. Could I ask the ministers, therefore, to confirm or address that issue and confirm that the new Corsica will try to re-engage with all of the HIA groups where there has been disengagement between some?
Member for his question, and just to say yes, so Ms Ryan is required to work a period of notice. So that's why the appointment won't be until the 14th of December, but obviously we look forward to that appointment. And it's always been the intention of the interim advocate also to continue to provide representation to victims and survivors until we had this new person in post. However, officials will work with the advocate around the level of input required as we work our way through the weeks ahead till we get to our permanent post. But I think today certainly represents a new chapter and allows us to make this very significant appointment as a joint office. And I think that hopefully for victims and survivors, they will it'll not go unnoticed to them the significance of getting this permanent position in place, and that what must be at the heart of all of that is that the victim's voice is heard.
And I call Christopher Stalford.
Thank you very much, Mr. Speaker. Today does mark an important milestone. I think myself and Mr. Nesbitt may be the only original members left of the old OFM DFM committee that are still on the Executive Office Committee. This has been a long time coming, and I remember sitting with some of the victims at the launch of the Hart inquiry and the promises that were made. We have an absolute obligation to see those promises fulfilled. As I say, this is one part of the package and it's very welcome. Another part of the package, obviously, is securing funding for the compensation scheme, and we have a very wide estimate in terms of just how much that's going to cost. Can I ask the Deputy First Minister what update she has had from those religious organisations who were entrusted with the care of children as to the scale of the contribution that they anticipate making to such a compensation scheme? Thank you.
Can I thank the member for his question and concur that this has been a long journey. And for those elected representatives that have worked and supported victims, I commend all the work that's been done for many years to get us to this point. What's important at the heart of all of this is always for us to remember that these are people who've been hurt, people who've been wronged, and been wronged by many institutions. And I think it's really, really significantly important that then everybody plays their part in allowing things allow us to respond to the needs of victims and the requests of victims. So I think the role of the other institutions is crucially important, and there's been a number of engagements with the different institutions around redress. And as you know, I believe from your committee experience, you'll know that the current estimates for financial redress range from 149 million right up to 402 is a central kind of estimate, and then even a higher estimate of 668 million at the upper end. So we're intending to hold a roundtable meeting with the institutions and to bring them round the table again, and let's get this progressed. Let's make sure that every single redress is made, and let's ensure that we also progress all the other issues, which include that fulsome apology, the memorial issue, the other things that were identified. And I'm determined, and certainly we as joint First Ministers are determined to make sure that this work is done with speed.
And I call Linda Dillon.
And can I welcome today's announcement first of all, and I look forward to meeting with Fiona Ryan when she is in post, just to have a conversation with her about how she will engage with victims and survivors, because that is a vital element in all of this, and as the Joint First Minister has already outlined how important that is, and I think it really is and can't be overemphasised. And we know that there were some difficulties obviously with the interim advocate with some of the groups. So I hope in moving forward that Fiona Ryan will engage and build a good relationship with the victims and survivors. Would the Joint First Minister accept that today's appointment has been a long time coming, and will you join with me in commending the victims and survivors in their campaign for truth, justice and public acknowledgement? And would you also agree with me that this engagement and support that we have talked about with victims and survivors will be vital in terms of the memorial and acknowledgement, and what will be put in place around the apology, because that is going to be important not only to those victims and survivors who are still with us, but to the families of those victims and survivors who have passed, and for those who have no interest in compensation, but absolutely want somebody to acknowledge what has happened to them or to their loved one who has already passed. Gormagat.
Her question, and again, I mean, I think this is a hugely significant milestone for victims and survivors and their journey. And I think it's testimony to all of their efforts. It's testimony to them finding their voice, exposing the horrors of institutional abuse that I'm here today as Joint Head of Government making this announcement. I think that, you know, we all and everybody in this House will agree that historical institutional abuse should never have happened. It was so wrong on so many levels. And, you know, trust was violated. Trust was breached and children were obviously violated. And it's a sad reality that so many children went through this experience and were forced to spend their lives carrying this unimaginable burden for such a long time. So I think that, you know, in recognition of the fact that thousands of children were robbed of their childhood and they were forced to carry this through their lives is just appalling, and they were failed by a system that was supposed to be there to protect them. That's the reality. They were failed by the system, and a system that also on many occasions turned a blind eye to what was happening, and it covered up systemic abuse. So we need to take this opportunity to learn all the hard lessons that need to be learned about what happened in these institutions and make a pledge that this will never ever happen again. I know that, as you have said, redress has been a long time coming. It's been far too long coming. So to all the victims and survivors of childhood institutional abuse, I pay tribute, we pay tribute to your collective will, to your determination and to your resilience over many years. And I think it is on days like this that we turn to those people that have actually lost, who've lost their lives, and our thoughts are with those families. And I believe that collectively across this House and indeed in wider society, we now also need to support and empower victims to move forward and assist them in rebuilding their lives. With the First Minister, we're committed to ensuring that all victims and survivors ensure they get the acknowledgement, the advocacy and the redress that they deserve. And today, this appointment, I believe, carries forward that work and will begin to progress some of the things that are still outstanding. So as Fiona Ryan embarks upon her work, working with victims, being that voice for victims and making sure that they will never be silenced again, I think this is a significant day, but we should never forget, in the midst of all of this, that it has been the courage and the tenacity and the resilience of those victims and survivors that has brought us to this stage today.
Thank you, and I call Matthew O'Toole.
Thank you, Mr. Speaker. Clearly, like everyone else, welcome this appointment. This is overdue, particularly for the thousands of people who had to endure appalling suffering at the hands of these various institutions. Can I ask the Deputy First Minister to say something about the staffing support that Fiona Ryan will have? It's right and welcome, clearly, that this appointment has been made. Other appointments, as we know, haven't been made. In relation to the TO, but what staffing support will she have in order to be the best possible advocate for victims?
Thanks again to the member for his questions. I think that there are, in terms of the staff, there's been a lot of work done around the support services and the staff that are available to the interim advocate, and also I think that we have an obligation to look at the work that's being done currently, and then what are the additional needs of the incoming Commissioner, and she obviously will have an opinion about all of that. So I think what we need to do is make sure that the Commissioner is supported in the best possible way, with the full resource that she requires in order to support victims. If we are marking this as a milestone, as a new beginning, and as an opportunity to address the outstanding issues, then certainly that I want to ensure that the Commissioner herself has absolutely every single piece of support that she requires. There are numbers, I can't recall to hand the number of staff that actually support the interim advocate and what will transfer over, but I'm happy to provide that to the member in writing.
I call Paula Bradshaw.
Mr. Speaker, and I welcome this appointment today, although I am disappointed that the likes of Savvy and I'm assuming other victims groups were not advised in advance of the press statement of this appointment. Nevertheless, my question, Deputy First Minister, is what this role of this new Commissioner, will she have any remit to provide support and advocacy for those unmarried mothers who suffered abuse in mother and baby homes, or children who were abused by clerics in non-institutional settings? Thank you.
Well, I think just Concordia, we thought it was appropriate to come to the House and make a significant statement of this nature to the House, and of course we will engage with the victims and survivors to make sure that they're fully briefed on the outworking of this. I think that just to be clear around the role of the Commissioner, it's responsible for a number of identified areas which the member will be aware, appointing a panel of persons, all of whom are victims and survivors, whose function will be to provide a forum for consultation and discussion with victims and survivors. That panel will be known as the advisory panel. She also will be responsible for providing advice on matters concerning interests of victims and survivors, and taking reasonable steps to ensure that victims and survivors are made aware of the functions of the Commissioner, the location of the Commissioner, and the ways in which the Commissioner can communicate directly with the Commissioner. She also will be undertaking or commission research into matters concerning the interests of victims and survivors, encouraging the provision and the coordination of provision of relevant services to victims and survivors, and then also making arrangements for publicising the role of the Redress Board, monitoring the operation of the Redress Board, and then establishing or making arrangements for establishing a panel of solicitors, the members of which the Commissioner is satisfied have the necessary expertise for providing legal advice and assistance on applications and also on appeals. The member will also be aware that in relation to those victims that fell outside of the HEART recommendations, that there is an interdepartmental group that's been established under Judith Gillespie, and that's looking at all those people that are actually still to be, they still need to be supported and find a way forward. So we look forward to the work of that group coming forward and actually making recommendations to us about what we can do next. So that work is ongoing, and you know that's a cross-executive, it's an interdepartmental working group. You'll also understand that the Department of Health are the lead department on the work on mother and baby homes and Magdalen laundries, and that's also an ongoing piece of work.
I call George Robinson.
Thank you, Mr. Speaker. And could I thank the ministers for their statement? And could the Deputy Minister state if the new Commissioner will have the ability to suggest new legislation if, during the course of discharging her duties as Commissioner, she finds this would be helpful to carrying out the very important duties that would be bestowed on her?
Thanks to the member again for his question. I think, again, as I said out there previously, the remit of the Commissioner, and clearly the remit of the Commissioner at its core is to be the voice of victims, it's to listen to victims, it's to engage, and it's also to represent them, and to make sure that they have confidence and faith in the office of the Commissioner to address their needs. So when it comes to making legislative changes or anything that's required, then we will listen. Our door will be open to work with the Commissioner. Our door will be open to make whatever necessary arrangements are required, legislatively or otherwise. But we want to say today very clearly to victims and survivors that your voice will always be heard. You will never be silenced again, and that this executive will make sure that we leave no stone unturned in assisting you and the Commissioner in the way forward.
Call Patrick.
Cian Corla agus Goan Buegas leis an ara Subta Righteous. I thank the Minister for the statement this morning. I wonder, could she advise why this appointment isn't coming into effect until the 14th of December?
The member for the question. We were keen that obviously that Ms Ryan would take up post very quickly, but because she has a current employment, she has to work out her notice. That's the only reason for the delay. Otherwise, we would have her in place today. But I think the significance of today shouldn't be lost. This is a significant public appointment which we are delighted to be able to make, and we hope that after this long-awaited period that this is something that the victims will see as a step forward and a milestone in their journey.
I call Trevor Clark.
Mr. Speaker, and like others, can I join in welcoming the fact that we've got to this stage? I'm sure many thought this day would never come in terms of the appointment, so we all welcome the fact that that Fiona's been appointed to this post. But given the difficulties, Deputy First Minister, around the interim advocate, do you believe that this is the right person for the job and she will have the confidence of the victims and survivors?
Yeah, I mean, I think that today isn't about the interim advocate. Today is about the new Commissioner coming into place. Today is about a new beginning or a new chapter, and today is about giving hope that finally things are being done and the needs of victims and survivors are being addressed insofar as we have this permanent appointment. Yes, both myself and the Joint Head of Government, Arlene Foster, we interviewed a panel of candidates. We were very satisfied that the appointment that we made is the right appointment. But clearly there'll be a period to build confidence, to gain the confidence of the victims and survivors. There'll be work to done to build those relationships. But I think that Ms Ryan certainly demonstrated to us that that is what she is about, and she is someone with a wealth of experience in working with people who have experienced trauma across a whole range of areas. And I think that that will be testament and will stand to her in her role as Commissioner. And we wish her well, and we wish that the relationship flourishes between herself and the victims and survivors.
I call Martina Anderson.
Caoimhe, and thank you, Minister, for your statement. And like Christopher Stalford, I actually was in the Assembly at the time that the institutional abuse inquiry was launched. In fact, I had the privilege of being the junior minister, one of the two junior ministers that launched the inquiry for the late Martin McGuinness and Peter Robinson. So I do welcome this announcement today. As we all know, the victims have went through a long journey. I hope that Fiona Ryan will take to her new post, and I'm sure that Sylvia and the other North West survivors groups and the other victims groups will all work well together now as they go forward. Minister, you outlined a number of applicants that had already applied. Could you give us some more information on the level of redress payment that has been made to date?
Thanks to the member for her question. And in terms of redress, as I said, the board opened for applications on the 31st of March, and we were delighted that 7 weeks later the first compensation payments were made within the timescales set out by the President. And we now know that numerous victims and survivors are now starting to receive the compensation that they are long overdue. The latest figures that we have are as at the 30th of September, 579 applications had been received, 156 of them from people who participated in the Hart inquiry, and panels have made determinations totalling 4.1 million and paid out a total of 2.6 million. So we're very grateful to the President of the HIA Redress Board for continuing the prompt payment and assessment of applications, and to those solicitors and groups that are supporting the applicants through this difficult process.
I call Sinead McLaughlin.
Mr Speaker, and thank you, Minister, for your statement today. It is very, very welcome, long overdue, and I'm absolutely delighted that we're at this juncture. We realise that the remit of the Commissioner is to be the representative voice of victims, but we also know that the victims of abuse, their families, have suffered greatly as well. Will the Commissioner have any remit in supporting the wider families, not just the victims and the survivors?
Their job is obviously to be the voice of victims, to be, to listen to them very carefully, to communicate that to government, to make sure that their interests are taken on board. I have no doubt that that would also include, the support circle around victims. But I think that in terms of support services itself, this is something that is actually being looked at. And the interim advocate himself had actually brought forward a number of recommendations around that, and we need to continue to make sure that all the support services that are required are in place. I know that the interim advocate had been looking at what further support that could be service provision is needed for victims and survivors, in line with the recommendations in the Hart report, for example, around specialist services, and he put in place an interim personal support service with the Victims and Survivors Service, which offers both a listening ear and access to emotional support and counselling, and that can be accessed via the Interim Advocate's office or independently. So officials are looking in the meantime then around how they can expedite preparations for making sure that the Commissioner will have key input into the services that are needed, so that would obviously include families also.
I call Mike Nesbitt.
Mr Speaker, thank you. May I welcome the Minister's statement, both very positive and extremely significant, I think, in this journey. As Mr Salford reminds us, it was the OFM-DFM committee of the day that scrutinised the legislation that set up Hart. And I think we were all very conscious that it was only open to victims who were abused in an institutional setting, and that there were many other victims, perhaps of the same abusers, who did not have access to Hart, not because of the nature of the abuse, but because of the location where it occurred. So I hope the Minister would agree that there is an equality issue here. And further to what she said about Judith Gillespie and that interdepartmental group, could she expand on the terms of reference and the indicative timeline for reporting, please?
Thanks to the member for his question. And again, it's really important that we send a very strong message to victims and survivors that no one will be left out, that they'll never be silenced, and that their voice is heard here in the Assembly and in the Executive. I don't have the direct role or the direct terms of reference for the Interdepartmental Working Group with me, but I'm very happy to provide that to the member. But clearly that's the role of the Interdepartmental Working Group is to consider evidence in relation to all of these matters and then to make recommendations to us in the Executive. So we look forward to getting that. The time frame, again, I will respond to the member in writing around the time frame of the Interdepartmental Working Group. But then alongside that is obviously the work that's happening in health, in the Department of Health around mother and baby homes and Magdalen laundries. No victim and survivor should be left behind. So we have an obligation to make sure that we progress all of this work in as speedy a manner as possible and that we allow victims and survivors to get to the point where they have the fullness of all the recommendations that were made in Heart. So whether that's apology, redress, memorial, all the things that are significantly important to victims and survivors, I want us to deliver that as a matter of urgency.
I call Jemma Dolan.
Does the Minister regard the HIA apology as a public acknowledgement of the wrongdoing suffered in institutions?
Yes, I think the delivery of an apology and public acknowledgement of harm and wrongdoing will be another significant milestone for victims and survivors. And I think that the sooner we can get to that point, the better. We know that there's been a significant body of work done through the interim advocate and working with the Victims and Survivors Group. They've also been looking at international best practice, so where else it's happened. It's really important that whenever we deliver this apology, that it's delivered correctly and appropriately and that it actually meets the needs of the victims and survivors. So I believe that over the course of the next short number of weeks, we have a meeting to discuss this, and I hope to be able to come at some stage to the Assembly to update colleagues on where we are with that. But it's a really significant, fundamental part of the Heart recommendations that we deliver an apology, and we're determined to do that.
I call Daniel McCrossan.
Thank you, Mr. Speaker, and I thank the Ministers for their statement as well. This is a significant announcement, and yes, one, as has been said, is long overdue. I'd like to commend the victims, those who have stood strong through very difficult times and have suffered continually throughout the years. This will come as welcome news today, and also to wish Ms Ryan well in her difficult and challenging job that lies ahead. Can I ask the Minister, is there any intention to increase the budget for the office, given the numbers of people involved? Additional staffing would help, and I know you've touched on that earlier as well, but just to give an assurance to those who are affected that there will be no barriers in terms of the resources necessary to support the Commissioner in her vital and necessary work.
Thank the member. We are determined to support the Commissioner in her work, and budgets will all be worked out in line with the needs of the office, the needs of victims, and what we can do to support them. So I thank you for your acknowledgement that this is, I have no doubt this is a day for the victims and survivors. It's them that have brought us to this point. I'm glad that I'm standing here today as Joint Head of Government, able to make this announcement, but in recognition that it has been a long time coming. But this is a significant day, and to all the victims and survivors, thank you for everything that you have done to get us to this point today, in your tenacity and the courage that you have shown and your resilience that you have shown for many years in the face of all the adversity that you have faced. And it's right that we're making this announcement today, and I'm glad that we're at this point, but we have a few more things to do. Not least the apology and the memorial. I want to get us to that point, alongside all the other work that needs to happen for those people that don't fall within the terms of the Heart inquiry itself.
I call Jim Allister.
I trust this will prove a more successful appointment than that of the interim Commissioner, and arising from the disastrous breakdown between many of the victims and the interim Commissioner. What lessons have been learned, and what mechanisms are in place to deal with such a situation if it should unfortunately arise again?
Well, let's hope that today is a new beginning, and that when Ms Ryan comes into post as the Commissioner, that the relationship between herself and the victims flourishes. Today isn't about yesterday, or it isn't about the interim advocate. It's very much about how do we support victims and survivors in the period ahead. And that's what I am focused on. What I want us to do is that we have a situation where all victims feel that they have a place, that they have a voice that is directly communicated with ourselves in the executive. That's what we're determined to do. This is a hugely significant day. Let's look to the future. Let's assist victims and survivors to look to the future. Let's help them rebuild. Let's deliver on the commitments that were made in the Hart report, and let's make sure that we're continually looking forward and assisting them in all that they do.
I call Claire Sugden.
Thank you, Mr Speaker, and I welcome the appointment. I appreciate both ministers bringing it to the floor of the House today. I think that's an important and significant statement to make. I'm also impressed by Ms Ryan's background, not least her experience within domestic abuse. Institutional abuse is comparable with domestic abuse, not least because it's an abuse of trust for those people who should have been protecting those children. The compensation will go some way to acknowledging the wrongdoings against these individuals, but I think there is significant trauma here, and in order to heal, we need to put more resources into addressing that trauma for those individuals. So will they be able to access resources such as counselling or legal services through the Commission?
So as I said earlier, in response to another answer, that the interim advocate has been looking at what support services are there, what is missing, what needs to be replaced, and then I suppose the resource conversation would follow the identification of need. But clearly this is something that we all prioritise. This is something that we know is a hugely emotive area of work that we do. And if we just make that firm commitment to be as responsive as we possibly can be and to support the needs of victims and survivors as they are identified by the Commissioner, I think that's the commitment that I could give today.
Okay, members, that concludes questions on the statement. Could I ask members to take your ease for a few minutes, and while we're waiting on the next matter, could I remind members that during the interval there, it's important that we still maintain the social distancing rules of 2 metres apart. Okay, thank you.
Order, members. The original intention was that this sitting would go until 1:30. This element of the sitting would go until 1:30, but we're running ahead of ourselves in terms of time. Unfortunately, I've been told that the statement that the Junior Minister intends to make runs to 24 pages of text, and it's now 7 minutes, less than 7 minutes to 1. So it would be my intention, with the leave of the House, to suspend this sitting, and the next item of business will be question time to the Minister for Infrastructure, and this business will be dispatched at 3:30, as was originally intended. The sitting is suspended.
Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the...
We resume the sitting. And the sitting is resumed. It is time for questions to the Minister for Infrastructure, and I call on Philip McGuigan. Mr McGuigan.
Question 1.
Tackling the climate emergency is the single biggest global challenge we face, and as Infrastructure Minister, I have made addressing climate change one of my key priorities. I am focused on delivering clean public transport and active travel options to build connectivity, reduce emissions and promote health and well-being for all. Earlier this year, I announced TransLink's procurement of 3 hydrogen buses, which will see the first hydrogen buses and the first hydrogen refuelling station in Ireland. It is anticipated that these vehicles will go into service later this year. In addition, I have committed £55 million of capital funding in line with the commitments in New Decade, New Approach for the purchase of 100 zero-emission vehicles by TransLink over the next 2 years. These vehicles will include 80 battery electric buses and 20 hydrogen fuel cell buses. It is anticipated the new buses will go into service in Belfast and Derry in spring 2022. I can assure the member that I am ambitious and I am committed to delivering on the decarbonisation of public transport. I recognise that collectively, with my executive colleagues and with the members of this Assembly, we can deliver lasting change for our communities. However, to make the change that we desire, we need to invest in infrastructure now for the future. I recognise that investment in infrastructure is not an end in itself. It is about people and place. It is about unlocking our economic potential, protecting our valuable environment to transform and connect lives, and it is about improving health and well-being for all our communities across the north.
Philip McGuigan, supplementary.
I welcome the Minister's answer and her commitment, obviously in the midst of a climate emergency, with transport one of the biggest contributors to carbon emissions. We obviously need to fully embrace sustainable transport methods. Can I ask the Minister how the Department's upcoming regional strategic transport network plan will help in reducing help and efforts to decarbonise the transport sector, and also maybe get an update on the 30 million for low-carbon buses announced in June?
I thank the member for his question. Within the regional transport plans, we are developing our road and our public transport network, and for me that is an important component of the decarbonisation. But as he says, I have invested 30 million this year in terms of the low emission and zero emission buses. And as I say, we have 3 hydrogen buses, the first in Ireland to come online before the end of this year with the first hydrogen refuelling station. I'm also keen to work with TransLink so that we can see decarbonisation right across our bus and our rail network. And I look forward to working with the member and others in terms of realising this.
Caoimhe Archibald.
Mr. Speaker, and thank the Minister for her answer. And she'll be aware, following a meeting we had with Wrightbus in my own constituency in Northampton, the importance of this issue, particularly to that company. And given the issue of hydrogen, how important it is, what undertakings and what information can the Minister give us in terms of discussions that she's had with the UK Government in drawing down our share of the money that was allocated in relation to the zero emissions buses? And also, will she give a commitment to ensuring that this is a matter which right across this executive is not only in her department, Department of the Economy and other ministers, so that we get an outcome rather than just proposals and plans?
I thank the member for his question, and as I said in my initial response, we have tangibly and pragmatically moved this forward in terms of the procurement of the 3 hydrogen buses. As you say, this is a commitment, a new decade, new approach, and on a very regular basis I am in contact with the British Government to remind them of their commitments and the compelling need to honour those. In terms of discussions with executive colleagues, you're absolutely right. Zero carbon is an ambition for the executive in its entirety, and just yesterday I met with the Finance Minister, the DAERA Minister and the Economy Minister to talk about the opportunities that we have across public transport, across our wastewater infrastructure, right across our public services to advance this whole agenda, given that we have very ambitious targets around zero carbon emissions and given the importance of the pressing climate emergency facing all of us.
Call Robbie Butler.
Speaker, thank the Minister for her answer. And in your answer to Mr McGuigan's question initially, you did mention active travel initiative. I know you've been shown great leadership in that respect. Can you outline to us any conversations you've had with local council with regard to planning matters, particularly area planning, and how we can partner, and you can partner with your department, with local councils to ensure that this is embedded right down to the community and societal level?
I thank the member for his question, and the whole active travel agenda is one that's very important to me, but also I think one that's hugely important in terms of public health, in terms of climate action, and we really do have a wonderful opportunity, I believe now. Yes, we've got the challenges of COVID and the challenges of Brexit, but we also have renewed momentum, I think, among communities to embrace active travel. We also have development of the local development plans within councils. So I think now is a very opportune moment to be working in partnership with all of the councils and with local communities. And in fact, my department and my walking, wheeling and cycling champion has been in very close contact and engagement with all of the councils. That's why we're able to advance the park and ride schemes, and we're working with them really closely to realise a number of active travel projects right across Northern Ireland.
Call Dolores Kelly.
Thank you, Mr Speaker. And Minister, thank you for your answers so far, but could you provide an update on your department's work to tackle climate change and how you've been hoping to green our infrastructure, including public transport?
I thank the member for her question. Yes, I am very committed to doing what I can within my department, working with executive colleagues, working with councils and with communities to tackle the climate emergency. I'm always struck by the way we as a community in Northern Ireland have rallied together in terms of our response to the COVID crisis, and I think we will see that impetus, and it's important that we do encourage everyone in our communities to realise the pressing emergency that is the climate crisis that is also facing us. We're trying to do what we can within the area of public transport. You will also know that I'd requested a sharp external review of the York Street Interchange project, a very important strategic project to which I'm very committed, but again one that I want to ensure is inclusive about communities, sits very well with all of our current strategic plans and also plays a key role in terms of the climate emergency. This approach is something that I want to embed right across the department so that we are seeing things in terms of a green recovery across every single aspect of certainly the Department for Infrastructure and I would hope right across the Executive.
Okay, members, before I call the next question, I should say that question 14 has been withdrawn. I call Jerry Kelly.
Question 2, let hope.
Mr. Speaker, with your permission, I would like to group question 2 and 7. In line with the commitments within the New Decade New Approach, I've begun early discussions with Minister Ryan on a feasibility study of a potential high-speed rail connection north and south as we seek to create a spine of connectivity on the island. The intention of a feasibility study will be to provide a high-level analysis of the potential of both high-speed and higher-speed rail to support the wider outcomes and priorities of both the Irish Government and the Northern Ireland Executive. It will allow for consideration of options from electrification of existing lines to bring maximum speed up to approximately 120 miles per hour to the development of a new high-speed connection on the corridor. Work is ongoing and I intend to engage further with my counterpart, Minister Ryan, to discuss this project further at tomorrow's NSMC Transport Sectoral meeting. In relation to improving the All-Ireland rail network, I am committed to improving transport links for the benefit of our economy and communities across our island. Improving connectivity between the north and south is a key priority for me, providing increased social inclusion, enhanced economic opportunities and an improved environment for all of our citizens. Rail, I firmly believe, is an untapped opportunity with multiple benefits that can play a crucial part in our future, and I'm looking forward to making progress with our colleagues in the Irish Government.
Jerry Kelly, supplementary.
We just listen to our hand Fragra Shin, and I thank the Minister for her answer so far and agree with a number of the things she said. And I will agree with her that the need to improve north-south connectivity starts with north-south transport connections, also to promote regionally balanced growth and to address the effects of partition on the island's infrastructure. However, Bus Éireann, I think last week or the week before, certainly suspended the bus service from Dublin to Belfast indefinitely. And I would ask the Minister, since she is meeting her counterpart in Dublin, could she raise this issue and try and reverse that decision?
I thank the member for his question, and he raises a very important point. I was informed by Minister Ryan's office on Saturday the 26th of September that the Bus Éireann Board would be recommending the indefinite suspension of the Belfast-Dublin service. I can assure the member that I am committed to securing island-wide services between Belfast and Dublin, and I will be discussing this matter with Minister Ryan at tomorrow's NSMC Transport meeting. My department will continue to work to provide services for our communities north and south and will work with TransLink to minimise the overall impact to passengers.
Call Justin McNulty.
Can I thank the Minister for her answers thus far. Can I ask the Minister what support is required from across the Executive to deliver on All-Ireland Rail that will help enhance our All-Ireland economy?
I thank the member for his question. As he knows, I am determined to make progress on island-wide connectivity. In the face of Brexit and economic turbulence, never before has the case for all-island connectivity been stronger. Rail is a crucial part of the jigsaw for growing connectivity north-south and enhancing our island economy. I'm pleased to say I've been working very closely with Minister Ryan, and we have together discussed how we can move forward on progressing this important area. And while we are in regular contact, I'm delighted to be meeting him formally tomorrow at the sectoral meeting on transport. But the member asks a valid question on the required support for all-island rail. Across the globe, we are seeing investment in critical infrastructure as a means to help communities build towards recovery. With the economic strain here, the crisis of the climate emergency, COVID and Brexit, we need to make strategic choices to enhance our economy and connect our communities. I will, of course, need funding, But given our commitments in New Decade, new approach to delivering change and investing in infrastructure, I hope that my executive colleagues will support the delivery our communities need.
Call Michelle McAleer.
Thank the Minister for her responses. In terms of developing Northern Ireland's regional connectivity, the European superhighway across the North Channel is central to accessing our largest market, but it's also the most expensive sea crossing in Western Europe, and the A77 and the A75 that it connects to are probably amongst the worst roads in Scotland. What work is the Minister and her department doing to reduce costs and to secure Scottish or national government investment in order to address this?
I thank the member for her question, and this is an issue that spans a number of government departments. My officials are working with their counterparts in Scotland. I am in close contact with Michael Matheson, my ministerial counterpart, because we recognise the strategic importance of that connection. And of course, I will continue to press the British Government to ensure that we can get the required investment, to ensure that we can get the road upgrades, that we can get that connectivity that is required to support our economy and connect our communities.
I call Rosemary Barton.
Thank you, Minister, for your answers so far. Minister, has any thought, you talked about north-south connectivity, has any thoughts been given to east-west connectivity and perhaps an investigation into rail transport towards Dungannon and on to Enniskillen?
I'm very mindful of east-west connectivity. I think that COVID, one of the positivities, and I've said that before on the floor of this Assembly, that I certainly have benefited from is having close engagement with ministerial counterparts across these islands. I have developed a very positive working relationship with Michael Matheson in Scotland, with my counterpart in Wales, and although at times it's fractious, also with Grant Chaps in the Department for Transport, and that is something, that engagement that I don't want to lose, I want to build on. I think it's particularly important in the face of Brexit. I am very ambitious for our rail opportunities. The difficulty that I will face is my ambition being curtailed by a lack of investment and funding. Public transport has suffered hugely, like all organisations, as a result of COVID, with a dramatic drop in passenger numbers and therefore income. The battle for me is to secure necessary investment to protect our existing public transport network, but I want to assure the member that my ambitions don't stop there. I want to see rail connectivity pushed across Northern Ireland. I want to see public transport as a cornerstone of our economic and our climate action strategy going forward as an executive.
I call Jim Allister.
Ms McAleer raised the issue. I'm content.
Thank you. Moving on then to Maurice Bradley.
Thank you, Mr. Speaker. Could I ask the Minister, following, question 3, that'll do.
As Minister responsible for promoting and improving road safety, I want to work actively with all partners to reduce death and serious injuries on our roads. As such, I have regular discussions with PSNI in relation to road safety, and I am acutely aware of the ongoing road safety concerns relating to car cruises in Portrush and Portstewart. I recognise that local residents are extremely concerned about the adverse effects caused by speeding and noise pollution from vehicles in the area. My officials have had discussions with both PSNI and Causeway Coast and Glens Council about these events, and I understand that a further multi-agency meeting is to be arranged. You may also be interested to know that the Department is currently progressing the legislation to extend the existing traffic calming measures on Lansdowne Road in Portrush. This will introduce some additional traffic calming humps to address some of the concerns about speeding in Portrush. I can advise you that DVA provided technical support during a multi-agency enforcement operation in Portrush and Portstewart on the 30th of August, which coincided with the recent car cruise event. During the course of the operation, police escorted 14 modified cars to Coleraine Vehicle Test Centre, where each vehicle was thoroughly examined by an enforcement officer using the agency's vehicle test equipment. Results from these inspections revealed that 12 vehicles, that was 85%, were found to be non-compliant with construction and use requirements to varying degrees, and that 4 were found to be in such serious or such dangerous condition that they could not continue to be used on a public road. Overall, there were 12 vehicles subject to immediate prohibition action due to varying road safety critical defects, with several drivers informed that they would be reported with a view to prosecution by police.
Maurice Bradley, supplementary.
Thank you, Mr. Speaker. I thank the Minister for her response. I have had those detailed conversations with the local PSNI, and I'm aware of the figures. But I was thinking, with the Minister being prepared to work with the multi-agency task force to look at ways of perhaps closing off the promenade during those peak times, Sundays and Saturdays being the worst. Thank you, Mr. Speaker.
For his supplementary question, and I know it's an issue that he's been working very hard on locally. The police can and do close roads in both Portstewart and Portrush when they have concerns about public safety. We do, however, need to be clear that this isn't really the solution, as we want all drivers to use the road with respect to all. But I assure him that my officials have attended the multi-agency meetings to date and will engage with all the partner organisations to try to address this issue and the concerns of local residents.
I call Caoimhe Archibald.
And I thank the Minister for her comprehensive response. Similar to Mr Bradley, I will be in regular contact with the PSNI around these events on an annual basis. And as you have touched on about how you're addressing the issues in relation to congestion and speeding, but also in relation to the air pollution that would come with that, is that something that you are also looking at?
It very much is. I see this problem as one of multiple layers, and I think we need to have a comprehensive approach to it. Tackling the modifications issue and the dangerous condition that a number of these vehicles are in will help with that in terms of modifications to exhaust. Doing what we can to ensure that they're not gathering in large numbers and revving their engines is also an important component of that, and we will continue to work with all elected representatives, with the PSNI, with the Council and with the local communities to try to get this situation under control.
Call Cara Hunter.
Speaker, and I thank the Minister for her answers so far. I welcome that the Minister has been very helpful by agreeing to ensure traffic calming measures and that they will be progressed. And I'm grateful that she recognises the stress this has caused my constituents by some boy racer enthusiasts. Can I ask, please, for an update on the traffic calming measures that will assist in stopping cruising and speeding?
Again, I thank the member for her question. Yes, as I've outlined, my department is currently progressing the legislation to extend the existing traffic calming measures on Lansdowne Road in Portrush. The scheme will consist of the following measures. One set of speed cushions on Causeway View between the junctions of Lansdowne Crescent and Princess Street, and 2 sets of speed cushions on Lower Lansdowne Road. The proposal was advertised earlier this year and there were no objections. I recognise how concerning this situation is for residents, and I am pleased that the scheme is planned to be in place this financial year.
Well, Claire Sugden.
Mr Speaker, and I want to thank my constituency colleague Mr Bradley for raising it in the House. It's an issue that all MLAs have been contacted about, and I do appreciate the Minister saying that it's not just an infrastructure issue, it's a multi-agency issue. In fact, it's an interdepartmental issue, because ultimately this gave rise to quite serious antisocial behaviour, which culminated in quite a serious and significant event which led to the prom being closed. I suppose I have a concern that we may face this again at other times of the year. And would the Minister work with the Minister of Justice to look at this as an antisocial behaviour issue, and what measures she can add to that to mitigate this happening again?
The member for a question, and to place on record my appreciation to local representatives of all parties who have been representing their constituents concerning this issue, and also been very much in solution mode as well, so representing their constituents' concerns but also coming up with practical ideas about how we can work together to address this. I mean, my officials have attended the multi-agency meeting. I'm not aware, I know the PSNI were there, I don't know if there was any representatives from the Department for Justice, but a partnership approach is the right approach in this instance, and my officials will work across all government departments and with all statutory agencies to try to address this and bring peace of mind and a better quality of life to the residents that are affected.
Moving on, I call Gary Middleton.
Number 4, Mr Speaker.
In June, I announced my commitment to fund the continued development of a number of strategic road improvement schemes, including the A2 Buncrana Road, as part of my plan to aid economic recovery and community transformation while addressing regional imbalance. Consistent with my wider priorities, I am committed to ensuring that this scheme is future-proofed and will help stimulate the green recovery. My department will continue to progress the A2 Buncrana Road scheme in line with my objectives, which include improving transport links, road safety and traffic progression, and contributing to the regeneration of the area whilst maintaining the environment and achieving value for money. Earlier this year, I met with local business owners in the area and have committed to exploring what options can be looked at in light of their concerns. I am keen to work in partnership with the community to deliver positive change for the North West. I would hope to be in a position to decide upon the progression to the next stage, which includes publication of the draft statutory orders for consultation by mid-2021.
Gary Middleton, supplementary.
Thanks, Mr Speaker, and can I thank the Minister for her response. I've met recently with local businesses who put across the position that there's a potential of 300 jobs to be lost if the development plan isn't adjusted. They have been met, unfortunately, at this minute in time with some of the officials rejecting those proposals. Will the Minister intervene and ensure that those 300 jobs are protected and that the concerns of those businesses are upheld?
I thank the member for his supplementary question. As I say, earlier this year I met with the local businesses on the Buncrana Road to hear directly their views and concerns, and I have asked my officials to continue discussions with all stakeholders over the coming months while progressing scheme development, in particular to ensure that it meets my objectives, but also that we work to try to address the concerns that are being expressed locally.
Call Martina Anderson.
Minister, you know that I have spoken to you about this matter at the committee. I've wrote you on it and I've raised questions, and like Gary Middleton, I've also met with some of the retailers as well. And I just want to ask you the question again, because they're not convinced that road service is really taking them serious enough, that they need modifications to the original plan. We all support the Buncrana Road, the A2, it's vitally important for the city to unlock the potential. So, Minister, I think it would be important if you could send them a signal today that you are listening. I know you are listening to them, but the modification of the road will definitely be taken into account in the context of new decade, new approach, co-design, nothing about us without us.
I thank the member for her question, and as I said, I specifically wanted to meet with the local business owners earlier this year to hear directly at a face-to-face meeting the concerns that they have. I've said very clearly to my officials that they need to be engaging and working with local stakeholders. I've said all along since I've taken up this post that we need to work in partnership. Local people know what works best. Obviously, I have strategic priorities in terms of my department and a number of measures that we need to meet around value of money, but I think that we get to the right place and we get better outcomes when we all work together. So I can assure you that I will continue to listen, and I've asked my officials to continue to engage directly so that we can work forward together.
Call Cara Hunter.
Martina has raised my issue, so I'm content. Thank you.
Okay, thank you. And moving on to question number 5, Andrew Muir.
Firstly, I must stress that securing the financial future of our public transport network remains a priority for me as we respond to the pandemic and develop sustainable ways of connecting people and communities to opportunities. My department's estimate of financial support required by TransLink for the remainder of the current financial year is £20 million, and my department will continue to bid for the shortfall. This sum takes into account the planned efficiencies identified by TransLink in response to COVID-19, as well as the most up-to-date picture of customer demand. We must also recognise that reduced passenger numbers does not automatically mean a similar reduction in the level of costs for the company. TransLink continues to play a vital role in ensuring that our citizens can continue to access their jobs, education and essential services. And I want to be clear that this funding is necessary if we want TransLink to continue to provide that service. Protecting a publicly owned public transport network and safeguarding jobs and ensuring a network that is accessible for all and based on need, not solely on profit, remains my priority, and one I know all executive colleagues share, given the renewed commitment I recently secured to ensure the network is protected and funded.
Andrew Muir, supplementary.
Thank you
very much, Mr Speaker, and thank you for the Minister for her response. At the outset, I would declare that I was previously an employee of TransLink. Significant funds have been allocated across the water to train operating companies, to bus operators and also to Transport for London. That came across to Northern Ireland as Barnett consequentials. Does the Minister not agree with me that the failure to pass that on and pass that support on to TransLink will have a devastating impact upon local communities and also upon our efforts to tackle climate change?
In short, I fully agree with the comments that the member has made and his analysis. On my desk, I have a very high pile of correspondence from across all political parties asking for additional services, additional train halts, extension of rail lines, and I wish that I was in a position to be able to grant them all. But as I say, TransLink is facing a hugely difficult situation as a result of COVID. And as you rightly say, we have seen right across these islands, the governments have recognised that. They have recognised the importance of our public transport in terms of connecting people, tackling the climate emergency, and also as a social justice element. So many people cannot afford cars and are wholly reliant on our public transport network. So I will continue to make the case at the Executive, and I very much look forward to the continued support of the member in that regard.
Call Cahill Boylan.
Thank the Minister for her answers so far. And just following on from the transport network, is it meeting the general demand of the public at present? And I asked it in the context of the rural areas because I know those areas could be a reduction of services in those areas.
Member for his question. From the onset of COVID, I agreed to a reduction in services, but right throughout the COVID crisis, we have constantly reviewed passenger demand. We have ensured that we have services on standby to enable social distancing across the network. And if the member has any particular concerns about any particular rural service, I'm happy to take that away and look at it. We have been increasing our services right across Northern Ireland in line with our risk assessment and the public health advice and the regulations from the Executive. And the member will also know that TransLink has put on an additional 500 buses to make sure that we can transport our school children safely to and from school.
Paul Frew, and there's literally seconds left.
Speaker, thank you. Can I ask the Minister, was it not a monumental error and therefore a matter of regret to the Minister not to put in place the apparatus to furlough TransLink staff? And has the Department calculated how much the furlough scheme could have saved TransLink?
In short to the member's question, TransLink did furlough staff. TransLink also provided a very detailed analysis of the scope and potential for furloughing, which was shared with the Finance Minister and Executive colleagues, which they all accepted. This is an issue that I know causes great hurt to TransLink staff. As one person said to me, every Thursday people stood clapping for frontline workers. TransLink were at the forefront of the fight against COVID, making sure that essential workers were getting to and from work, going over and beyond that. And they find it deeply hurtful that throughout that people were calling for them to be furloughed when it was very clear that the furloughing apparatus did not apply in that instance.
Okay, members, that ends the period for listed questions. We move on to topical, and I call Meg Nesbitt.
Thank you very much. I'm grateful if the Minister could outline her likely priorities when she engages with the Prime Minister's new connectivity review to be led by Sir Peter Hendy.
I thank the member for his question. I look forward to engagement with Boris Johnson on the connectivity review because there has been no consultation, certainly with me as the Infrastructure Minister in our devolved region. I'm very clear about the connectivity review. Connectivity is hugely important. But the British Government has signed up to a number of commitments within New Decade, New Approach that it has yet to honour. At a recent meeting with Minister Walker, I offered to send again that list of commitments to ensure that the British Government honours those. There are key strategic infrastructure projects right across Northern Ireland that would really transform lives. That's where I think we should put in our investment, not into a vanity bridge worth £20 billion between Northern Ireland and Scotland that none of us want.
Meg Nesbitt, supplementary.
Mr. Speaker, I thank the Minister for her answer. I wonder if she could tell us that, according to her own road engineers, the top 3 pinch points in the Northern Ireland road network and what her intentions are for easing those pressures.
Within the programme for Government and New Decade, New Approach, there are a number of strategic infrastructure projects that we've all signed up to. The A5, the A6, the A1, and we also have had significant and systematic underinvestment in our water and wastewater infrastructure. We now have over 100 locations in Northern Ireland where we're either at or just beyond development capacity. If we believe in building new homes for families, if we believe in growing our economy, then we absolutely must invest in our water and wastewater infrastructure. It's an absolute imperative.
Call Alan Chambers.
Mr. Speaker, Minister, I understand that there is at least a 7-week waiting list for a practical driving test before the online booking system went live yesterday, and that this morning over 730 people were queuing for over 20 minutes to even get onto the website to book a test. When will the driver vehicle agency be dealing with the backlog in driving tests and providing a service that meets the needs of the community?
I thank the member for his question, and he raises a very important issue. There has been a high demand for driving test bookings since the service reopened to all customers after being shut down for several months due to the Executive's regulations to prevent the spread of COVID-19. There has been thousands of driving tests booked for October to December, and this includes bookings for the priority groups, those who had tests cancelled, and obviously the new tests. The queuing software has worked well and has prevented the system from crashing, which is an experience that we saw in England. Slots have been released across all test centres up to the end of December, and today the DVA has released further slots from January. The DVA will also be incrementally releasing some additional slots for November and December when staffing availability is confirmed, as DVA continues to recruit more examiners to increase testing capacity as quickly as possible.
Alan Chambers.
Thank you, Minister, for your answer. You will be aware that there's a large number of experienced driving instructors, both in the private and the public sector, many of whom can train and test even to a more advanced driving level. I'm sure you fully appreciate the disruption that delays are causing to individuals and the economy. And will you consider bringing in urgent temporary measures to enable additional testing to occur at once?
Yes, I want to assure the member that DVA has been taking steps in this regard. We have already recruited 3 additional examiners. We are in the process of recruiting 12 temporary vehicle examiners and an additional 12 permanent vehicle examiners. The purpose of this is to free up our dual role examiners so that people are freed up to carry out additional driving tests. I understand the disruption that this is causing to people, but I also have to be honest with people. This is a high demand service that was shut for 5 to 6 months. We have put in a number of measures around the call system. We put in the queuing system. We are comparing at this moment in time anyway, and it is a fast changing situation, favourably to other parts of these islands. In the Republic of Ireland, for example, there is an 8-month waiting list for a practical driving test. So these are very difficult times, but I can assure you that the DVA is doing what it can to quickly as possible and safely resume its services.
I call Joanne Bunting.
Thank you, Mr. Speaker. The Minister has said previously, with regard to the same topic, that lessons would be learned from what went on in GB. What lessons does she consider have been learned in what has gone on in the past number of days?
Well, as I said, in England, the system crashed when it went online because of the volume of calls. Anticipating that and trying to learn from that, my officials have been very closely engaged with the DVLA in England. That's why we procured a queuing system to ensure that the system would be able to cope. I'm pleased to say that that is happening. And we've also, as I said, been in a very significant recruitment process as well to bring on additional examiners. We're also exploring how we can provide tests in the evening and on Sunday, but I have to caveat that with the need to ensure that the road safety conditions are paramount, because this is about teaching people to be able to drive safely across all of our roads.
Call Joanne Bunting.
I thank the Minister for her answer. But the truth of it is that a few additional slots aren't really going to sort out the problem. There's a backlog of around 23,000 cases. People do wait for hours to get to the front of the queue, only to be told that all the slots are gone. So, through you, Mr. Speaker, I would ask the Minister if she can tell us why the system went online prior to the published date for it to go online, and why some people were able to get test dates through their instructors in advance of the system opening, because it all sounds a bit Animal Farm.
Well, I don't accept the figure of 23,000, and I've heard this cited a number of times. I'd be keen to see the evidential basis for it. As I say, it's a high-demand service. When you close a service for 5 to 6 months, there will be difficulties. Trying to get a restaurant booked is difficult. Trying to get an appointment at a dentist or a GP is difficult. In respect of the online booking, the official reopening of online booking services for driving tests was scheduled for 8 a.m. on the 5th of October. This was the time the link to the driving test booking service was activated on the NI Direct front page. However, Capita completed their testing of the system around 8 p.m. and removed the restrictions on the system that had been put in place for key workers and those who had their tests cancelled due to lockdown. We now know that a number of customers managed to access the system from this point, although inadvertently this eased some of the pressure on the service the following morning.
I call Trevor Lunn.
Mr. Speaker, Minister, the owners of cars more than 4 years old had their MOT validity certificates extended for 12 months. But it does appear, and I'm prepared to be corrected, that there weren't actually any written communication with them to confirm that. What action has the Minister taken in particular to remind that group of motorists of their obligation, particularly on their insurance policies, to maintain their vehicles in a roadworthy condition?
Member for his question. Yes, at the beginning of the process, TECs were posted hard copy, but given the volume and the need to try to have a smooth and efficient process, we did move to an automated system. And I do know that has proven difficult for some people. I actually think it was Paula Bradshaw from the DUP who raised that it was a particular issue for older citizens, and so we've been engaging with AGNI and other sector groups to help with the communication around the automated system on that. There is a website, it's a DVLA website called Check Your MOT Status, and anyone can go on that and see what the status of their vehicle is in terms of their MOT and TEC, and I would encourage members to encourage their constituents to do so. But the member makes a very, very important point. The responsibility for the safety of your vehicle rests with the owner at all times, and I would ask members to help me in trying to continually convey that message to the public.
Call Trevor Lunn.
I thank the Minister for her answer. I suppose the solution to all this would be to bring the backlog of MOT tests up to date. Has the Minister considered maybe extending the opening hours of MOT centres, perhaps to include Sunday opening, or has she even considered licensing private garages to conduct MOT-type tests as they do across the water?
I thank the member for his question. In relation to the use of private garages, that's not possible under our legislation. I can confirm that all of the test centres, including Belfast, are now, well, Belfast is about to be operational, but the other 14 test centres are up and running. Belfast was handed back as a COVID testing centre. The lifts are being installed as we speak, and I hope within the next week that will be live, and that will help with the additional capacity that the member is seeking for his constituents.
I call Robin Newton.
Can I welcome the Minister's decision to invest £2.8 million in greenways? I recognise in the Cumber Greenway that there are problems from the boundary of Castlereagh Council to into the North Down Council. Can I ask the Minister what plans she has to invest in and upgrade the stretch from Hollywood Arches to the Billy Neal playing fields?
I thank the member for his question, and he is a champion for the Cumber Greenway and his constituency, and I welcome his support for the development of greenways more generally. I remember back to the adjournment debate that you had secured in March, and it was in light of that and wider considerations of the benefits of greenways that I found myself in the position where I'm trying to support them. We wrote to all of the councils to ask them for proposals to invest the capital monies that we have this financial year. I'm very much in the hands of councils. I know that the member has a particular interest around lighting of the Cumber Greenway. I've asked my officials to look into that. That will necessitate bat lighting, brat-friendly lighting. It will necessitate neighbourhood consultation. But I think the key here is working in partnership with the councils who have much wider remit than I in this. But I want to assure them that I'm keen to do what I can to support the Cumber Greenway and the advancements of greenways right across the north.
Well, Robin Newton.
I thank the Minister for that, and that is indeed encouraging. I would remind the Minister that both Belfast City Council and Lisburn and Castlereagh City Council unanimously voted in favour of the development of the Cumber Greenway and that stretch. Could I ask the Minister to give us an indication of when she might invest in that stretch?
Well, I've made an allocation this year. I hope to be in a position to provide further support to other greenways in the next financial year. We've actually asked councils who weren't in a position for us to be able to invest capital monies this year to be providing us with their proposals so that we can advance and progress through to delivery next year. Of course, that will be subject to funding, but I would hope to be able to advance this agenda while I'm the Minister for Infrastructure.
I call Emma Rogan.
A lot of people depend on driving for essential journeys, including getting to work. They deserve to have proper access to important services such as driving tests. Why were our services not better prepared for recommencing?
Driving tests have recommenced. They actually commenced for priority groups several weeks ago. The system went live this week for new driving tests because we had worked through key priority workers and also those who had had their tests cancelled, which I think was the right and fair approach. As I said in response to a number of questions from ministers, this is a high-demand service which was shut for 5 to 6 months. But as I hope I've demonstrated in terms of procuring the queuing system for the online service, by demonstrating that we are recruiting 27 vehicle examiners, that we are exploring additional capacity in terms of evening and weekend testing, that we recognise this is a really important issue and we are doing what we can to minimise disruption by making sure that we adhere to all of the risk assessments that we've carried out, that we adhere to the public health advice and we of course adhere to the Executive's own regulations.
Emma Rogan.
I have no further questions. It's been answered.
Jonathan Buckland.
Mr. Speaker, in May 1994, the Eurotunnel was officially opened, connecting mainland France with mainland United Kingdom, a feat in engineering and a game-changer for trade and connectivity. This week, the Minister sadly branded a study plan for a potential Boris Bridge as a publicity stunt. Can I ask the Minister, will she approach this with an open mind and realise the true potential that such a bridge could bring to the economy of Northern Ireland?
I thank the member for his question. If there was an endless pot of money, if we had strategic investment in our strategic infrastructure network, I would be happy to look at this. The reality is that this bridge is estimated to cost £20 billion. There are huge questions over its engineering possibilities, but we have to look at the person who's proposing it. He has a long list of vanity bridges that he's never been able to get off the line. So yes, I'm open to all key strategic projects, but I would remind the British Government and the Prime Minister that he has gave commitments around New Decade New Approach, and he absolutely must honour them.
Final seconds, Mr. Buckley.
There were sceptics in 1994 for the Eurobridge. I have no doubt they're here today and they're in this chamber, but there is people that want to see the feasibility study to such a bridge and the recognition of the potential that it could bring to the economy. And I would ask the Minister to proactively engage with the community and the transport sector as to how this potentially could go forward.
And I recognise that this is a project that has support among a number of people, and I do not want to be disrespectful of that. But imagine what we could do with £20 billion. The member is very proactive in representing his constituents to seek advancements and progress to infrastructure in his own constituency, which I support and I would like to do more on. We look and see what we could do in terms of our road network. We've spoken about the need to decarbonise our public transport. Those are priorities. I would not like to be in a position where we were squandering, and I do say squandering, £20 billion on a bridge that neither the Scottish Minister nor I as the Infrastructure Minister see as our #1 priority.
Time is up, members. Time is up. And members, please take your ease for a moment or two to be prepare the chamber. Okay, members, we now move on to questions to the Minister of Justice, and I call Sean Lynch to ask the first question. Mr. Lynch.
Question number 1.
Thank you, Mr. Speaker. The care of vulnerable people is of paramount importance and is taken very seriously across the justice system. This is particularly important in the context of the work of the Northern Ireland Prison Service, as we seek to care for and support a significant number of people with complex and challenging health needs who find themselves in custody. In answering a similar question in February of this year, I indicated the RQIA had been asked to undertake the review and would report by September 2020. Unfortunately, as a result of the pressures caused by the developing pandemic, it was not possible for this review to be completed. My department and the Department of Health continue to work with the RQIA to complete the review, with delivery of the final report now expected in May 2021. Although I regret that the announced review of vulnerable people in custody has not taken place, by working closely with the South Eastern Trust, our healthcare provider, the Prison Service has made significant progress in improving the support to people who are at risk.
Sean Lynch, supplementary.
And I want to thank the Minister for her answer. And I know the Minister said at the beginning of the year, she indicated that her intention was to discuss the issue of vulnerable people within the prisons. Can the Minister now commit to taking this important work forward as a priority with her counterpart, the Minister of Health?
I can indeed commit to it being a priority. It would have happened by September, but for the fact that COVID meant the RQIA, as you will understand, were repurposed and refocused in order to assist with the health crisis. But we are now working with the RQIA to ensure that that review takes place. We have, however, delivered a lot in the interim, so we have a joint suicide and health self-harm risk management strategy, a joint management of substance abuse misuse in custody strategy. We are reviewing our supporting prisoners at risk procedures, and that has reviewed in the delivery of a new person-centred approach, which aims to support someone through periods of crisis or distress, as well as addressing the root causes. We now have wellbeing hubs in each of the prisons, which provide therapeutic environments for people in care who need the trust mental health teams, and also specific therapeutic spaces in each of the establishments to provide multidisciplinary support to people at risk. So it is a priority. We are still making progress, but I still want to see the review done by the RQIA as quickly as possible.
I call Doug Beattie.
Mr. Speaker, Minister, a death in custody is unusual. 2 deaths in 10 days is extremely rare, and our thoughts are with the family of those who have died. However, does the Minister think it's acceptable that this Assembly and the Justice Committee found out about this second death via social media and whistleblowers, especially in light of the fact that I raised the issue about chronic understaffing of night custody officers?
Mr. Speaker, I want to unpick some of the issues in the question. Firstly, with respect to deaths in custody, every death in custody is not just unusual, it is a tragedy. There is a family who are grieving as a result of that death in custody, and it is our practice in Northern Ireland Prison Service to carefully liaise with families about public announcements. In the case of the second death, it was at the request of the family that no public announcement was made, and that was respected. However, in both cases, the deaths, as you would expect, were reported immediately to the Prisoner Ombudsman and also to the Coroner and the PSNI, and a full investigation will happen into each of those deaths in custody. And it is absolutely crucial that people do not make preemptive or prejudging statements in relation to deaths in custody when the nature of that death has not even yet been investigated or established. With respect to the specific issue and unrelated issue of staffing in the prison, I can assure the member that the prisoner, the Governor and the senior management team scrutinise staffing figures daily, including night staff deployment, and redeploy staff where necessary. That process ensures adequate numbers are on duty at all times. And I can confirm that there were adequate numbers, the full complement, in all residential areas of the prisons on both nights when those tragic incidents took place.
Okay, thank you. And I call Linda Dillon.
Concordia, question 2.
Mr. Speaker, with your permission, I will answer questions 2 and 10 together. Firstly, I want to say again how much I regret that this incident happened and apologise to the victims of these offences for any additional trauma they have suffered as a consequence. I realise how difficult it must be to accept the convictions of those who committed these crimes against them will be rescinded, and how difficult it is to hear these issues discussed in the public domain. My priority throughout has been to ensure that the victims are protected as much as is possible from further distress, and once I was made aware of how the PPS intended to proceed, I sought assurance from the Director that support would be in place when victims were informed about the intention to set aside the convictions and continuing for as long as is necessary once victims had time to absorb and consider the information. The Director provided that assurance and advised he had engaged the services of victim support and Nexus, and I'm grateful to both for their assistance during this period. My officials have had regular meetings with colleagues in the PPS in 2020 to understand what went wrong. Further meetings are taking place in the coming months to take stock and consider what actions are necessary to ensure that the lessons learned from the current situation are applied going forward. As part of this approach, I have tasked a senior lawyer in the department to develop a quality assurance check mechanism, which will be built into processes involved in both developing policy and drafting provisions for future legislation. I have also spoken with the Director of Public Prosecutions, and we have agreed that a joint system review will be formed between both the DPS and DOJ to take forward work in that regard.
Jemma Dolan, supplementary.
And thank the Minister for her answer to the question, and thank you for coming to the House last week. Obviously, out of that arose some further questions, but just in relation to, have you an update? And you did give us quite a good update last week, but I would like to know if you have an update on how many of these there will be re-prosecutions, and how many there won't, if you have those figures, particularly around the issue around those who are on the sex offenders register.
With respect to the re-prosecution, obviously you will appreciate that that is not a matter for my department. It is a matter for PPS, and it is too early, I think, at this stage to judge whether there will be re-prosecutions in all or some of those cases. They are currently liaising with the victims to take on board their views. They will also look at the evidence and also what impact it has on the protection of public safety. That is one of the core issues that they will have to consider as they reach their decisions. However, as I explained last week, there are certain protections in place with respect to public safety. So the fact that these convictions have been overturned does not mean that they will not turn up, for example, on access NI checks. It will simply be put through the filter, first of all, of the senior police officer responsible for responding to those checks.
Call Alan Chambers.
Thank you, Mr. Speaker. Minister, can I confirm if your officials have actually met with any of the victims? And has the Minister met them herself, or has she any plans to do so in the future?
Mr. Speaker, my officials have not met with the victims. They have been contacted by the Director of Public Prosecutions and his team, as would be appropriate, as it was their decisions to prosecute the cases. If any victim wishes to speak to me, of course, as with all other victims, I would be willing to meet with them. However, I would certainly not be wishing to impose any further trauma or debate around these issues on them, if perhaps some of them simply now have acknowledged that the error has happened and don't wish to discuss it further. We have to proceed sensitively with these issues, but certainly if a victim wishes to meet with me or with my officials, I would be more than happy to do so.
I call Sinead McLaughlin.
Thank you, Speaker. Can I ask the Minister what measures that she has put in place to ensure that there's no perverse compensations are made available to those that are convicted under the legislative area?
With respect to compensation, I think we have already noted last week that it would be my intention that if anyone were to seek compensation for their conviction, that we would resist that robustly as a department. These are not flawed convictions. These are robust convictions, many of them, I think at least half of them actually, as a result of guilty pleas. So there isn't a question here about the validity of the conviction, simply about the court in which it was taken forward. So we would not be willing to consider lightly any claim for compensation, and we will resist that. With respect to other payments that those individuals may have made, they may be entitled to reclaim those, and we have said that we will indemnify the victims of those crimes from having to repay any compensation. They're relatively small amounts of money, but nevertheless, I think the indignity would be significant were we to expect any victim to repay, given that none of this is their fault. So we will indemnify any victim where there is an attempt to reclaim that money. However, there's no clarity that that would be the case in any of these cases at this stage.
I call Paul Frew.
thank the Minister for her very clear statement last week on this issue. And in that statement, the Minister stated that it was some 3 months between her department knowing and the Minister knowing about this issue. Can the Minister clear up for this House whether the Minister received any sort of inkling or briefing before she was informed, or was that vacuum of 3 months in which the Minister was kept completely in the dark?
Well, I set out the timeline very clearly last week, Mr Speaker, when I was informed, when the department was informed and what they were informed of, and I have nothing to add to that statement today. I think it is important for members to understand that there may on occasion be issues that arise within the department where someone thinks there may be a problem or concerned that there is a problem, and it is important that we allow people to do that investigatory work in order that when they come to the Minister they come with the full picture, and I think that's what officials were seeking to do. I have to say that what I want to have within the department and within the justice system more widely is a system where people feel free to come forward and raise issues if they have concerns, raise issues with the Minister if they're concerned about that there may have been errors or faults, because what we want in all of this is to have a justice system that is responsive and is properly held to account, and creating that culture of accountability is hugely important, but it involves allowing staff also to do their jobs without constantly feeling that someone is breathing down their neck.
Call Sinead Bradley.
Mr Speaker, would the Minister accept that there is now a duty on her to take action to preserve any documentation or evidence that was used during the original convictions should re-prosecutions have to occur?
Well, Mr Speaker, one of the key documents that will be preserved is the court record from the original trials where people will have pleaded guilty or indeed where evidence will have been presented. There may not be a huge amount of other evidence actually available. Some of these cases date back to 1973. So we have to be realistic in terms of what will and will not be available. However, there's been no suggestion from the DPP that lack of evidence would be an issue in deciding whether or not to re-prosecute these cases.
I call Stuart Dixon.
Question number 13, or supplementary? Supplementary. Oh, thank you very much, Mr Speaker. Minister, you've had a meeting with the PPS with regards to this situation. What assurances have you received that this error or errors like this will not reoccur?
Well, I think that there are two things we need to do from this. The first is to put the victims in this particular situation first and ensure that every resource is available to them that they need in order to cope with what has happened. And the second is to look robustly at the system. This was a unique error and not one that we have seen happen anywhere else in the system. However, that is not to say that it is not possible that there would be other errors, because this is a human error and those things do happen. The important issue is how we respond to it, and part of that response is that we will work with the DPP to review all of those changes in legislation and to make sure that where saving provisions were necessary, that those are indeed in place, and learn going forward so those are not repeated. I also think, Mr Speaker, with fairness to this chamber, that its presence here and the scrutinising role which it performs is possibly the best safeguard against what happened in that particular case in 2008, when at that time we were not here able to do that work as an assembly in terms of justice. And I think that the scrutiny role which committees play in terms of looking carefully, clause by clause, at pieces of legislation, asking questions and scrutinising how things are taken forward is absolutely critical in terms of avoiding a repeat.
Moving on, I call Gary Middleton.
Mr Speaker.
Mr Speaker, with your permission, I want to answer questions 3 and 14 together. Ensuring the safe operation of custodial environments is a top priority for my department. The Northern Ireland Prison Service has followed the advice of the Public Health Agency and worked closely with the South Eastern Trust to implement an extensive range of precautionary measures in March of this year. These measures included the suspension of in-person visits, forms of temporary release, significantly restricting access to prison establishments, and the introduction of house-based routines to support social distancing. Further to those specific measures, there are robust arrangements in place for the isolation of individuals committed to custody or who become symptomatic. Northern Ireland Prison Service also has well-developed and embedded procedures for prisoners and staff to be tested for COVID-19. Prisons also have extensive arrangements for the supply and appropriate use of PPE and for hand washing. All of this work has been supported by regular communication about the risks of infection and how these can be mitigated. Advice about hand washing, catch it, kill it, bin it, and social distancing is widely displayed and reinforced at establishment level and service-wide. On the 3rd of July, Prison Service formally initiated its Operation Recovery Plan. Through this recovery plan, the measures introduced will be incrementally and gradually relaxed, provided that the risk posed by the virus does not alter and impact on those plans.
Well, Gary Middleton.
Thank the Minister for her answer. Minister, what preparations are you taking in terms of sickness, absence within the prison service staff and potential longer-term complications arising from those recovering from COVID-19?
Question, and clearly absence was a consideration at the height of the pandemic in the spring, and it may well become a consideration again. There were a number of measures that we were able to take at that time, including additional payments, additional hours worked, but we have to be realistic about how we manage our resource, and so we will be responsive to any changes in attendance at work. There are a number of our prison officers who also fall into the vulnerable category, and we need to recognise that as well, in addition to the fact that we have a significant cohort of people within the prison system who are also vulnerable. So there is a lot of work being done to ensure that we have the proper staff complement. There have been recent recruitments into prison service, and we are continuing to work forward with that as new people are brought onto the service, and we hope that that will help alleviate some of those concerns.
I call Trevor Clark.
Thank you very much, Mr. Speaker. Can I thank the Minister for her responses thus far? In her response, she referred to some of the restrictions because of COVID, in terms of visits and such like. In terms of the visit, in terms of the protesters outside, do you believe that the prison service has done enough to actually bring that to an end, as opposed to actually putting an additional burden within the service?
Well, first and foremost, the policing of protests outside the prison are not a matter for prison service, they're a matter for the Police Service of Northern Ireland. Prison service worked at all times with the police in terms of the protest. If the member is referring to the protest within the prison, I believe that prison service acted in a proportionate way, as it has done throughout the COVID crisis, in terms of ensuring that those who return to the prison from outside, whether that be from a hospital, and in this case it was Givan Area Hospital where there had been a spike in COVID, or whether it is from the general public, go through a period of isolation in order to ensure that we keep the prison population safe and free of COVID-19. Given what has happened in other residential environments and indeed in other prisons across these islands, I think it is to the credit of our prison service that we have managed to only have one case detected of COVID in the prison, and that was in the isolation unit, which was doing the job to which it was actually designed.
Next question, I call Jerry Kelly.
Question 4, please.
While the short title of the Act is the Serious Crime Act 2007, its provisions are not limited to dealing with serious crime offences, though that was the purpose. This is the case particularly in Part 2 of the Act, which introduced offences of encouraging and assisting crime. Section 44 falls under Part 2 of the Act. Section 44 of the Serious Crime Act 2007 created the offence of intentionally encouraging or assisting an offence. It sets out what a person must do to commit the offence and provides further definition as to what is meant by intention. Its application across the spectrum of criminal offences, and that is not only intended for serious crime.
Call Jerry Kelly, supplementary.
Question, thank the Minister for the answer up to now. And she may have anticipated my next question is about. As she suggested, the purpose of it was suggested for, as the name says, serious and organised crime. And while I know she can't talk about any particular case, just let me say in terms of background, that the PSNI used it on the 6th of June, both in Derry and in Belfast, I think on 5 occasions to that. And I think I may have said this, but if I didn't, obviously I have to say I'm a member of the Policing Board as well. In the Black Lives Matter, which caused a lot of consternation. So I suppose the question to the Minister, on the basis of what the answer she has given, is does she believe that it is either proportionate or appropriate to use this, I'm not speaking about use that as background, but to use serious crime legislation for peaceful protests or anything like that?
Well, Mr. Speaker, The issue of protest is not necessarily only whether it is peaceful, it is also whether it is lawful, and that was the point in question. But it would not be appropriate, given the investigations that are ongoing by the Ombudsman, by the Policing Board itself, and also given that these cases are still potentially before the courts, for me to comment on the specific use of the offence. I'm also aware of the comments made in the press today by the Director of Public Prosecutions in relation to the use of this offence. I think it would be best for all of us now to wait on the outcome of the investigations that have been set out in order to judge that. I can only speak to the legislation, and whilst the legislation is the Serious Crime Act, the sections of that Act which were used are not solely for the use in serious crime. They can be applied across a range of other offences.
I call Paul Givan.
We know that the Minister has been tasked with looking at enhancing the enforcement powers around COVID. Is she going to be making reference to this section as part of considering those issues?
To correct the record, Mr Speaker, I volunteered to look at the issue of serious offences because, like all my executive colleagues, I want to play an active role in ensuring that we are able to deal with this issue in a timely way. We will not necessarily be referring to this particular offence, but there is an issue which it points to, and that is about differentiating, Mr Speaker, between those who in good faith embark on activities, believing them to be organised by someone else in a way that complies with the regulations, and those who organise activities and fail to comply with the regulations. I think the burden ought to lie more with those who organise events inappropriately and without due regard than those who perhaps attend in the false confidence that they're attending an event which is safe and secure. And so we do want to look at the penalties, not just in relation to individual infractions, but also to those who are organising events, who are managing facilities and who are not taking due regard to the regulations.
Next question, I call Meg Nesbitt.
Mr Speaker, question 5.
It is important to understand that the management of separation in our prisons is complex, challenging and at times dangerous. Therefore, I want to begin by paying tribute to the staff of Northern Ireland Prison Service for the commitment and the courage they demonstrate every day working on our behalf. If a prisoner, whether sentenced or on remand, applies for and subsequently meets the criteria set by the Secretary of State for Northern Ireland for separation, then the Prison Service is required to hold that individual in accommodation apart from the other prisoners at that establishment. We currently have 42 adult male prisoners in McGabry, 19 Loyalists and 23 dissident Republicans accommodated on 4 landings in bush and row houses, and 3 dissident Republican female prisoners held on 1 landing in Fern House at Hydebank Wood. It costs the Prison Service in excess of £2 million per annum to operate separation at McGabry, and we expect annual running costs at Hydebank to be in the region of £330,000. Irrespective of whether we agree with the concept of separation or not, it is vital that these landings are appropriately staffed and security is commensurate with the level of risk of the Prison Service is required to manage.
I call Meg Nesbitt, supplementary.
I thank the Minister for that. A fortnight ago, she told me in this chamber that she would support an end to segregation, but that the matter lies with the Northern Ireland Office. And I quote her here, "It is not my duty to direct the Secretary of State." Does she understand? Nobody was asking her to direct the Secretary of State, just questioning why, if she's in favour of an end to segregation, she hasn't had the conversation with the Secretary of State.
Well, Mr Speaker, first and foremost, with all due respect to the member, he's not aware of what conversations I have or have not had with anyone. He did not ask that question and I did not answer it. With respect to the separated regime, it exists because conditions in wider society create a need for the regime. Bringing about an end of the separated regime depends on our collective success at tackling paramilitarism, criminality and organised crime. The Executive has an action plan, which it is implementing, and has committed to extending that programme of work. We're using to build resilience in individuals and in communities. It's vital that we also provide the political leadership to enable that change to happen. Prison Service has a range of commitments under that action plan, and these are important in their own right, but they cannot address the wider and underlying conditions that will depend on the success of the overall action plan. The focus and priority in our prisons has been on keeping people safe, throughout the COVID-19 pandemic. That is what we have done, and I pay tribute to the staff for their work in that. There is a commitment to review the operation of separation under the Tackling Paramilitarism programme. That will be taken forward when possible, but the focus for now is on managing the risks to prisons from COVID-19.
Stuart Dixon.
Thank you, Minister, for your answer. Minister, I'm sure you would agree with me, and indeed every right-thinking person, that the sooner we end segregation and bring about the circumstances to end segregation, the better. That can only be done through tackling paramilitarism and other criminal activities like that in our communities. But there are also other issues which we need to deal with in order to deal with segregation in our community. We have segregation in education, in housing, teacher training and other things. Some of those might be easier asks, but, Minister, today it is important that we all work together to end segregation in our prisons.
Mr. Speaker, our prisons are a microcosm of the society in which we live. If we want to tackle separation within the prison system, we need to tackle segregation outside the prison system. All of us have a role to play in that, not just me as the Minister. But if leadership is required in these areas, I will not be found wanting, which is why I've set up the political advisory group around the Tackling Paramilitarism programme. We've had our first meeting. We intend to meet again. And we will be driving this forward, hopefully, with collective political engagement. But it has to be a collective response. And I have to put first the safety and security of those in the prison, not just those in the separated regime, but the rest of the prisoners within the prison.
Jemma Dolan.
Could the Minister outline what plans she has for wider and more comprehensive reform of the overall prison system?
The member will be aware that Prisons 2020 is just about reaching its expiry date, and whilst a huge amount of good work has been achieved under that, we are now in the process of looking at the next phase of improvement. We obviously are on a constantly improving situation in terms of trying to ensure that support for prisoners is improving, that accommodation is improving, and that we're making the kind of investment in our prison system, particularly around rehabilitation issues, that will allow people when they exit the prison to rejoin society and play a constructive and productive role. I believe that that should be the focus of what we look at when we look at our prisons, because being successful in rehabilitating prisoners is the best way we can prevent further victims of crime.
Allister.
Thank you. I'm sure, Minister, none of us need reminded how tight finances are, particularly during COVID. But am I to understand from a written answer which you gave me that in respect of Landing 4 in Fern House, £482,000 was spent to prepare that landing for 3 women Republican prisoners, and that the annual ongoing cost, the resource cost, will be £355,000. Have we really got things into the proportion that they should be in these times?
Well, I, like the member, am very concerned about the cost of separation within the prison system. The previous separated unit at Hydebank is now a mother and baby unit, and the interim accommodation that was being used was not considered suitable from a security perspective. Consequently, Landing 4 in Fern House was identified as a discreet and more secure facility. Extensive work was required at a cost of approximately £482,000 to repurpose the unit, and the work had to be completed within a 2-week period. Structural, electrical, mechanical work was all required to enhance security, and it is right that we ensure that an adequate and appropriate level of security is in place to manage the challenges presented by separation and by particular prisoners. Unlike Maghaberry, Hydebank is not a Category A prison, but the risks presented by those who do not recognise the legitimacy of their imprisonment is no less significant at Hydebank than it is at Maghaberry, and it is right that we should invest in that. I would want to reassure members, however, that despite all of that expenditure, less than £6,000 was spent on cell furniture, soft furnishings and recreation room. I believe that it is right the prison service provide modern, decent and fit-for-purpose accommodation. I visited the unit myself to ensure that that is what we have done. This is not in any shape or form about luxury or preferential treatment. It is about decency, it is about security, and it is about managing a very difficult environment professionally, competently and humanely.
That ends the period for listed questions, and I will move on to 15 minutes of topical questions. They call Alan Chambers.
Mr. Speaker, Minister, I understand that the Northern Ireland Policing Board are currently dealing with a complaint under their standing orders against one of its board members, Mr Jerry Kelly, MLA, by consideration for informal resolution by their Vice Chair, and if that cannot be achieved, being referred on to the Chair. However, the Minister does have the powers under the Police Northern Ireland Act 2000 to take action to remove a member of the Policing Board. Can she confirm if there is anything in the Police Act that compels her to await the outcome of any internal action by the Policing Board before she can consider or exercise these powers of removal?
Mr Speaker, on this issue, I have to put my position on record. I found Mr Kelly's comments offensive and inappropriate, and I ask that he reaffirm his commitment to non-violence and exclusively peaceful and democratic means, consistent with his responsibilities, both as a member of the Northern Ireland Policing Board and as a member of this House. Any investigation into whether Mr Kelly is in breach of Policing Board Code of Conduct is a matter for the Board in the first instance. I am aware of the powers available to me under the Policing Northern Ireland Act 2000 to remove members of the Policing Board, and should this matter come before me, I will give it careful consideration. But as Minister for Justice, I have to stand for due process, and it would be wrong for me to make decisions precipitately before the due process has been followed.
Mr Chambers.
Minister, with respect, is it not the case that in fact you have moved outside due process by calling on Mr Kelly to reaffirm his commitment to peaceful means, and the Code of Conduct of the Policing Board does appear to be silent on what action they can take, but public confidence in the board has been seriously undermined, and would the Minister not give consideration to dealing with this as a matter of urgency?
Well, no, I don't believe, Mr Speaker, that I have gone outside due process. Every single one of us in this House has a duty to call on all members to respect the rule of law, to be temperate in their exchanges, to be sensitive to victims. And so I don't believe that it in any way precludes whatever decisions will be brought forward by the Board. I await the outcome of the Board's deliberations on this matter, and when they're brought to me, they'll get the due consideration and regard that they deserve.
Michelle McAleer.
I ask the Minister for her assessment of the appropriateness and effectiveness of penalties where breaches of COVID regulations have taken place.
Mr Speaker, the issue of penalties is one that is currently under review. It is hard to judge, quite frankly, whether or not the distribution of penalties is what drives people's behaviour, or whether instead it is people's genuine concern for their family, their friends and their community. I rather believe that it is the latter. At the beginning of this COVID crisis, we saw people act in extraordinary ways, making huge sacrifices in order to protect their family, their community and their loved ones. I believe that by the 4 E's, so by engaging, explaining and encouraging, we are helping and assisting people in being able to continue to comply with the regulations. However, as with any law, there must be some enforcement and it must be fit for purpose. And so my review that I'm undertaking with other executive colleagues this week will look very carefully at that issue and take recommendations to executive in due course.
Michelle McAleer, supplementary.
Thank you, and I appreciate the response from the Minister. Given the extent and the scale of some of the breaches to date and the lead role that the junior ministers are playing on the ministerial-led group on compliance and enforcement, can I ask the Minister to outline the extent of her personal commitment and that of her officials to the work of that group?
My senior officials sit on the group and contribute to the discussions. I raise these issues on my bi-weekly calls with the Chief Constable in order to ensure that there is good policing input into this. Though I have to constantly remind members, it is not only the police who are responsible for enforcement. Councils also have a role in that. And when it came to the review of the penalties, I offered to take that forward as a separate piece of work, and I will be bringing the recommendations to the executive in due course, hopefully in advance of this Thursday's executive meeting. I think it's important that all members of the the Executive are committed to this. I should also note that having engaged with police, with councils and with others, they are now looking at a different model in terms of how they take forward these issues under civil contingencies legislation, which would actually probably transfer responsibility for leadership on this to health, as they wish to be tasked from a health perspective with the duties that they undertake, as they don't sit comfortably within the justice sphere.
I call Cathal Boylan.
Just following on from the previous speaker in relation to fines and the imposition of fines in relation to the regulations for wearing masks or face coverings. Can the Minister just give her assessment of that on whether or not there has been sufficient enforcement in terms of these regulations?
Well, I think there is a danger in thinking that because there have been no fines on an issue, there has been no activity around that issue. I think that is flawed in terms of the narrative. If we actually engage with the police and talk to them, they make many thousands of interventions with people on an average week, where they speak to people, they ask them to wear a mask, they explain the importance of it and they explain the regulations. And the vast majority of people who are able to do so comply. So the fact that we are not handing out fines for this is not either that unusual, because there have not been a significant number of fines across GB for this either. It is quite a difficult area for the police to enforce. There are sensitivities in terms of people's underlying health conditions that may make it difficult for them to wear masks. There can be complications in terms of determining the age of an individual and as to whether or not they should or shouldn't be wearing a mask in different circumstances. But I think it's incumbent on all of us to show leadership, because by showing leadership, by showing that we recognise the importance of wearing a face covering when we are in closed circumstances where we may find social distancing being breached, by showing people that we don't see it as in some way emasculating or a pointless exercise, I think we can show leadership in the community and hopefully encourage others to take their responsibilities in that regard equally as seriously.
Cathal Boylan, supplementary.
Could I thank the Minister for that response? Minister, there has been disturbing reports about unacceptable abuse towards workers, in particular shop workers, who've played a vital role over this pandemic. Can I ask the Minister to give assurances that such unacceptable abuse will be tolerated by her department and by the criminal justice system?
Well, I mean, I think we have perhaps all at times been witness to people who have been less than gracious when they've been asked to put on a mask in a shop or a restaurant or wherever they may be. To the people who have gone out every day throughout this pandemic and have served the community in order to keep things ticking over. Anyone who gets abusive towards staff risks exactly the same penalty as they would at any other time. Engagement has to be civil. If people have good reason not to wear a mask, there is nothing to preclude them making that clear without getting into altercations with shop workers. And those who do, and we've been clear about this, while the police may not have the resources to be in every shop or on every bus or on every train or in every street corner, they do have the resources to respond when people are abusive or create disturbance or are intimidating or threatening towards members of the public. And I would hope that shop workers would have the confidence to phone the police in those circumstances, and that they would, I am sure, get a speedy response.
And I call Claire Bailey. Next question.
Thank you. Minister, can you let us know what the membership of the Antisocial Behaviour Delivery Group, led by your department, consists of, please?
Mr Speaker, it's a cross-departmental multi-agency group which brings together officials from local government, from the Department for Communities, from my own department, and I think also from the Executive Office. But I will write to the member in more detail to give her the full details of its membership and complement. However, the work of that group is hugely important in terms of tackling antisocial behaviour, because we do have clearly issues around how we tackle that. Those issues have been multiplied by COVID, but they do pre-exist. And it's something that we have been working on in terms of an antisocial behaviour strategy and how we might implement better procedures going forward.
Claire Bailey, supplementary.
Thank you. Can the Minister let us know how often or how many times the group has met to date, and if the strategy will be published so we can see it in some form of a report?
Well, in terms of an update on the review, obviously there will be an opportunity for people to see an outcome We're currently engaging with stakeholders in the review of ASB legislation, including with colleagues across other departments, to gather evidence and discuss what changes, if any, should be made to the legislation. Non-legislative measures, however, are also currently being considered, and any structures to allow for partnership and collaborative working. It is a PFG commitment to review ASB legislation, and we do have a momentum for that, heavily influenced, I have to say, by disorder in the Holy Lands linked to on-street drinking. We undertook in April 2018, the DOJ undertook a public consultation on this. The response was published in December 2019, and since the publication of that response document, we are now taking this forward in terms of how we're going to gather evidence and share that. First meeting of the delivery group to progress the work was held in July, a second meeting in August, and there are plans in place for monthly meetings. Any legislative change spanning across a number of departments is unlikely to be commenced within this mandate. However, as I've said, there is an opportunity for us to take this work through in terms of non-legislative measures, and an update on the work will be with the Justice Committee in the new year.
I call Pat Sheehan.
Last week, Minister, your department published a summary of the consultation responses to the sentencing policy review. I'm just wondering, could the Minister outline her next steps and how soon she thinks this can be turned into an action plan?
Well, first of all, I want to thank and put on record my appreciation of everyone who responded to that consultation. We often hear debate about sentencing structures and so on. It's hugely important that when people get the opportunity to give us their feedback, they do that. I think what was stark for me, certainly in reviewing the consultation document, were the number of responses, particularly around road traffic deaths. And I think that was largely as a result of the incredible campaign by Jemma Dolan's parents in order to focus attention on that element of the consultation. But throughout that consultation, we have had some very, I think, thought-provoking responses, and I think there will be an opportunity for us to take that forward. I'm currently considering those responses. We will then move on to see whether there are changes which need to be made in terms of the sentencing framework, or whether there are other issues that are non-legislative that can be taken forward in the interim to ensure that people feel that the time and energy which they invested in the consultation is repaid in terms of outturn.
Pat Sheehan, supplementary.
Thank the Minister for her answer. I'm just wondering, given that there were a number of issues not included in the consultation in regard to sentencing, such as drugs and car theft, does the Minister believe that the issues dealt with regarding sentencing in the consultation go far enough to address the lack of public confidence in sentencing policy?
Well, I would say a couple of things in response to that. First of all, what the sentencing review didn't do was indicate that there was a lack of confidence in sentencing policy. There is sometimes a lack of understanding of sentencing policy, and I think that needs to be addressed as much by members of this House when they communicate sentencing, to understand the detail of the sentences and how they're arrived at. And I've been on a steep learning curve myself with respect to sentencing over the last 8 months. I think it is hugely important when we come to the sentencing review that we look not only to those issues which were covered in the sentencing review, but also to other issues which may be raised as we take this forward when it comes to, for example, legislation. Others may want to feed in, including members of this House, and they will have ample opportunity to do so through the Justice Committee or indeed to me directly.
Call Morris Bradley.
Speaker, can I ask the Minister, would she agree that the PSNI's current 101 reporting system needs an urgent overhaul?
The operation of the 101 system is a matter which is operational and one for the Chief Constable and the Policing Board to take forward. It wouldn't be appropriate for me to comment on that.
Supplementary, Morris Bradley.
Mr. Speaker, the reason I ask is because I get regular complaints from constituents who feel like criminals when they try to report an incident, especially an incident that has a sensitive nature. And also they feel that some of the operators that answer the calls they hang up because geographically they don't know where the complainant is speaking about. So it is I think, an urgent matter that needs to be addressed. Thank you.
Mr. Speaker, I would be more than happy if the member wants to write to me to pass that concern to the Chief Constable for him to look at in due course.
I could take Catherine Kelly for a very short period of time.
Minister, the Justice Committee is due to conclude the committee stage of the Domestic Abuse and Family Proceedings Bill in the next fortnight. Can you indicate a timeline for completing the passage of this legislation?
Well, first of all, I want to say again my thanks to the Justice Committee. This was a weighty piece of legislation, and there have, I think, been some significant improvements to it through the committee system, which is why I believe that scrutiny is so important. In terms of taking this forward, I will be meeting with the Chair and Deputy Chair shortly, not just to look at the scheduling of this particular piece of legislation in terms of its consideration and further consideration stage, but also in terms of other legislation which we hope to introduce into the Assembly over the autumn. It is also, of course, a matter for this House through the Speaker to schedule the business. So perhaps, having heard your plea for us to do this quickly, Mr. Speaker, will be minded to accommodate.
And unfortunately, time is up, so we can't explore that matter any further at the moment. Okay, members could go ahead, Mr. Nesbitt. Point of order.
The Justice Minister, when I asked her about conversations with the Secretary of State, said I didn't know what conversations she had had because I hadn't asked that question. Hansard for the 22nd of September makes clear that I asked her what steps she was taking to address this issue. So I did ask the question because having a conversation is taking a step.
Okay, the members made a point and I will review Hansard in due course. Very briefly, please. Minister.
Mr. Speaker, I don't believe that having a conversation is taking action. I believe that having a conversation and exploring the issues is not a step towards action. It is simply that, a conversation. I was not asked, did I have any conversations?
Okay, remarks noted. Thank you very much. Could members take their ease, please, until we prepare the chamber?
Order, members. The next item of business is a motion to approve a statutory rule. Before I ask the clerk to read the motion, I want to say two things. Firstly, on a personal note, can I thank all the members of this House who contacted me during my recent illness. It was very much appreciated. I want to put on the Hansard as well my appreciation to the member for South Antrim in ordering me to the hospital to ensure that I got the necessary medical treatment. Secondly, the statutory rule that we're about to consider relates to the opening of soft play areas. If you want to talk about Funky Monkeys at Dundonald, that's fine. You want to talk about Coco's in Newcastle, that's grand. If you want to have a general discussion about coronavirus and how the government is handling it, not so good. So can I ask members to please direct their comments to the content of the statutory rule? I ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions No. 2, Amendment No. 3, Regulations Northern Ireland 2020 be approved.
Thank you. I call Junior Minister Kearney to move the motion.
Éireann go Cian and Runachor Conkin, I beg to move.
Thank you. The Business Committee has agreed there should be no time limit on this debate, and I call the Junior Minister to open the debate on the motions. Minister.
Thank you, Mr Principal Deputy Speaker, and may I just note your opening remarks. I think they're very timely and very appropriate in relation to offering guidance to the progress of the debate. But the motion before the Assembly today relates to Amendment number 3 of the Health Protection Coronavirus Restrictions number 2 regulations. And if you'll recall, the number 2 regulations were made on the 23rd of July. These revoked and replaced the original health protection regulations, including all the previous amendments that were made to them. The number 2 regulations require the closure of certain businesses, services and premises listed in the schedule, except for limited permitted uses. Prior to the motion before us today, the number 2 regulations have been subject to a number of amendments, some of which have already been led through the Assembly by the Health Minister. The first amendment to the number 2 regulations were made on the 7th of August. These allowed certain venues to reopen under specified circumstances, including theatres or concert halls for rehearsals or live recordings without an audience. However, nightclubs, conference halls, conference facilities and soft play areas remain subject to closure. Amendment number 3, which is the specific and singular focus of this debate today, removes soft play areas from those businesses, service providers and premises subject to closure, and has allowed them to reopen on the 14th of September. The decision to exempt soft play areas from closure was agreed on the basis of the most up-to-date medical and scientific evidence at the time, and on the stipulation that all relevant public health guidance and mitigating measures were implemented in advance of reopening. The Executive considered that the reopening of soft play areas would provide the balance in retaining livelihoods within this sector whilst improving family life. It is hoped by restoring a sense of normality for children, as well as providing them with a controlled space to develop their social skills, that this will help to increase their well-being. This amendment followed the reopening of other key spaces for children that was catered for in the original revisions to the regulations in July 2020. And this included summer schemes and playgrounds. The decision to reopen soft play areas came into effect over 3 weeks ago, and much has changed since then. Ní mór dúin ar machnú a dheanú ar an rúna atás ar góir, mar gheall ar na cúrsaí ratha is déanaí. Caithfear an cóhacs ratha a bheith we scrúdú aginne a gcónaí. Therefore, I do think it's important to consider the motion before us in context with recent developments. As has been repeatedly emphasised in these debates, we need to take account of context at all times, and levels of community transmission, continuous scientific analysis and due regard for societal and economic recovery are all relevant to the context within which decisions need to be understood and agreed. Over the last week, in the context of stable testing, there has been a marked increase in new positive cases, along with a progressive rise in COVID-19 hospital patients, which are now close to 25% of peak levels during Wave 1. R is clearly above 1, both for new cases and hospital admissions, and has been for a number of weeks. The First Minister made a statement to the Assembly last Tuesday, and since then there has been a further increase in the daily number of people tested positive. Yesterday the number was 616. Today that number is 669. Unfortunately, there has also been further deaths, bringing the death toll to 585. Yesterday, there were 64 COVID patients in hospitals across the north. Today, there are 85 and 13 in intensive care. The current numbers of confirmed cases in the south of Ireland is 38,549. Throughout Ireland, a total of 53,908 confirmed cases have now been recorded. To date, 2,395 deaths have been caused by the virus throughout the island. From the outset, the behaviour and pathway of the pandemic has been similar across Ireland. However, levels of community transmission and confirmed cases of infection in the north have remained as a factor of that island-wide pattern. That, however, has now changed. Ta ahrú allmhór an inis agus ta cuasaí a golanolcas ó hui. Notwithstanding the deteriorating situation in the south, it is deeply alarming to note that relative to per head of population, the levels of community transmission and infection in this jurisdiction now exceed that what is happening in the south. Our power-sharing executive have discussed this new disturbing context. It is recognised by every single minister that we have entered a new and dangerous phase of this health emergency. All of our executive ministers from all of our 5 main parties are agreed that this changing situation requires us to reset our regional government's approach to tackling COVID-19 in the coming period. Evidence we have from the Test, Trace and Protect programme tells us that a significant number of COVID cases are being acquired through household contacts and informal interactions within the community. In response to this, further restrictions have been imposed on gatherings in domestic settings, initially on a postcode basis and then extended to all households. These were brought into effect through Amendment 4 to the No. 2 regulations. Restrictions imposed on indoor venues were then extended to outdoor venues through Amendment No. 6 on the 28th of September. Members will also be aware of the restricted opening hours for hospitality venues. A closing time of 11 p.m. has been applied to the hospitality sector with effect from last Thursday. These measures were brought into effect through Amendment No. 7 to the regulations on the 1st of October and will be debated by the Assembly shortly, Mr. Principal Deputy Speaker. And most recently, additional restrictions have been placed on those who live and work in the Derry City and Strabane Council area. None of these decisions have been taken lightly, and they have been based on the latest scientific evidence and advice. But the escalating situation in the Donegal, Derry City and Strabane Council areas gives us all great cause for concern. While attending the North-South Ministerial Council sectoral meeting on health last Friday, I emphasised the need to ensure that all of the required capacities were available in this sub-region of the island in terms of testing, PPE, ICU and bed capacity. It reinforces the need for increased North-South coordination and indeed a two-island approach. Janan and Aimen is goal nisrienta shaw reachtanach agus an ord agus an agar. Ní mór doin féinniu, le trá and fandéim shaw a haru. The Executive considers those particular measures to be necessary and proportionate. We must now act to curb the transmission of the virus. And let me reassure all members today, they will only be in place as long as it is considered necessary. Once it is safe to do, the restrictions will be eased in line with advice from our Chief Medical Officer and our Chief Scientific Advisor. All of this shows that the landscape today is quite different from when this amendment on soft play areas was made. For example, on the 10th of September, when the Executive made this decision, 599 individuals had tested positive in the last 7 days. Yesterday, this figure was 3,630, an increase, Mr. Principal Deputy Speaker, of over 500%. Therefore, in recognition of these challenges for soft play areas, the Executive published guidance on the 28th of September, and this guidance informed the owners and operators of the ongoing legal restrictions and requirements. It also offered advice for businesses, including the steps that they can take to reopen and operate in a manner that minimises the risks of transmission. We encourage all soft play areas to consider this guidance and advice carefully and to be particularly vigilant at this time. Mr. Principal Deputy Speaker, this is a challenging time for us all. All Executive Ministers from our 5 main parties are agreed on the need for increased unity of purpose and integrated modes of working. The danger of this new unfolding context should not be underestimated. We will have to rely upon new levels of community and political resilience in the time ahead, and that will place new demands upon all levels of government. As political representatives from all parties, we will each need to be focused on what actually matters regarding our fight back against COVID-19 within the Assembly chamber, within our scrutiny committees, at executive meetings, and in separate working structures with our partner agencies. In the coming weeks and months, we will all have to play our role in a whole of government and whole of society effort in helping to suppress the virus. But we've demonstrated before that we can do it. Ní neart go cur le chéile. And I'm confident, Mr Principal Deputy Speaker, that we will do so again. Mulla man rún agus na réala had done channel. I commend the regulations to the Assembly.
Mr Allister, point of order.
In light of your opening remarks, Principal Deputy Speaker, indicating that members would be restricted in their comments, in light of that, and now in light of the fact that 8 of the 10 minutes of the Junior Minister's speech would have been on any construction in breach of that ruling, can you now revisit it and advise the House that we all will have the same latitude in context in regard to these regulations?
Yes. I call Mr Doug Beattie.
Thank you, Mr Speaker. I rise on behalf of the Committee for the Executive Office. There has been much debate about amendments to the COVID-19 regulations and the impact the easing of restrictions has on the R rate. And more recently, we've seen the introduction of tougher restrictions in an effort to bring the R rate down and maximise public health. The committee has discussed issues around the lifting of restrictions, but it doesn't have the responsibility for scrutinising the legislation. That statutory responsibility for that lies with the Health Committee, and I'm sure the Chair will provide detailed commentary in due course. In summary, the Committee for the Executive Office welcomes the lifting of restrictions when the time is right, but encourages, in the strongest terms, compliance with those restrictions that remain in place to help in the fight against the spread of the virus. Mr Speaker, if I could now make a few comments as an Ulster Unionist Party MLA. COVID-19 remains unpredictable. The very reason I'm having to give this statement here now instead of the chair of the committee is because of COVID, and he is self-isolating. So that just shows you that it is in every single walk of life, and I wish Colin all the very best. But there are some within our society who are simply not taking it seriously. Like the proverbial drunk driver, they will do nothing until there is a fatality. And when they have the fatality, it is far too late. We talk about the easing of restrictions, as we are now, in soft play areas. And we do ease those restrictions, and it's important to ease some of those restrictions. Soft play areas are not just about for places for children to socialise with other children. It aids physical and mental development and the well-being as they mature. Soft play areas such that as Peter Pan's in Portadown are amongst the most comprehensive and safe ways for kids to develop. So it's right that we look to see how we can open up places like soft play areas. But at the same time, we do have to impose restrictions in areas such as Derry and Strabane Council area. It isn't complicated. We just need to understand what is happening in this COVID environment that we live in. Mr Speaker, I've said this before. We can unpick these regulations every day of the week by picking a scenario and developing that scenario so it will unpick the regulations, but that helps absolutely nobody. The reality being, if we don't start to adhere to the legislation and the guidance here in 2020, we're going to be still talking about it in 2021. And nobody wants to see that. Enforcement is a tool, but increasingly we're going to have to look at enforcement as a tool to make sure that people adhere to the guidance and the legislation. And I see that some ministers have stepped up to the mark and they have put their names forward and they've forced through those unpopular enforcement measures. Some ministers have carried away and hidden from it. The measure is simple. The message is simple. Wash your hands, keep your distance, wear a mask, adhere to the guidance, and let's get out of this COVID environment so we don't have to be talking about it in 2021. Thank you.
Thank you. I call Mr. Colin Gildernew.
Goramagat, Frew last Can Corlia. Cheater Rishmuj Imwin Gisparacta, Fuina Shrenta Awelu, Eganur Awelian Nanini, Ian Fibeha, Egmedu, Agushrenta Elu Awelu. Mr. Deputy Speaker, Principal Deputy Speaker, once again we find ourselves debating relaxations to restrictions at a time when sadly infections are rising and further restrictions are actively under discussion. The Health Committee considered this statutory rule on the 24th of September and we were advised that the rule amends current regulations by removing soft play areas from businesses, service providers and premises required to close. The briefing and discussion addressed both this rule and another which is to come before the House at a later date. While the committee did not raise any specific concerns in relation to this rule and agreed to support its confirmation, the focus of discussion remained, as it has for some months, on the clarity, communication, rationale and data underpinning the overall approach to restrictions and their relaxation. Tá coiste Imwin County go fáil leis an éire agus iartha agin an sonreacht fan fuaine sé tíomh hir de Caoimhe sna réalacha reachtuile ag teacht cont'd. The committee remains in dialogue with the Minister and is seeking to obtain more detail on the evidence base underpinning the decisions reflected in the statutory rules coming forward. I would add that the committee has had and continues to have regular briefings from the Minister and is seeking to play a constructive role, scrutinising the pandemic response while promoting adherence to the regulations and guidance and helping to assist communication of changes to the rules. And if I may, Frew last Can Corlia, I'd like to make a few remarks just as in my role as Sinn Féin spokesperson for health. And I think it is notable today that the Minister has set out some of the impacts that this has had. And I have to say, it makes me angry when I see people on street corners extolling people to not take this seriously, to not abide by regulations, that it's all some kind of a conspiracy. And I think that is extremely dangerous. It essentially encourages young people to take a chance and exhorts older and vulnerable people to take themselves and take themselves out of society in order to protect themselves. And those are not approaches that we can. So I would ask the public to continue to abide by these restrictions. I recognise they are difficult, they are onerous, they're not to be taken lightly, and we as a committee do not approve of them lightly. It's because they're necessary to deal with this pandemic. Fuiero a Can Corlia, Tame Kinche, J. Go Newhy, Shina Duplarliact, Le Forsa Ibri, Adulang, Gulior, Akata Avas, Eglias Jack, or Anubber and Shaw, Go Kion Nashaktana, Amak Rowing. In closing, I'm sure colleagues in this House will join me in expressing our solidarity with the workforce that has endured so much but is now buckling down to help us to meet the challenge in the coming weeks as this virus is now spreading and circulating. And I would ask everyone to consider all of those frontline health and social care workers and their protection, as well as protecting themselves and protecting each other.
Thank you. I call Ms Pam Cameron.
Thank you, Mr Principal Deputy Speaker, and it's good to have you back in the hot seat there today. And be in no doubt if you need another lift to hospital and told what to do, I'll be there for you. I should just add, I did wear my mask when I took him in the car because we couldn't have a social distance. Anyway, thank you, Mr Principal Deputy Speaker. And obviously this rule today amends the Health Protection Coronavirus Restrictions No. 2 Regulations Northern Ireland 2020 by removing soft play areas from businesses, service providers and premises subject to closure. And we are, of course, all aware that and having to debate these regulations as they come before the House after events have already taken place, and it's well documented as to why this is the case, and because of the nature of the emergency health regulations. We do find ourselves in a very concerning situation, however, and I'm sure all of us shared the shock expressed by the Health Minister when we heard daily case toll of almost 1,000 positive COVID-19 tests in a single day in very recent days. The vast majority of people across Northern Ireland have sacrificed so much in the last 6 months to curtail this virus, yet we find ourselves now in a position that, quite frankly, is alarming. The restrictions introduced to indoor gatherings, outdoor gatherings and a range of other areas are necessary. It is not a choice, it is a necessity. If we are able to control the spread of the virus and protect our elderly and vulnerable, it is simply the right thing to do to stop the wrong thing happening, which is lost lives. Mr. Principal Deputy Speaker, we have more localised restrictions, and I want to commend those in those particular areas for their adherence to these measures. Personal sacrifice for the greater good has been the action of a majority, and we thank them for this. I welcome that the soft play areas have opened for all, and for all the good reasons outlined by Junior Minister Kearney today. But Mr. Principal Deputy Speaker, we still have that minority who think that they are above the regulations and the guidance, that their interests trump all else. And I must say that the pictures that have emanated in recent weeks, more than once from the activities of the GAA, is quite simply scandalous. In Dungannon and Ballachy, we have seen the sacrifice of many of the people there being mocked by crowds at games and in the post-match celebrations. And this is wrong. And yes, the GAA are to be commended for their very charitable role in responding to the need of the community, and I'm very happy to acknowledge that today. But this good work does not excuse the blatant flaunting of life-saving rules and regulations. And I'm glad to see that the GAA are now taking some action in regard to those regulation breaches. We do hear much about leadership, Mr. Principal Deputy Speaker, and I would like to hear from the leadership of Sinn Féin that these activities are wrong and condemn them. But then you cannot condemn people for what you do yourself. And the Deputy First Minister and those members opposite sent out a message, unfortunately, that these restrictions could be ignored, that nobody would tell them what to do or how to behave. Today we see the consequences of their actions, with the daily positive case count rising. Let me take this opportunity yet again to highlight that hands, face, space, and we all know it, but we still need to be told it. Washing and sanitising our hands regularly, covering the face where social distancing is difficult or not able to happen, and keeping that space from others. These are the most basic measures that can allow life to continue in a pandemic, and if we do not follow these simple measures, we will see our health service overwhelmed and put our healthcare workers at an unbearable strain while they do their absolute best to take care of us all. Let's stop this selfish nonsense of knowing more than scientists and health experts. We must find a way to allow our children to have their education, for businesses to survive. Mr. Principal Deputy Speaker, we have that power within us to do what is right. We all have that individual responsibility to set an example and to adhere to and to promote these rules, to call out wrongdoing, regardless of where it comes from. And the next weeks and months will see more families broken-hearted, more families added to that 585 who have already been affected to date. Let us all commit to doing what we can to make sure as few as possible families have to go through this trauma. Thank you.
Thank you. Mr McNulty is not in his place, so I'll call his colleague, Ms Sinead McLaughlin.
Thank you, Mr Principal Deputy Speaker, and thank you, Minister, for your statement today. And it is important that I say that we appreciate the seriousness of the situation that we currently find ourselves in. But it's really important that our communication is right. So we're today discussing the relaxation of some regulations while we are imposing harsher regulations in other areas and other places within Northern Ireland. And I appreciate that this is a tightrope and a very, very balancing act here, that we're trying to protect lives and livelihoods. But it's not clear messaging coming out from this assembly, trying to get the public to adhere to the regulations when we're giving mixed messages. That's all. Thank you.
I call Ms Paula Bradshaw.
Thank you, Principal Deputy Speaker. I rise to support the regulations as amended. I do so with some considerable concern, but I would put on record the hardship that many of the business owners of the soft play areas went through in the months when they were closed. We all received emails from them, and it was disappointing that they were given an open date and then it was rescinded, and I can understand the thinking behind it, but I do know a lot of them really felt the pressure, especially in terms of maintaining their staff. When the amendment came into operation on the 11th of September, the trend was just beginning to show an uptick in confirmed cases of the virus. 3 weeks later, the situation is transformed for the worst. Part of the reason for this continues to be the utterly confused messaging, as Sinead has just also mentioned there, sent out by the regulations themselves. Mr. Principal Deputy Speaker, I do not think that we have learned the lessons from the last debate here on these regulations. There remains considerable, if not more, confusion over what the various regulations mean and how they apply, and also about what they are supposed to achieve. Rightly or wrongly, it is a simple fact that if people do not understand why they are doing something, they are less likely to comply. As I said then, we are aiming for voluntary compliance, but the truth is often we are not getting it. That lack of compliance is often tied to the wrong turnings of the Executive Office and Department of Health in terms of how they have taken forward and put out the messaging and communication. As a result, less than 2 weeks after pubs opened, we now have a rearguard action with pleas being made for people not to socially mix. Yet the very point of pubs is to enable people to socially mix. So what does this say? Even within the last fortnight, therefore, the fact is the Executive Office and Department of Health were taking action which would inevitably increase social mixing. Yet now we are telling people not to do so. This is not what the trends are telling us in terms of the rates of cases. I warned last time we were debating these regulations that a confused message would get a confused response, and that is what happened. Even on days where 1,000 people were testing positive for the virus, people are packing into indoor venues. It is a nonsense. Mr. Principal Deputy Speaker, turning now to contact tracing. In order to set out effective regulation, we need to know how the virus is behaving. I'm extremely concerned that contact tracing appears to be understaffed, that people are not being contacted for days after they need to be, and that frankly we are not getting enough understanding about the virus. 2 weeks ago, the First and Deputy First Minister confidently told us household transmissions were the big issue. Yet on Sunday, the Chief Scientific Advisor painted a rather different picture, one in which clearly socially mixing in hospitality venues plays a role, but also one in which he had to admit we do not know the origin of many infections. If we do not know, we have no option but to go off evidence from elsewhere and basic common sense. Social mixing spreads this virus. So why are we so determined to open up places where purpose is to encourage social mixing? This is a basic failure of public policy. It is not evidence-based. And I think that we need more information out in the public domain as to how the Executive are making these decisions. So, Principal Deputy Speaker, as I said last time, communication is about creating understanding. Compliance will be easier, and indeed enforcement will be easier if the rules are simple, understandable and enforceable. If our concern is that people should not be socially mixing, then let us put in place regulations and guidance which make that clear. Clearly, consistently and coherently. If we do not want social mixing, do not open venues which exist purely to provide it. If we think face coverings are important, they should be compulsory at all indoor venues, except perhaps when eating or where tables are appropriately distanced, or when we're exercising at appropriately distanced equipment. In conclusion, I said last time that I thought there was still goodwill to the executive out there, but ongoing missteps mean the public is rapidly losing confidence. As a result, even as case numbers have spiralled out of control, life has gone on almost as normal, even with queues to get into pubs and shops. With regard to these regulations and the guidance around them, we still need to communicate better, with less confusion and more clarity, to achieve our own stated objective of less social mixing, to ensure the trends around the spread of the virus are reversed and that our health service does not become a COVID service, as my colleague Pat Sheehan mentioned at the Health Committee recently. We also need to accept where we've got it wrong and take necessary steps to fix it. We have a small window of opportunity. Thank you.
Before I call the next speaker, given that the, I hope you'll not be offended by me saying it, given that the Junior Minister took a bit of a liberty and went beyond the confines of soft play areas, I allowed Ms Bradshaw to do the same. She referred to contact tracing. I don't think that the Junior Minister at any point in his statement referred to contact tracing. I may be wrong on that, and if I am, I apologise. Can we at least try to comment on the content, wide as it was? Can we at least try to comment on the content of the Minister's statement? I call Mr Pat Sheehan.
Frew, and first of all, could I welcome you back into the Speaker's chair? Your wit and humour has been missed during your absence, so welcome back. And well, I can assure you I'm being very sincere, and I hope you remain in good health in the time ahead. I raised to speak in support of the regulations as amended. They deal with the reopening of soft play centres, and this is a relaxation measure of what previously was quite draconian legislation, and all of us have been here many times now dealing with these regulations, and most of us will agree that the regulations have been draconian but necessary all the same in terms of trying to get to grips with this pandemic. And in many ways, the regulations are like part of a contract. We ask the people to abide by these regulations, and in return, they expect us to keep them safe. And we ask them to adhere to social distancing, to wash their hands, and all of those other measures like wearing masks and so on. And in turn, they expect us, in response to accepting these draconian regulations, that we will do our best to keep them safe. So, I know the Speaker said not to move into the area of testing and tracing, and I don't want to move in there, but I think it is part of the contract that we have with the regulations and the system that is in place to keep people safe, that the testing and tracing is essential to keeping people safe. And there are difficulties with it at the minute. We saw a letter this morning from 13 senior medics from different hospitals who say that the testing and tracing system needs fixed. We saw difficulties across the water yesterday, 16,000 people who weren't traced because of some technical malfunction. And these are difficulties that we have to get over if we're going to do our best, all of us as political leaders, to try and keep people safe. So there's a contract there. We're asking the public to sign up to that contract, to be a party to it, and we also have to carry out our part of the contract. So I'll finish there. A Frew last Corner.
Thank you. I call Mrs Martina Anderson.
Caoimhe Archibald, can I also welcome you back? We've missed you at the committee meetings, and I hope you stay well. It's going to be difficult to discuss this and not widen it out, and I appreciate the fact that you're going to allow us to at least respond, and I will try my best to fit what I want to say into the response from the Junior Minister. I think the amendment to the health protection COVID regulation that we're dealing with today Obviously, we all know that some of these regulations now have been superseded by further restrictions, which I know that the Assembly will deal with at a later date. Removing the soft play subject to closure, officials are confirming that despite those added restrictions to places like Derry and Strabane, that they can still remain open with appropriate precaution, because I was concerned that when we would be sending out a signal today that we had removed soft play, that if that wasn't the case, for instance, for Derry and Strabane, that they would get very confused. People that operate those facilities, they had been confused over the weekend. They were contacting us, they didn't know whether they could stay open or not. So I think it's important to note that the officials have confirmed that they're still operating in the same way, and that message needs to be heard across the area, across Derry and Strabane. This motion, as the Minister has said, was addressing a rate of COVID spread that was concerning at the time. And when I listened to the figures that was being read out, 599, and then today 3,630. So we can see how alarming it is, and that all these restrictions are absolutely vital to address this deadly virus and try to get it under control. In my own constituency, and that has been referred to, of Foyle, but Derry and Strabane, the council area, from last Tuesday to this Tuesday, 876 people have COVID-19. And can I say that at the time when this regulation was being brought in, I knew no one in my constituency who had COVID-19. I would say to you there's probably very few people in Derry and Strabane that don't know someone who has COVID-19, or at least know people who are self-isolating. Such is the alarming rate. There's not a day that goes by that someone tells me a name of a person that I know. When the first wave, when we were all discussing it and we were dealing at the time of its height, I knew no one. Up to the end, there was one person in the city that I knew. So I think that people are clearly getting the message, and I know the ministers have said so today, and they've said so in the past, that we are the host of this virus. We are the carriers of this deadly virus, and it is spreading at an alarming rate. Now, thankfully, like Derry and Strabane, like many areas across the north, we have got a fantastic community infrastructure. And that includes even the offering that's been made from soft play and elsewhere. But we have got a community and voluntary sector with people in it that have gone beyond the call of duty. And they will do so again. And I believe that we will get this out of control. When I was listening to the Minister and the figures that he was giving us, and I suppose like everyone here, our hearts were sore at the first wave, particularly as we were dealing with those vulnerable people in care homes. And we were all running around ragged at times trying to secure PPE for them and trying to get people protected. Today, when we hear that there are 31 of our care homes are battling to try to stop the spread of this further, we also know that carers, and they have been mentioned too, those workers in those care homes, those people that are working. And can I say that there's an issue that maybe soft evidence, we're talking about soft play, it's not scientific, it's subjective evidence that there are some people I know in my own constituency who are agency workers, who are carers, and they don't qualify for any kind of financial support. Say, for instance, if they're self-isolating, they don't even qualify for statutory sick pay because they're agency workers. And they can be going from one care home to another because that's their job, and then from one house to another because that's their job. But, the fact is they might have to feel that they've decided to carry on. So if we're talking about trying to curb the spread of this deadly virus, as we are now in the middle of this second wave, we need to be mindful of the implications that that's having on workers. I know that we've also mentioned, and there are people who are recently self-employed. There are people in terms of soft play who are recently self-employed. They have facilities that, at the time when they were closed down, and they weren't able to get any financial assistance. And we know that we've had many people across this chamber from different political parties have raised this issues. That I spoke to one small business owner over the weekend, and he's running on empty. And, he is saying that he heard the economy minister tell him that he fell through the cracks, and he received nothing from the hardship fund, he received nothing from the 2 grants. Those who were recently self-employed and those people who are operating soft play facilities and others have been struggling throughout this pandemic. So we need to keep in mind that when we're putting these restrictions in place, that the financial package that would be coming forward to deal with some of these facilities that had recently opened, some of the pubs that had spent a clear fortune for them when they didn't really have it to try to reopen, and now they're having to obviously close again. Thankfully, soft play, we're being told, but they have to do so and make sure they're following all the precautions, are not closing. But we know that people are struggling at this moment in time. But I think as a community, Derry and Strabane is probably no different to any other community. A community of people who will look out for one another, who will go beyond the call of duty to make sure that we get this virus under control. And when the Minister was talking about the figures of those people who are infected, we know now that there are 89, I believe, people in hospital, 13 on ICU. So some of our hospitals, and I want to talk about the hospital in my own constituency, thankfully a fantastic hospital, Givan. And Givan, I brought here an issue to the Minister of Health about a man, for instance, separately to all of this is going on, had waited 5 years for a hip replacement, and he got an apology, still waiting. But the orthopaedic ward closing because of having to, they believe, repurpose it because of COVID. And I'm concerned about the disruption that this is going to have to services across our hospitals. So whilst it's hard just to focus, Chair, on the issue of soft play, given the figures that the Minister gave us today, 53,908 across this island being affected, I think that's an alarming figure. That people, if they haven't heard that before, need to hear more of that kind of language coming from yourselves so that it resonates on. Unfortunately, we know across the north and maybe further, there are campaigns, they may be small in number, but they're out there with people called anti-mask campaigns, people telling us this is all a conspiracy. The World Health Organization is filling our heads full of sweetie mice, that this isn't happening. This is serious. This is real. We all now know somebody, either in our families, our neighbours, our communities, and so we all need to collectively work together. I believe we can, but unfortunately I don't think that this is the end of the conversation that we'll be having about restrictions if we don't get a grip and get this under control. So thank you for the latitude that you've given us all today. I really do appreciate it.
Thank you. Mr. Matthew O'Toole.
Thank you, Mr. Principal Deputy Speaker, and like others, welcome you back to your place. It's good to see. Like others, I welcome the fact that this regulation is being changed. It feels slightly surreal to be talking about it, I suppose, up front. Before we get on to the more serious matters, I should declare an interest. As the father of a 3-year-old, I have a very specific interest in soft play facilities being open, as I'm sure other parents of young children do. I had lots of correspondence from soft play owners and operators who welcomed this clarity when the regulation was changed, and I'm sure indeed, as I alluded to, like myself, other parents who were welcoming of the fact that these facilities with specific sanitary and health measures were able to reopen. Having said that, and reflecting on the latitude that you've allowed us, Mr. Principal Deputy Speaker, the specific regulation change that we're talking about today feels almost quaint and tiny, frankly, in relation to the seriousness of the statistics that are coming at us now every day in relation to new infections, and now not just new infections but increased hospitalisations. Martina Anderson, I think, referred to the increase in the number of people hospitalised. If I've read it correctly, today's figures, I think, went from 60, early 60s until either 85 or 89. I think it was an increase of nearly a third. So in the last 24 hours, the number of people hospitalised with COVID-19 in Northern Ireland has increased by about a third. If I've got that correct, and if I haven't, I apologise to members of the Assembly. But if I have, that's extremely serious. That's an extremely worrying increase, and it reflects clearly a shift in the pattern of this virus in the second wave. We are not now in a lag period where increased socialisation is happening and therefore infections are increasing. We're probably in the second phase where we've had a few weeks of increased socialisation and infections increasing. We are now seeing the medical impact of that as relates to increased hospitalisations. It is, I'm afraid, therefore inevitable that the next step in the weeks to come will be an increased number of deaths. That's unavoidable. That is almost an arithmetical fact on the basis of the increase in infections and the increase in hospitalisations. It is true, notwithstanding some of the surreal remarks coming out from the White House, it is true that medical professionals are better equipped now in terms of their understanding of this virus. There is a little more knowledge in terms of treatment. There is also, I'm glad to say, I welcome what we heard this morning from the Health Minister in terms of preparedness around getting the Nightingale facilities back up and running. That now seems like an inevitability, but I welcome much of what he said in terms of increased capacity in the health service and also increased procurement of ventilators and PPE, which are, in a sense, two different parts of the NHS response to this virus, but the increased procurement of both ventilators and PPE over the past few months. But it is clear that we are, in the coming weeks, entering in, or have already entered, as I've said, a very, very serious phase of this crisis. The difficulty is, and I think it's been reflected a little in the debate today, because every single member who has got up and spoken has spoken out of complete sincerity and seriousness about their constituents and about this place and about the public health response. But it is also clear that there is a deficit in clarity around policy making for this jurisdiction. I don't say that to score points against either of the ministers here, the parties they represent, or indeed the executive as a whole. My party is a participant, it's a five-party executive, as the junior minister said. I agree with that. This is one for all of us. But it is true that this is going to be a uniquely difficult challenge for the executive. Uniquely difficult for two reasons. First, the first part of this COVID crisis involved, in a sense, a very clear sense of purpose, a very clear message that had to be communicated to people in this society, and not just this society, but societies everywhere. Stay at home, lock down, limit your contacts. And yes, while we're saying those things now, we're saying them with caveats, and we're saying them with a degree of shade as it were. Now, it's also true that some of that shade is necessary. So I'm not going to stand up here today and say that we should lock down tomorrow. I don't think that is a response that that I couldn't stand over that recommendation as a public representative. But nor can I say that I'm anything other than deeply concerned about the path of the virus and the fact that large parts of our society are not just open as before, but there does appear to be, as others have said, a real challenge around observance to the current best practice, not just the restrictions and the regulations, but current best practice around mask wearing and social distancing. So that's the first part. That's the first challenge that the executive faces, which is that the first phase of COVID was more straightforward. It's more straightforward to tell people just don't leave the house, other than for a little bit of exercise or to get your shopping. That's a challenge that all jurisdictions face, and it's one that they're going to have to navigate. And the best way of navigating it will be getting everybody at this assembly, certainly everyone who's a public representative, and in the wider community on board with the reasons for the fact that the guidance remains more complicated than it was in March. What I mean by that is, if we aren't locking down, if we are going to continue to have a more tailored, localised lockdown approach, we need to know the executive's working out. We need to understand the rationale for decisions. Members of the public are not members of the public. The vast majority of them want to follow the regulations. They want to keep their family and their neighbours safe. The best way of ensuring that they do that is treating them with a degree of seriousness and respect and explaining to them why certain restrictions are the way they are. And that includes, for example, explaining to them why certain restrictions haven't been imposed, for example, on some businesses or licensed premises or restaurants or hospitality venues. And if the reason for that is that the executive has made a decision to balance a pure public health response or a pure COVID limitation response with broader economic aims, that's not necessarily an illegitimate aim. But it has to be explained to people, and it has to be explained why that balance has been struck and how those decisions have been made. One of the junior ministers has his head in his hands. I have no doubt he is thinking about this every day and probably having to think about these balances. But that's the first challenge. The second challenge is, I'm afraid, one that's particularly distinct to this place, and that is the fact that the unique nature of the way we are set up, both geographically, jurisdictionally, and in a sense culturally, societally, is that we look both east-west and north-south. We take our cues politically from other jurisdictions, and that's not just necessarily a dysfunctional thing. It's a natural thing. We share landmass with the rest of Ireland. We have called consistently for an all-island approach to managing this virus. I still think that is completely critical. I welcome lots of what I heard from the Health Minister today around that. We need to see collaboration on that front. But it's also true that we need to see very clear east-west collaboration, not just because our economies are interlinked and there continues to be significant degrees of transit between Great Britain and Northern Ireland, but also because, frankly, we will need to ensure that our public health response, our economic response, is tied in to the funding package that we are getting from Whitehall and the economic response the UK government is willing to make. We are, like it or not, bound into that structure, as the Finance Minister himself said today. So our north-south, east-west preoccupation, if you like, in this place isn't irrational. It's necessary. It's a necessary and critical part of us managing the holistic policy and public health response to this virus. But we've got a challenge there too, because in those jurisdictions, they're finding it harder to be as consistent, unified and clear about their own approach to this virus as they were earlier in this year. We saw what happened in the south in the last 24 hours around NFET and the Chief Medical Officer and the difference in emphasis, to put it diplomatically, between the medical advisors and ministers in the south. We're also seeing in Britain many and significant challenges around the UK government's response to this virus, not least their misuse of Excel, or an official's misuse of Excel in the last day or two, but not just the Whitehall response to it. Frankly, we're seeing today, we saw several of the metropolitan mayors in the north of England issue complaints about the way what are called local lockdowns are working in their jurisdictions, Liverpool, Manchester and elsewhere. They clearly want to manage the virus, keep the virus as low as possible in their jurisdictions, but they're raising particular questions about how these lockdowns are working in their areas. I don't have the answer to any of that stuff, and it would be deeply disingenuous for me to stand here today and say, well, this is exactly what should happen, this is exactly the path that we need to follow. I'll admit, and I think it's been frankly implicit in what most of colleagues here today have said, we're entering into really complicated, genuinely uncharted territories in terms of the trade-offs that we are having to manage in the weeks and months ahead. We need absolutely to ensure, first of all, that the public health guidance is being followed to the absolute maximum. That's the thing we have the most control over, that people, citizens in our society, are absolutely clear about the steps they need to take within whatever the regulations are, whatever premises are open or closed, whatever the exact regulations are at any given moment. They need to be taking personal responsibility first and foremost. And bluntly, yes, it's clear that many people in various parts of our society haven't been doing that over the last few weeks and months. So if there's anything, if there's one thing we do have control over, it's how we message clearly to the public. But my overarching message to come back to is, because of the two specific, there are two specific but interlinked challenges. This executive faces a very, very difficult period ahead in terms of both deciding on the correct policy response to the frankly chilling increase in infections in our society, but also in managing that on both a north-south and an east-west basis, and then most critically of all, communicating it in the most clear, consistent and transparent way possible to members of the public. And let me just linger, Mr. Principal Deputy Speaker, I've taken up enough of the Assembly's time, but let me just linger on that final point, transparency. We can't pretend to our citizens that these are easy choices. And in a sense, if we do pretend that they're easy choices, we risk them not following the guidance. We risk them not believing us because they can't understand how we've done our working out, how the executive has done its working out. So I suppose my final plea is that as the executive makes these considerations about how we proceed in the days and weeks ahead, be absolutely clear in your public messaging, because that is the best way of taking our society with us as we proceed through these next very difficult few weeks and months.
Mr. Jim Allister.
Thank you, Principal Deputy Speaker. I'm sure, Principal Deputy Speaker, all the warm words about welcoming you back may have caused you to think you didn't know you were as popular, but savour the moment. I suspect it.
It's been a long time from the members had a moment like that.
Indeed. We're undoubtedly discussing a very serious issue, and COVID has, in all sorts of unpredictable ways, reached every corner of our society. And nothing I say today minimises the threat of COVID. And indeed, I'm conscious, not having stood in the shoes of those who have suffered from COVID, one needs to be cautious about what one says going forward. But I will, in the course of these remarks, raise some issues about where we are going in tackling this pandemic. But before I get there, I think it is important to say that whereas the Executive understandably makes plaintive pleas to people to do the right thing, and I echo those, we all should act with the utmost responsibility. We should follow the public health guidance. We shouldn't take it lightly. But I think an abiding problem for this Executive in its messaging is typified by the very presentation of this debate today. This motion is moved by a junior minister who himself does not come to this issue with clean hands, so to speak, because when it came to the test of this junior minister on that critical issue of the executive living by its own laws, this junior minister failed that test, because this junior minister was a participant in the most flagrant breach of those regulations, attending the Story funeral, at a time when the regulations said that people who were not family, etc., should not even be there. So when, therefore, you bring a debate to a house such as this, hoping that the public are listening and heeding, and the presenter of that debate is one who himself, with his colleagues, thought himself above the very laws that he speaks to, then there is a fundamental credibility problem. And the same applies to the member for Foyle, Miss Anderson, who was very prominent in that flagrant breaching of the law, and who indeed, at or about that time, was tweeting exultantly about wakes and all sorts of things. What sort of example, what sort of leadership has been set? And that, until the day comes when ministers and members who put themselves in that position unequivocally, with no weasel words, apologise to the public that they exhort to follow the rules, for themselves not following the rules, by attending that funeral, etc. Until that day comes, this executive is beset with a credibility issue on these regulations. That's the reality. Some might like to duck and dive and pretend otherwise. That is the reality. And maybe it's no surprise that when political leaders set that example, then other organisations, never mind individuals, think that they too can be above the law. And we've seen that with some of the GAA gatherings, which Mrs. Cameron referred to, where for 3 successive Sundays we saw breaches of the social distancing and all of that. Yesterday we had a statement from the GAA acknowledging difficulties, saying they were going to cancel club matches. But they haven't cancelled inter-county matches. And if what I read today is correct, then it's still anticipated that up to 400 people can be at matches such as that. So organisations too have the obligation to give leadership. And I do question if it has been there with the depth and sincerity that it needs to be. But the question I have to ask about all these regulations is, where are we going with them? Is all the action we are taking about delaying COVID? Or is it about defeating COVID? And if it's about defeating COVID, then should there not be a role amongst the fit and the healthy to allow immunity to grow? Because if every time the virus raises its ugly head, our response is shut things down, then how do we ever get off this roundabout? How do we ever get to the point, unless the virus obliges us by dying out, or unless a vaccine is found, which seems some way off, then we are, by this course of action, constantly saying the only answer we have is when the virus rises, we close down. Now, is that the sum and substance of the strategy? Because some other countries, there's been much reference to Sweden, have maybe shown that there is another way. That immunity, now it's disparagingly called herd immunity, but community immunity amongst the fit and the healthy may be an approach that's going to have to be considered. Because I do not see how, bearing in mind the economic consequences and the mental health consequences, how we go on indefinitely simply repeating the same answer, which isn't an answer. So I do question, where are we going in terms of our approach to this? What is the strategy? Do we not need to get to the point where we very severely ring-fence those who evidently are vulnerable, but allow the rest of society to largely get on with their lives in the expectation and hope that that will create rising community immunity? But this attitude that, oh, there's a rise in the number of cases, not a great rise in the number of deaths, happily, not a great rise in the number of intensive care patients, happily, but a big rise in the number of cases. So our proportionality is restrictions proportionate to the number of cases, not to the number of deaths. And then we say, so we must be severe in our clampdown. As the cases rise, we must come down on the community in their movements. And never, by that strategy, create an exit strategy for how we're going to get out of this situation. So I do say to the executive, I think there has to be a bit wider thinking on this about where exactly we are going. Now, there will be mistakes made. That's an inevitability in handling something like this. And you do need a safety net and a capacity to quickly probably take counter measures. But I think there needs to be in mind a strategy which is more than, let's just keep reacting to the rise in the number of cases. Because if we keep doing that, Mr. Principal Deputy Speaker, when are we ever going to get out of this? That's my question.
Thank you. No other members indicated to me that they wish to speak in this debate, so I now call upon the Junior Minister Gordon Lyons to conclude and wind up the debate on the motion. Junior Minister Lyons.
Thank you very much, Mr. Principal Deputy Speaker, and can I join with other members in welcoming you back to your place and wishing you good health for the future. Can I also welcome today's debate and thank members for the contributions that they have made. As we are all acutely aware, COVID-19 is having an impact not only on our health, but it's also having a significant societal and economic impact too. The Executive's response to the crisis has always been aimed at delivering a balanced and proportionate package of measures across all these areas. We bring in restrictions only when necessary and relax them as soon as they are no longer required. The reopening of soft play areas on the 14th of September is evidence of this, and the guidance published on the Executive's website provides owners with a blueprint for opening in a safe and controlled manner, taking into consideration the protection of both staff and customers. The recent restrictions put in place across domestic settings, hospitality closing times, and in the Londonderry and Strabane area remind us of the stark position that we find ourselves in. It's important to remember that the increase in the number of confirmed positive cases is not just because more tests are taking place. As the Health Minister and the CMO have said, the increase we see in confirmed cases is because the transmission rate has increased and is continuing to increase. The positive case numbers are of serious concern to the Executive, and I know that they are also of concern to all parts of our society, including individuals, families and businesses. If this rate of increase is allowed to continue, it will inevitably lead to an increase in hospital admissions and deaths, and we must do everything we can to minimise this. I would now like to turn to some of the comments that have been made by members today. I'm going to try and touch on most of the issues, but particularly those that are most pertinent to the regulations that are in front of us today. First of all, the Vice Chair of the Executive Office Committee spoke, and I wasn't aware that Mr McGrath had to self-isolate, so certainly we want to send our best wishes to him and to his family at this time. However, in filling in for Mr McGrath, Mr Beattie rightly identifies the benefits of improved well-being by having soft play areas open and available to our society. But of course we must use them safely and in accordance with the published guidance. And it is important to emphasise when the member mentions about enforcement. And enforcement alone isn't going to tackle the issues that we have in front of us, although enforcement is important and will become increasingly important as we get beyond the explain and encourage stage. But we all need to work in partnership with one another as well, and by following those core public health messages. And I thank him for his contribution. Colin Gildernew and Paula Bradshaw both raised issues in relation to the evidence base, and scientific evidence is provided to the Executive, and the decision about publication and when it should take place is a matter for the Executive as a whole. Departments submit proposals for relaxation to the Department of Health, and this will include their own supporting evidence, such as reports by various bodies and submissions by stakeholders. This information is then reviewed by the CMO and the CSA, who have access to information from SAGE, the Government Advisory Group, and other groups from across the UK, Republic of Ireland and internationally. And then a professional assessment is made around that, including where the country is in the pandemic and the R rate as well. I also want to pick up on the comments that have been made by Mrs Cameron, and also congratulate her for her heroic role in making sure that we still have our principal Deputy Speaker with us today. But she also recognised the important role that our NHS staff have played in this pandemic thus far. And it is important, of course, that we take these actions and that we obey the regulations that are here in front of us so that we can protect them as well. We're at a critical phase in the pandemic, and so it is important that we all are making sure that we're playing our part to help suppress the virus. Sinead McLaughlin made a number of comments in relation to communication. I wholeheartedly agree with her, and I think it was Mr O'Toole that had mentioned the fact that it was very easy at the start of the pandemic because it was a very simple message. Everything's closed down. Of course, it's a lot more difficult now, and I do agree with the member that communication is key in regards to that. And as an executive, we've certainly tried to get that information out as quickly as possible. I hope that the member, along with other members from the Foyle and West Tyrone constituencies, appreciated the fact that as executive ministers we did take that opportunity last week to try and explain the reasoning behind some of the restrictions that were coming in, and we hope to keep members updated in that sort of format in the future. And I think it's already been recognised as well that the Executive Office have increased their written statements to this House as well to explain the reasoning behind some of the things that we have been doing. So I appreciate her comments on those. There was a number of comments again from Mr. Sheehan in relation to the test and trace, and Ms Bradshaw also commented on those. I'll not go into those any further, but I'm sure the member knows that they have been placed on the record, and I think that's what he was trying to do rather than get an answer from me. Ms Anderson made a number of comments, and it is of course absolutely right that there is the schemes that are going to be introduced for businesses that are going to have to endure these additional restrictions. Obviously there's still the job retention scheme in place as well, and she had also mentioned the increasing infection rates. And I think that reminds us that the threat from COVID-19 is still here. It is still a problem, and it is something that needs to be dealt with, which is why we, as an executive, will take appropriate and proportionate action when it is necessary. Mr O'Toole had already touched on the issue that he had raised in relation to the difficulties that we're facing now compared to where we were before. And of course we are making these policy decisions in a very difficult environment. And he's absolutely right that we need to balance economic and societal needs along with the pressing health needs that are there as well. And I do think it's important that we put on record and we recognise the costs that have come, that we've seen already from lockdown. And I do want to emphasise that we do not take these decisions lightly. And we will not take any decisions lightly, because we understand, and any MLA who's in touch with their constituency and their constituents at all will understand the effects that the period of lockdown had on our constituents. I think of children, special needs children that I know that have missed out on speech and language therapy, on carers coming in, on music therapy and play therapy and physiotherapy, and the developmental opportunities that they have missed out on. We're all aware of the effect that it has had on older people in terms of isolation, and the sad stories that we have heard of older people in nursing homes who have not been able to see their family, and the effect that that's had on their mental health. And obviously the effects of mental health on the wider population as well during these periods of restrictions. We know about the effect that domestic violence has had over this period, and the period of lockdown gave opportunity for abusers to have more control, and I think a lot of charities were recording the highest volume of calls on record over that period. We also know, and Mrs Cameron frequently raises this in debates as well, the impact that it has had on physical health, non-COVID related. GPs and dentists and other healthcare providers often pick up on greater issues that a person might have with their health, and we need to be wary of that. We need to also think about the effect that it's had in terms of education of our children when the schools weren't open. We have to think of things like funerals when people have not had the proper opportunity to grieve as they previously would. We need to think of all of these issues, and that's before we even touch on the issue of the economy and of jobs and of the people who have struggled during this time, and some of the people who have not got the help that they would have liked. And we need to take into consideration the fact that unemployment and poverty also cost lives and has a detrimental impact on our society. So all of these issues around restrictions and lockdown come with a cost. We're aware of that. Some of those costs are quantifiable, but many of them are not, which is why we need to ensure that we're taking everything into consideration and only taking actions which are proportionate. And Mr O'Toole is right that we do need to balance the issues around COVID with those economic and societal issues as well. Mr O'Toole also mentioned a number of issues around surge planning, and I believe obviously that the Minister for Health will have addressed those earlier on today as well. I fully appreciate the sincerity with which Mr Allister approached the debate today. There has been a concerning rise in the number of cases, and there's often a lag in terms of hospitalisations, hospital admissions and deaths. and we don't know the full impact of those at this time. We also have to take into consideration the fact that we have already brought in further restrictions around household gatherings. And this Chief Scientific Advisor has informed us, I think it's 44% of COVID cases can be traced back to settings within the household. And I hope that because of the actions that we took, first of all in Ballymena and then in Belfast and then later across Northern Ireland, that we'll start to see the result of that, and hopefully we'll see a reduction in cases, and we won't see the increase in deaths and hospital admissions. I appreciate that he is saying there are different approaches that can be taken, and I can assure the member that our advisors look at data from all over the world, including the examples that he has given. But the Chief Medical Officer has said to us that what is the ultimate goal? The ultimate goal here is a vaccine, that we can get immunity built up that way through a vaccine, but that these steps may be required in the short term to keep that rate of transmission down. Mr. Principal Deputy Speaker, for those members whose points I've not addressed, I'm sure they will be picked up on, and that the Department will respond in writing in the days ahead. But I would like to conclude with these remarks, and just want to say that we appreciate that this is a difficult time for everyone, and more restrictions are not what any of us want. And I know that people are sick and tired of them. I'm sick and tired of them. I'm sure we all are, and we long for life to go back to normal. The temptation is to think that we are already there and then to act accordingly, but that would be wrong. As always, we must continue to be extremely careful in all aspects of our lives, particularly as we think of those in our community who are vulnerable. And it is vital that everyone continues to follow the consistent public health messaging, and that business owners and that members of the public adhere to the advice and the measures that are put in place. And I would encourage us all to play our part, to maintain social distancing, to maintain good hand and respiratory hygiene, to wear face coverings, to self-isolate immediately if we experience any symptoms, including a new persistent cough, a fever, or a loss of change of smell or taste. We need to seek a test if we experience any of these symptoms. We need to download the Stop COVID NI app, and we need to comply with the restrictions that are in place. I know, Mr. Principal Deputy Speaker, this is a difficult time for all of us, and it has been a very difficult few months for many different people, and there have been lots of grim warnings about what comes next. I think I would just like to place on record the fact that we will one day be beyond COVID. We will get to the other side of this, and it is important that we have some hope and that we give some hope for the future. However, we can all make sure that we get there quicker and that we can stop additional sickness and hospitalisations by following the regulations that have been placed before us, and I commend them to the Assembly. Thank you.
Thank you. The question is that the Health Protection Coronavirus Restrictions No. 2, Amendment No. 3 Regulations Northern Ireland 2020 be approved. As many as are of that opinion say aye. Aye. Contrary, if any? I think the ayes have it. The ayes have it. Members will take their ease for a few moments just to allow change at the top table. Thank you.
Order members, the next item in the order paper is a motion on the impact of COVID-19 restrictions on workers and on the economy. I'll ask the clerk to read the motion, please.
That this Assembly recognises the profound impact of COVID-19 restrictions on workers and the economy. Notes projections that more than 100,000 people in Northern Ireland could be unemployed by the end of 2020. Further notes with regret that many businesses are excluded from current support schemes. Notes the positive impact of wage subsidy programmes as a critical lifeline to small businesses and those struggling to make ends meet. Expresses regret that the Minister for the Economy has not produced a COVID-19 recovery strategy that provides support to workers and businesses asked to restrict their trading capacity, and calls on the Minister for the Economy to work with the Minister of Finance to bring forward a radical economic intervention programme that supports wages, creates pathways for those who have lost their jobs to re-enter the labour market, promotes new jobs and closes regional imbalances.
I call Sinead McLaughlin to formally move the motion.
I so move.
Thank you. The Business Committee has agreed to allow up to 1 hour and 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose and a further 10 minutes to wind. All other speakers will have 5 minutes. I now invite you to open the debate on the motion.
Thank you, Mr. Speaker. We're living through and trying to guide our communities and local businesses through one of the most challenging public health and economic crises in living memory. This is not an easy time for any of us, least of all for those workers and businesses whose livelihoods hang in the balance. But I also want to acknowledge that these are not easy times to be a minister. We haven't experienced a challenge like this before, so it's inevitable that the executive won't get everything right. Our ministers are human, and like all of us, they make mistakes. But in the current environment, mistakes will inevitably have exaggerated impacts, so it's important that they remain open to constructive feedback, and that is the basis on which we approach this debate this afternoon. Rishi Sunak got it right with the furlough scheme, but he got it wrong with its replacement, the job support scheme. The result is that more than 100,000 people in Northern Ireland are likely to lose their jobs. Across the UK, this could transpire into 2 million people becoming redundant. So we all have sympathy with those ministers who have to take tough decisions in a demanding environment. That doesn't mean we can ignore the sense that the Department for the Economy appears to be rudderless, a bit like a small boat tossed around in a gale, not certain what shore or port it will end up in. The Department must do two things at once: navigate through this crisis while preparing for when the crisis is over, and I'm not confident that it's fit for that purpose. First, let us consider the immediate challenge. There are people in all our communities who are deeply distressed about the impact of the COVID crisis will have on their family, the security of their job, the health of their loved ones. How many people have called each of our offices in absolute despair because they don't know how they'll provide for themselves and or their children? How many have called deeply and justifiably angry because they don't see government digging deep to help in their moment of need? Too many businesses, self-employed workers and others have not received the security of a support scheme to give them the confidence that they'll make it through in the coming months. Let us consider those groups from the various support schemes that have been excluded: the newly self-employed, those who are self-employed but trade as a company, the low-paid casual workers, businesses who share premises, social enterprises, the arts, freelance artists have all been particularly badly hit, with support coming very late for some and not at all for others. About 10,000 small businesses in Northern Ireland have been excluded from support. And remember that Northern Ireland, much more than Great Britain, is an economy of small and micro businesses. Yet we find that according to an estimate from the Audit Office, around £13.5 million has been paid out from the Small Business Grant Scheme in error. Moreover, around £65 million has been underspent within the Hardship Fund. That is a lot of money, around £80 million in total, that could have gone right into the right hands. My office has had terrible stories of hardship and distress, from childminders right through to individual consultants, hairdressers, etc., as I'm sure all members of this House have. So what is the solution? We have to rescue what we can, re-evaluating our support schemes, making sure that they are fair and properly administered, particularly in the light of the latest restrictions imposed on communities and businesses, and particularly in my own constituency in the North West. And I make this impassioned plea here today for support for businesses in Derry and Strabane that have had to freeze their operations, not because of their actions, but because of our decisions and impact of the virus. At the same time as we support businesses in need, we must build a new economy as part of a new society. We need long-term recovery as well as short-term rescue. At the end of this crisis, we will have the same challenges that we had before the crisis. If the problem hasn't changed, the solution hasn't changed either, as John Hume used to say repeatedly. So we offer our solution. The SDLP have laid down our 4 principles for the economic recovery of the North. A new deal for our young people, providing them with skills and opportunities as we emerge from our economic crisis. A new localism, rewarding those businesses that have helped us survive in this crisis. New infrastructure to build our way out of recovery into recovery. And new powers for the Northern Ireland institutions to enable us to raise funds needed to invest into that recovery. The underlying problem facing the North are infrastructure, skills, productivity and the inequality that lies at the very heart of our society. On infrastructure, that means obviously roads, rail and water, and these are public services. But it also means doing what we can to promote the private sector investment into infrastructure. We need to speed up our rollout of the higher speed broadband that will assist rural areas. We need to accelerate spending on the electricity grid. If we can get construction work going and moving quickly on broadband and on the north-south electricity connector, this can assist on new jobs. This is equally true with major road building, which Minister Mallon has recognised with the fast-tracking of the work on the A6. Indeed, Minister Mallon's team of infrastructure experts have turned round their review of infrastructure provision in just 6 weeks, a great example of how quickly Stormont and its work can proceed when leadership is shown. And we must also invest in carbon infrastructure, kick-starting the Green New Deal. Our neighbours are about to spend massive sums on retrofitting homes to reduce carbon emissions and to home heating costs. We need to do the same, while scaling up our commitment to zero emissions energy sources into electric and hydrogen vehicles, carbon capture and large battery technologies. And then we have skills. And here I will congratulate Minister Dodds. She has done exactly what the SDLP has called for, allocating additional funds into apprenticeships and college vocational training. So well done, Minister. But we have also need to boost investment in training adults who have jobs, both those workers who may lose their jobs in the coming weeks and also those who we hope are safe in their jobs. We have to improve skills and improve the use of knowledge in order to raise that productivity. We also must do very much more to tackle imbalances in our economy. We have to raise the skills and aspirations of people living in our very poorest communities. That divide is unacceptable, yet for some reason our society has accepted it. And so it reoccurs generation after generation. To change this, we must ensure that our schools, our preschool support, our careers guidance and our skills training systems provide ways to enable people to advance into better and better paid jobs. Let us remember the joint commitments made in the New Decade New Approach to focus on creating good jobs, protecting workers' rights with security of employment. Yet we have heard very little from Minister Dobbs about any long-term vision. If we don't know where we want to get to, we are much more likely to get lost along the way. My fear is the sat-nav destination has not yet been set. The terrible truth is that many of the jobs that our society relied on before this crisis will no longer exist when the crisis ends. So we must do all we can to create the new generation of well-paid jobs that emerge as we reshape society and the economy after this crisis is over. Mr Deputy Speaker, this executive does not have a programme for government. This executive does not have an economic strategy. This executive does not have a skills strategy. This executive does not have an energy strategy. And this executive has no agreement on infrastructure priorities. Mr Deputy Speaker, this cannot go on. Finally, Mr Speaker, I call on the Minister of the Economy to work with the Minister of Finance to plan for long-term recovery and together with all government departments to bring forward a radical economic intervention programme that supports wages, creates pathways for those made unemployed to re-enter the labour market, promotes new jobs and closes regional imbalances. It is at a time of crisis when you have to take the opportunity to build back better. This comes down to leadership. I move the resolution.
I call Gordon Dunn.
Deputy Speaker, and no doubt the global pandemic that has had a profound impact on our economy and employees right across Northern Ireland. It is important to recognise the very significant amount of financial support that has been delivered to businesses, contrary to what we've just heard, with the various local funding schemes initiated by our Economy Minister through her department, complementing the various financial support measures from our UK Government. The recently announced job support scheme for the successor to the furlough scheme is designed to support viable jobs and businesses, which will unfortunately face lower than usual demand over the winter and will need more time to recover. The extension of the Self-Employed Income Support Scheme until April 2021 is another welcome commitment from the Chancellor, and it must be acknowledged the value of being within our great United Kingdom through such a challenging time within our history. All these measures have been a real lifeline to thousands of businesses and employees right across Northern Ireland, in every town, village and in our rural areas. Many sectors of our local economy continue to face huge challenges, including those within tourism, hospitality and the retail sectors, to name a few. We are in a different space to where we were in March and April, and that is why future support must be strategic, targeted and have a positive and sustainable economic impact. The Economy Minister very much recognises this, and the Rebuilding a Stronger Economy medium-term recovery plan, published in June, rightly prioritises decisive interventions to sustain and rebuild our economy over the next 12 to 18 months. The two new support schemes the Minister launched in early September, the £1 million digital selling capability grant to help retailers and wholesalers generate business online, and the £5 million equity investment fund targeted at early stage and seed stage SMEs, are examples of strategic support to sustain and develop economic activity, providing much needed support for upskilling and developing online activity and marketing. The aerospace sector is another example of a sector facing major challenges globally. There must be a UK-wide solution, and I know my party colleagues in Westminster and the Minister have pressed the UK Government extensively on the need for a sector-specific fund to sustain and develop our aerospace sector, which is such a valuable direct local employer, with Bombardier employing around 3,000 staff and many others involved in the supply chain. Yesterday's announcement from the Economy Minister of a £4.6 million investment to fund 3,000 online training places for people whose employment has been disrupted by the pandemic is exactly the sort of positive targeted financial support scheme we need. These courses focusing on digital skills will be delivered by our local colleges and universities and do complement the recently announced apprenticeship recovery package. We must recognise the work and commitment of our local businesses, who have continued to work through the challenging past 7 months, many of whom have diversified and adapted their businesses. I was pleased recently to welcome the Minister along to two such local businesses in North Down in Bangor. The Denroy Group, who have been manufacturing visors and reusable masks, are working indeed with the health service to future supply them with much-needed PPE. Whilst Priory Press, a local packaging firm, are investing £1 million in new machinery to grow the business into new markets. While we were down on the shop floor of these manufacturing businesses, it was a reminder that the people out there are continuing to work very hard to keep their businesses running throughout the COVID crisis. Resources are limited, and we must be prudent and strategic with the interventions we make and continue to get the balance right between protecting the health of our people whilst prioritising our local economy. Thank you, Mr. Deputy Speaker.
I call Caoimhe Archibald.
And I welcome the opportunity to speak to this motion today. And as I said yesterday in the debate on the Internal Market Bill, I'm very mindful that as we speak here today, there are businesses and workers who have faced very difficult circumstances over the past number of months and who continue to face uncertainty about the future, particularly so in the context of the additional restrictions introduced in Derry and Strabane Council area and the rising cases across the island and in Britain, which may see further restrictions required. We are all very aware that the health of our people and our economy are interlinked and that decisions have deep and long-term impacts. For that reason, I find it unjustifiable that the British Government is ending the furlough scheme at the end of this month. The replacement job support scheme will not be adequate to protect those jobs, and there will be thousands of redundancies, which makes the support to protect those jobs to date seem somewhat futile. The furlough scheme is a necessary support for those sectors that as yet cannot return to work or that have to close again if restrictions are reimposed. The Economy Committee has written to the British Chancellor expressing our concerns in relation to the removal of that vital support, and I know the Finance Minister has also raised concerns on behalf of the Executive and sought clarifications and has requested an urgent meeting with the Chancellor to discuss the emerging picture of additional restrictions. Because in the context of further restrictions, additional support for the Executive will be necessary to help support businesses, protect jobs and support workers. We do not have the fiscal or borrowing powers to put in place the types of supports needed. Lascan Corlia, I do believe we need to see an economic recovery strategy with definitive objectives for the short, medium and longer term, supported by actions that will achieve them. I believe there is space for us to do things differently, to build on the experiences we've had throughout the pandemic of alternative ways of working that give people flexibilities to have better work-life balance and to begin to redress regional imbalances through, for example, the development of regional hubs for working. In the midst of the health crisis we still face and the economic crisis which continues to grow, the climate emergency remains a dominant threat. Therefore, we need to realise the commitment of a Green New Deal from New Decade, New Approach as part of any recovery strategy. Green skills development and infrastructure projects can be central to supporting young people gain skills and jobs, and those who have been made unemployed gain new skills and get back to work. These are all things that can and should be incorporated into our economic recovery strategy. Sinn Féin's economic recovery strategy that we published in June incorporated these things across 4 priorities, focused on supporting workers and their families, supporting businesses to create and sustain employment, delivering on a just transition and giving the Executive the tools to aid recovery. In my opinion, a recovery strategy must look to the type of economy and society we want, and I'm not convinced that those economic recovery documents brought forward so far by the Economy Minister and Department have the ambition supported by actions necessary to address the historic and structural difficulties in our local economy. It's my belief that such a strategy also requires a cross-executive approach involving other departments, particularly those such as infrastructure, DAERA and communities. Indeed, the proposer of the motion mentioned infrastructure projects as part of the recovery, and therefore I believe this motion should be directed wider. Skills, training and employability programmes are going to be central to the recovery also, to enable people to reskill and upskill and as has been mentioned by other speakers, some positive steps have been made in that respect. We also need entrepreneur supports to encourage new business development. And in saying that, Last Concordia, I have to reflect on another point in the motion about those who have been excluded from the supports to date, those who have been left behind and fallen through the cracks of other supports, our newly self-employed and sole traders, small manufacturers, some childcare providers. We need to give businesses and individuals the confidence to know that we won't simply reap the economic benefits of their innovation and labour in the good times, but that we will also support them through the bad times. So I would urge the Minister once again to look at how supports can be made available to those groups that remain excluded. I am supportive of us looking forward to the type of recovery we want, and I recognise what the Minister said yesterday in response to my question about supporting businesses to build their capacity. However, for many, survival remains their current and only focus at this time. Therefore, I would urge the Minister to look at how the allocations for recovery funding can be best utilised here and now to support businesses that were viable before COVID, help them to get through this winter and give them a chance to continue to operate and recover and to support jobs and workers into the future. Gurmugget.
I call John Stewart.
Thank you very much, Deputy Speaker, and I thank the member for Foyle for bringing this motion here today and recognise her experience in her previous life in the terms that she did and the expertise that she brings and the knowledge that she brings to this discussion. Mr Deputy Speaker, just even talking about the figure of 100,000 job losses is frightening. That's 100,000 families, 4 or 5 people per family, a quarter of our population potentially affected by this, and it is impossible to understate the gravity impact that will have. BBC reported today that economists are predicting an 11% contraction in the Northern Ireland economy, with an estimated growth of only 7% next year. And we in the Economy Committee heard recently that it could take 4 or 5 years to see a return to pre-COVID levels within our economy. Like I say, I think the motion and the proposer of the motion for bringing this forward today, and I think the Minister should see it for what it is, and hopefully not seen as political point scoring or a way to attack in any way. But I think we all, for the most of us anyway, want to see and play a constructive role in contributing to the economy and making sure we can feed into a process whereby the economy can grow and we can save as many jobs and make as many businesses flourish as possible. The motion rightly refers to those business owners and businesses that have to date been unable to avail of any support grants so far, and it is regrettable that 3 weeks on, even after a unanimous motion in this House, that we're still not seeing anything coming forward, and I do hope that the Minister is working with her colleagues. Yep.
Would the member agree that it is important that nobody in the community should be left to feel that they have fallen through the net in relation to receiving financial assistance from the Executive?
I think
members, an extra minute.
Thank you. I think that is exactly the key. We hear of so many examples coming to our offices of people who have battled and borrowed and done whatever they can to survive, clinging on, hoping that support would come. And it is lamentable that we are so far down the line and they still haven't been able to access that. But I truly hope that support is coming. The proposer rightly points out the vital life-saving support that's come from the Treasury to date, whether that's the self-employment scheme or the furlough scheme. They have been undoubtedly essential in saving off massive job losses. And like others have said, I do lament at the fact that maybe that scheme has ended too soon, and that it's perhaps a penny-wise and pound-foolish decision to cut off the furlough scheme immediately, not even just supporting those industries that maybe can't get back to work. But I think it does unfairly within the motion calling the Minister and her department to replace that funding. As has been said by the Chair of the Economy Committee, those vast billions of pounds are simply not within the coffers of this Executive, and it is important that we recognise just that level of intervention that has come from Her Majesty's Treasury to support that up. That being said, there is a great deal that the Department of Economy can and should be doing, and it does refer in the motion to the need to provide immediate support for those areas and businesses. Yep, certainly.
The member clearly stated that it's not his intention to score political points. Absolutely accept that. Even a basic understanding of how the finances of this place work would demonstrate that line in that motion, demanding that the Minister undertake action that the people moving the motion know she physically, even if she wanted to, physically cannot do, is blatant point scoring.
Thank the member. As I say, hopefully that support can continue to come. What I don't want to see is a reactionary process to this, but preparation. We do know that other lockdowns and other measures, whether they be circuit breakers, are coming down the road, and we need to be prepared as an executive, as a department, to have those shovel-ready schemes that can be rolled out very quickly to act as a buffer for those businesses between success or survival and failure, and that is essential. Mr Speaker, or Deputy Speaker, when questioned about the lack of economic recovery or when challenged about the progress to date, the Minister will point to the economic building a stronger economy in medium-term recovery, and I know one of the members referred to that. And I've been pointed to it, and other members earlier in the week have been pointed to it by the Minister, and it has three key headlines: delivering higher paid jobs, a highly skilled workforce and a more regionally balanced economy. And who could argue with any of those? I think that they are key cornerstones to anything. But it's nothing new. 2011, they were the three key cornerstones: new jobs, more skills, regional balance, 2016 programme for the government, an exact copy and paste. And if this is what we're working off for economic development right now, it's 9 pages. It looks like an A-level project. There's nothing in it. It's just words. We want to get here. It would be nice if we could do this. There's no substance. I've looked at it. I've looked at the Scottish model. Economic Recovery Implementation Plan, 60 pages long, published as a second piece of document. It's for the next 20 years. Everything is in there, whether it's the social economy, SMEs, the third sector, it is all there. Why are we so far behind? When you check the business plan from the Department of Economy for COVID-19 response, March 2021, we will deliver a similar scheme by. Why are we so far behind? And look, I hope I'm wrong. I hope that I am just complaining futilely and that the plans are there. But it really does worry me that we are this far down the line. March 2021 is a year on from when the lockdown began, and that's whenever the department is looking at that. So I'll finish by saying this. As I say, I hope I'm wrong. I really hope that the Economy Department and the Minister has got this nailed, and that I'm just standing here waxing lyrical for no reason. But I'm terrified for those hundreds of thousands of jobs that we don't have the plans in place, and this is just documents and words, and there's no real structure behind it. Thank you, Deputy Speaker.
I call Andrew Muir.
Thank you very much, Mr Deputy Speaker. I rise to support the motion. The Alliance Party has consistently called for swift and strategic economic responses to the pandemic from both Westminster and Stormont. Many of the actions taken to date are to be welcomed, but with COVID-19 restrictions likely to remain in place for some time, the Minister for the Economy should bring forward a detailed strategy on how best to support businesses through this highly turbulent winter period. What's been published to date in terms of what is said to be a strategy just doesn't cut the mustard. As John Stewart has said, we need real actions, not warm words without meaning. Furthermore, the Finance Minister must continue efforts to obtain the necessary financial powers and flexibility to enable the largest possible economic intervention to support workers and businesses in Northern Ireland. Since the start of March, ministers and civil servants have worked tirelessly to respond to the unprecedented havoc caused by COVID-19. I commend them for their work during these very challenging times. That is not to say that we are uncritical of some aspects of the response. Indeed, as MLAs, it is our duty to speak out on behalf of constituents when ministers and departments fall short. The Alliance Party and my colleague Stuart Dixon in particular will continue to champion the plight of those still excluded from any support to date. We also believe that it is unacceptable that Northern Ireland still does not have a kickstart scheme, a full 3 months after it was announced by the Chancellor. In Great Britain, Kickstart is already operational, but in Northern Ireland we still don't know the details of how our scheme will work, just a hope and aspiration that it will start in November. These are examples where ministers have either been too slow or have failed to respond. To make sure that this does not happen again, Mr Deputy Speaker, the Minister for the Economy should take the actions outlined in the motion, focused first and foremost upon an economic resilience strategy to get us through the winter and to the spring, when we may hopefully, maybe, then look towards a real recovery if a vaccine does appear ready for rollout. Yes.
Member for Givan Way. You rightly point out the need for other schemes that have been rolled out in the rest of the United Kingdom to come here, and that is essential, including that for the supported training and learning package that was rolled out last week for people who haven't got A-level or equivalent. Would you agree with me that it's important that we look at something like what Wales have done? Wales are on phase 3 of their Economic Resilience Fund and have pumped over £1.7 billion into the Welsh economy.
Members, an extra minute. I thank the member for his intervention. I must say, over the last number of months during this pandemic, I've looked at other parts of the United Kingdom and I've looked at the Republic of Ireland and the interventions that they've made, whether it's in Scotland or Wales or down south. And I look at those with real frustration and annoyance to see the measures that other devolved administrations or the Republic of Ireland are bringing forward, but yet we're stuck in a limbo here in Northern Ireland where action is slow or not forthcoming. So I agree with the member that those actions should be taking place here in Northern Ireland. We know a lot more about COVID-19 than we did at the outbreak at the beginning of this year. We have experience of economic interventions. We know what restrictions look like and we know what impact they have. We also know that these restrictions will take place well into 2021. There are some sectors that won't be able to trade normally while the restrictions remain in place. There are also sectors whose trading conditions will change dramatically as restrictions are altered in response to the public health situation, such as in Derry City and Strabane Council area. There are also some sectors, such as the events sector, who cannot trade at all. Knowing this, an economic resilience strategy should outline how the Executive can support each of these, whilst also acknowledging there are many sectors who have proven resilient to COVID-19 and are in fact growing and recruiting. An economic resilience strategy would provide a small amount of much-needed clarity for business owners and employees and enable the focused and effective response that is required. Finally, Mr Deputy Speaker, the motion calls for a radical economic intervention programme. We support such an intervention, but we're also realistic about the level of resources currently available to the Executive. The Minister's ability to act is limited by the block grant, by the Barnett consequentials received to date, and Northern Ireland's inability to borrow for revenue expenditure. Now is exactly the right time for the Executive to borrow to aid in economic intervention. I again back the Minister for Finance in his efforts lobbying the UK Government to this effect, whilst also reiterating the need to ensure that every single penny spent is spent wisely and no monies are surrendered at the end of the financial year. There is no doubt about it that this winter is set to be incredibly challenging for people across Northern Ireland. The Executive must do everything it can to provide the best possible support. We couldn't prepare for the summer disruption. The same is not true of the winter, where the focus must be upon safeguarding both lives and livelihoods. Thank you very much, Mr Deputy Speaker.
I call Gary Middleton.
Thank you, Mr Deputy Speaker, and I welcome the opportunity to speak on this motion and on the impact of COVID-19 restrictions on the economy. Over this past 7 months, we have seen severe impacts within our town and city centres. There's no doubt about that. Many businesses who initially closed for the first lockdown never had a chance to reopen. Many businesses who did reopen have struggled to keep themselves afloat. And of course, the latest restrictions within my own constituency have come as a real bitter blow to those who may have even just opened their doors for a matter of days, yet they've effectively been forced to close them. I do want to put on record my thanks to the Economy Minister for taking the opportunity on Friday, at the earliest opportunity, to meet with business leaders from the hospitality sector, the city centre, the council. A very productive meeting. It's important, I think elected representatives would do well to speak to those business leaders, some of whom haven't. They need to speak to those people and hear their concerns. They have said very clearly to us that, first of all, they see our Minister, Diane Dodds, as a strong advocate at the executive table. They see her as someone who champions the sectors that are particularly affected, and I think that was an encouraging note, and I think it's worth taking note of that as we go forward. Now, that's not to say that there aren't genuine concerns, because there are, and I think that the push at this minute in time to get additional support, particularly for my constituency, is one which I will be advocating along with others as well. We are, however, facing a very concerning situation in that we could be looking at further local lockdowns right across Northern Ireland. So whatever we do, we need to be mindful that interventions that are needed within the Derry and City Strabane Council area may need to be replicated. So we have to bear that in mind as well. We will need to be strategic in how we issue our funds going forward. We need to target support, particularly where it is needed, and particularly with those who are struggling significantly. I welcome the plan that was brought forward by the Minister in June, Rebuilding a Stronger Economy, the medium-term recovery plan. The paper itself focuses on the next 12 to 18 months. It sets out a framework for decisive interventions that deliver higher-paying jobs, skilled and agile workforces, and a more regionally balanced economy. But the paper also highlights some of the challenges and the stark reality that we face. The reality is that the decline in input in Northern Ireland, it is more severe than the rest of the UK. 6 years of labour market progress undone in a month, right? With expectations of redundancies increasing again sharply in the near future, falling retail sales and forecasts, and of course the risks and the economic issues that surround the operation of the Northern Ireland Protocol as well. So these are all concerns that we have to grapple with. The motion states that we need another strategy. Some members have actually compared the number of pages and strategies. But with all due respect, with all the strategies that we have, and the Economy Department has plenty of strategies, what we need to focus on is delivery. And I am confident that this Minister and this party is focused on delivery. The businesses out there and the constituents want delivery. And I think that's where this chamber needs to be focused on. The Minister has rightly been focused on previous occasions in this pandemic in getting money out to businesses as quickly and as efficiently as possible. But we need to ensure going forward that when money goes out, that it's making the most economic impact and the best possible economic impact to ensure that when we come out of this pandemic, that the businesses are still there and that they're able to survive. As we continue to grapple with the unpredictable nature of COVID-19, we need all ministers to step up to the mark and deliver on their own responsibilities. For the SDLP to stand and say what the executive haven't done, the SDLP are part of the executive. Step up to the plate and make these issues known. All parties in this chamber need to come together and stop the party politicking, stop coming into this chamber just to simply have a go with no solutions. People need to come forward with solutions if you have them, and then make that approach known to the executive. So we just need to come together on that point. And just on a final note, Mr. Deputy Speaker, as I say, the motion is there. It's disappointing, maybe the tone that it has taken, but I think all of us would do well to pull together to support the Minister in bringing forward the interventions that are needed and ensure that our communities are able to get through this in the best possible fashion. Thank you, Mr. Deputy Speaker.
I call Jemma Dolan.
Businesses and workers have faced a very difficult few months. It's only been around 7 months since the COVID-19 outbreak began, but it is apparent that the virus will have a devastating impact on economic activity here and, as a result, a detrimental impact on workers and their families. Projections that more than 100,000 people in the north could be unemployed by the end of 2020 fills me with deep concern. The majority of queries, like many MLAs in this chamber, coming into my office is around people applying for the job seekers element of universal credit. But my point is, surely it's more efficient to support workers to stay in work rather than put them through the hardship of being unemployed. Small and micro businesses and their workers are the backbone of our economy. This is not about pouring money into business accounts simply to pay bills. It's about protecting livelihoods and supporting workers and families. And when I talk about supporting workers and families, I'm referring to more than just allocating financial support to those who become unemployed. I'm also talking about those who remain employed but may be working from home and deserve the right to disconnect. Or the new mums who are returning from maternity leave, having been denied many classes and developmental opportunities for their babies in light of COVID-19 closures and restrictions. Or those who have lost loved ones and who require paid bereavement leave. In order to have a fair recovery, we need to see fundamental changes made to our labour market so that workers are truly valued and that they are afforded the necessary rights and entitlements in order to take on a new job or additional hours. The so-called new normal or the Build Back Better cannot just be slogans. They must contain commitments to advance flexible working arrangements as well as maternity and bereavement leave. We have heard about the bids that the Economy Minister made in relation to economic recovery, and there is certainly a need to have an economic recovery strategy that addresses the long-term structural issues in the local economy, including low productivity, by focusing on skills development and strengthening workers' rights, as well as the economic recovery from COVID-19. This is vital to avoid mass redundancies. In June of this year, Sinn Féin published our own economic recovery strategy based on 4 key principles: supporting businesses, delivering on a just transition, giving the executive the tools to aid recovery, and supporting workers and their families. As Sinn Féin spokesperson on workers' rights, I will hone in on that element of our strategy. This focused on tackling the scourge of low pay and in-work poverty across the North. As Sinn Féin MLAs, we are committed to delivering on the New Decade New Approach commitments, including the banning of zero-hour contracts and the executive becoming a living wage employer. Any economic recovery cannot repeat the mistakes of the past, and it must provide decent and secure work. The Minister's economic recovery strategy cites the need to resolve low-paying jobs, yet her strategy only looks at improving productivity in order to do this. She's given no commitments or recognition of the need to end precarious work, which results in low pay. If COVID-19 has taught us this, the very functioning of our society relies on the lowest paid and least valued workers. Lessons must be learned from this. The Minister has failed to recognise the importance of promoting and facilitating greater trade union membership and collective bargaining rights, both of which have been proven to lead to higher wages and greater productivity rates. Workers firmly need security and protection and must not be forced to choose between risking their health or risking their jobs. Caoimhe Archibald.
I call Christopher Stalford.
There's that collective spirit of cooperation that clearly exists in our government being exposed there. At this time last year, no one would have heard of the word COVID-19 or envisaged the damage that such a viral outbreak would have had upon our economy or upon the situation generally in our society. The fact that we're looking at 100,000 job losses, the fact that almost a decade of job creation has been wiped out in a few months demonstrates to us the scale of the challenge that we are facing. It has become a cliché to use the word unprecedented in relation to the situation that we're in, but these are unprecedented times. When I listen to members speaking, I think it's important to try and get back to some first principles. Principle number 1, there is no such thing as government money. These aren't government interventions. It's taxpayers' money. So if we're talking about making massive financial interventions into the economy, the only place that we can go to get that money is the people of this country. And no nation in history has ever taxed itself or borrowed itself into prosperity. No. The way to secure prosperity is to expand and grow the economy. Listening to the previous speaker, I do agree with some of what she said, particularly our sense of what is a key worker has changed. I absolutely accept and agree with that. And I don't just say it because my wife works at B&M on the Craiger Road. The notion of what a key frontline worker is absolutely has changed. And I think that going forward, I hope that those companies who provide those jobs, and I have to say I think B&M are a very good employer, those companies who provide those jobs do reflect that in how they treat their workers. I think the interventions that have been made, as others have said, demonstrate the benefit of Northern Ireland being a part of the United Kingdom. The sheer scale of the economic intervention has been enormous. But as I've said in previous debates on these types of issues, this will have to be paid back. And just as at the end of the Second World War, we finished paying off that about five or 6 years ago. And I'm mindful of the Eat Out to Help Out scheme. I said at the time, pardon? Certainly.
I'm sure the member would accept that in this phase we should be stimulating recovery and we should be focusing on stimulus to create jobs, to create tax income that is going to help us generate that recovery.
I don't disagree with that, although it does have slightly the logic of a man standing in a bucket trying to lift himself up, but that's a different issue. I think that we do have to reflect on the fact that this money, once borrowed, will have to be paid back. And the way in which it will be paid back is in taxation. And as you say, the way in which we get more tax take is to expand the economy. And this brings me to the point. When sometimes Stormont, at the best of times, I suppose Stormont can feel like it's in a parallel universe. Because when you're in debate in this chamber relating to health, people are leading the charge to lock down vast swathes of our economy, vast swathes of our society, and insisting on going back almost to a situation that we had at the start of this. And then we come into an economy debate. And some of those very same people who are leading the charge to get the economy locked down and to get society in general locked down are then criticising the Minister and demanding that she spend more money in terms of economic stimulus and growth. You can't stimulate a shut-down economy. It needs to be opened up. So I think it's for them to square that circle. But I think we can look honestly and say, and again, we're talking about planning for when the pandemic is over. When will it be over? Does anyone have a date? And the criticism is that the Minister isn't ahead of, hasn't got a thing set in place for when the pandemic is over. Given the twists and turns that there have been over the course of the last 7 months, the Minister may not know what her financial position is going to be in 7 weeks and what resources that she has available. And this brings me to the point, this is the concluding point. It's the easiest thing in the world to put down a motion that says, and calls on the Minister for the Economy to work with the Minister for Finance to bring forward a radical economic intervention programme that supports wages. No figures, no budget, no idea in terms of what it's going to look like, just a bland calls on the Minister for the Economy. There are 5 parties in the Executive, and we can all do this. Week in, week out, I could get my colleagues and I can table motions criticising Sinn Féin ministers, or indeed the Minister for Infrastructure. We could all do that, or we could actually start to work together.
I call Emma Rogan.
I think we can all honestly say that that many, if not all, of our households have been affected by the impact of COVID-19. Whether it's been working from home, shielding, isolating, or being made redundant, workers and families are continually having to adjust to the ever-changing circumstances. These workers and families are crying out for radical economic intervention that will make real and lasting improvements to their lives. In June 2020, Sinn Féin published our own economic recovery strategy. We want to see support for workers and their families. We want to see banning of zero-hour contracts and this executive becoming a living wage employer. We want to see support for alternative businesses such as social enterprises and cooperatives. We wish to see commitments to creating sustainable employment and for high quality of jobs to be created. We are also calling for additional support for the creation of new and Indigenous small and medium enterprises, which make up 90% of the businesses across our economy. The ending of long-standing regional imbalances and regional inequalities is also a priority. We want to see our local towns and local villages being enabled to grow and prosper, so residents aren't required to make long commutes and journeys in order to get to work. It's also an ideal time to grow our green economy and create additional well-paid employment. The further expansion of renewable energy can also help to lower costs for families and for businesses. Giving our executive greater control of its financial resources is also essential. The transfer of fiscal powers is necessary in order for us to raise revenue and deliver a fair recovery which will meet the needs of people here. When I look at the Minister's own economic recovery strategy, it misses many of the key objectives. The Minister has made no bids and made no proposal for tackling regional inequalities in terms of job creation or support. The lack of investor visits being scheduled by InvestNI in areas outside of South Belfast is a major issue and one which needs to be addressed in order to deliver an inclusive recovery. In the past, we have seen an over-reliance on InvestNI and foreign direct investment. In my own constituency of South Down, InvestNI has hosted no visits by potential investors in the 3 years from 2016 to 2019. In 2019 alone, 181 visits were hosted in South Belfast. The level of financial assistance offered in South Down was $10 million over 3 years. Whereas in 2019 in South Belfast alone there was $26 million worth of assistance offered. This proves that the Economy Minister, past and present, are oblivious to the potential business development opportunities that exist outside of South Belfast. So while I do express deep regret that the Minister for Economy has not produced a COVID recovery strategy, it is not too late to introduce a radical economic intervention programme which can adequately support the many businesses and communities that have supported us. I urge members to support this motion and for the Economy Minister to enact its objectives.
I call Pat Catney.
Thank you, Mr Deputy Speaker. When COVID hit at the start of the year, we did not know what impact it would have. We did not know how long the original lockdown would last, and we did not know the massive impact it would make to all our lives. But still, the Executive, to their credit, acted. They moved quickly to put support mechanisms in place. There were grants, rate holidays, tax breaks, and yes, because we had to act quickly, some people were missed out. But because we acted, we managed to help and support a lot of our workers. We were at an important moment. The statistics are clear. We are rapidly heading towards, if not a period of total lockdown, then a period of heavy restriction. Now is the time to act. Now is the time to put plans in place, and now is the time to make sure no one is left behind without support. A lot of positive work was done, and I do welcome the wage subsidy scheme, but the number of workers supported is going to be less and less. The Finance and Economy Ministers cannot ignore the projections that put over 100,000 people out of work by the end of this year. This is at least 12% of our workforce, and it will be overwhelmingly our young, our older workers who will lose their jobs. But just to say over 100,000 people almost sanitises the impact of this statistic, Mr. Deputy Chair. These are our friends, our families, our children, our grandparents. They're the ones who have been out during this pandemic, working hard, serving in our shops, stacking shelves, serving in our restaurants and bars. If we don't act, we will all have many personal stories of those who have lost their livelihoods because of this virus and our inaction. We also must look at the wider context. We have record levels of economic inactivity in Northern Ireland. We have Brexit looming at the end of the year. I know it takes a big decision to divert more funds to support schemes, but if there is not one in place, the signs are clear. There may not be an economy to support. Of course, we must try to get back to some sort of normality as possible. That is how we can help the economy. It is therefore important that we all follow the guidelines set. But these guidelines must be clear and direct and cannot be undermined by this Executive. On a personal note, during the year, my third grandchild was born. I am yet to be able to see them in real life. I have not been able to hold them, to look into the eyes of that child, of the next generation of my wonderful family. Through the breakdown of guidelines, as a result of unclear guidelines, it seems likely that a Christmas joy will go by without me seeing my grandchildren. I know this is only one story in a large book of sacrifices that have been made. That's why it is so important that this executive comes out united and direct to stay socially to guide the distance, to wear face coverings indoors, follow the guidelines. I ask you to support this motion.
I call Steve Aiken.
Thank you very much indeed, Mr Deputy Speaker, and thank everybody for this debate so far. And I must say I've been impressed by the tone and tenure of this debate compared to some of the others we've had recently. And I think it's vitally important that we do this, because we're talking about the second most important thing in Northern Ireland is our economy, and our position of our economy, and how we ensure that, particularly for our SMEs, which represent 99% of our economy, there is still an SME ecosystem there when we emerge at whatever stage we come out from COVID. And I'm sorry that Mr Stalford isn't here, but I want to say this in spirit of cooperation, because we must all be working together to create a plan, a business plan, that enables us to come out of the end of this with some form of economy that has the ability to grow and rapidly strengthen if it needs to. Because our economy is going to contract. We have already heard it's going to contract by about 11%, 11.7%. That is an absolutely horrifying figure. But what we want to be able to do is it bounces back, not by 7%, not by 10%, but we need to get it back bouncing 15, 16% or whatever. And quite frankly, that bounce back is going to come from the SME sector. They're the entrepreneurs. They're the people who are going to be agile enough to be able to do something about this. That's the people that we should be concentrating and helping. Because quite frankly, a lot of the other big companies are able to deal with this. They have chief executives. They've been able to get financing from banks. They've been able to do a whole variety of things that has enabled them to do this. But for the SME sector, they've watched their cash drain away. They've watched their ability to do things dissipate. And they're now in a situation where they're facing extinction. And if they go, that is a part of the economy of Northern Ireland that is not going to come back. But we're in a situation where we've known about this for some time. We have known about this since March. And indeed, the Department of the Economy gave back, I think it was about £53 million. It gave it back to the centre, quite rightly so at the time, because it didn't know how it was going to spend or allocate the money. This was money that came specifically for COVID to enable the economy to keep going. But that was March. This is now October. And last week, and I will be one of the first people to lambast the Finance Minister at every available opportunity, as many of you have heard me in this Assembly say so. But the Minister of the Economy allocated £37.9 million to the Department of the Economy. But has he received any bids or longer-term bids to be able to support the SME sector? Has any of the allocation of the money for the £53 million that has been very clearly identified by the Minister of Finances available there, has there any been bids being put together for that? We also know there's monitoring rounds. And we probably expect that comes to the end of the financial year, what will normally happen, even in this period of COVID, there will be a substantial amount of resource there that will need to be allocated very quickly. Now, the problem with this is, in these circumstances, that is money that could be going to ensure that our economic ecosystem is capable of growing and getting the SME sector back up and running. Certainly.
Would the member agree that if we have a situation where we're surrendering resource funding, which could have assisted businesses and people through this pandemic at the end of the financial year, that's nothing short of a scandal?
Members, the next
agree with you. And one of the things we should be able to do, working cooperatively together, because we know that the SME sector needs support, we should be looking at putting together some form of plan that is able to support them. But I hear words about strategy. I hear words about business plans. I hear words about this. It sounds like management speak. But for our SMEs, they do not need that. They need the assurance that they will have some form of financial support, so they'll still be around in the next couple of months, so they're capable of regrowing the economy. They, quite frankly, Minister, they don't need another strategy. They don't need another business plan. They need somebody to tell them very clearly, and that should be you, that we hear what you say, and we are going to be able to give you the necessary finance to be able to do that. And you do have the opportunity and the support of all the parties in this Assembly who will want to work with you and work with the Finance Minister and the other ministers to make that happen. But the first point is we need to realise there is a significant problem and we need to do something about it. It's not the time for more plans. It's not the time for more strategies. It is time for outcomes and actions. And I think somebody, and you, Gary, said quite rightly, you said, you know, we've had plenty of strategy, what we need is some deliverables. So let us as an Assembly commit to making some deliverables and make that happen. Because quite frankly, unless we do that for our SME sector, which is 99% of our economy, if we don't do that, there isn't going to be an economy for Northern Ireland. And as Mr Stalford quite rightly pointed out, there's not a question of raising a tax base on an economy that is growing, because there won't be an economy to grow. So we have to do something. Let's stop talking about it. Let's get on with it, Minister, and let's do something now. Thank you very much indeed. We support the motion.
I call Kelly Armstrong.
Thank you very much, Deputy Speaker. When you get to this stage in a debate, you quite often find that what you want to say has been said, but there's a little bit more I'd like to add to that. As many have said who have spoken before me, COVID has really had a negative impact, not only on the health of our community, but on the impact on the workers and the economy. Of course it has. This present crisis is quite different from any of the previous ones. The impact of the lockdown has gone way beyond anyone's expected trade shocks. Much of the negative impact has been sector-specific. We all know and have heard from the manufacturing industry, hospitality industry and retail sector about the impacts that they have faced, but many of those businesses, thankfully, have been able to avail of financial support schemes to retain employees and keep their businesses afloat. However, and as the Minister does know, there are businesses and employers that have not been able to avail of support, and I believe we need to let their voices be heard. As a member of the Committee for Communities, I have been inundated with calls from those businesses and business people that feel like they have been left behind and they're banned from working. And while the Minister for Communities has been successful in her business case to access further funds for the arts, there remains a number of businesses, as my colleague Andrew Muir has mentioned, for instance in the events sector, that are still banned from working and unable to generate an income. But Mr Aiken has actually brought up one of my key speaking points tonight. Many of those businesses are self-starters, those who've been through the Go For It programme, setting up their own businesses, those small enterprises, and even employing staff. However, there are many that have fallen outside the remit of the UK Treasury's self-employed income support scheme, and these individuals feel abandoned. As reported in our local newspapers, one being the Irish News, one of these individuals said that if her business had been located in Scotland or Wales, she would have received hardship funds to support her through 4 difficult months. It's a difficult thing to read, especially given the fact that we're all here in government. But I think we need to get back to reality. So I would ask the Minister, it would be really, really useful to know and to come from her department for her to confirm how many businesses and the type of businesses that haven't received the financial support, who are currently sitting without that support. I think with that detail it would help us to identify exactly who they are and where they are, and I do expect most of them to be SMEs. I would also like the Minister to confirm for this House what her and her department plan to do to build trust again with a lot of those entrepreneurs. Because those entrepreneurs were left out because they had started up their own business and perhaps had not registered themselves as their own employee. They were outside schemes. I really don't know how we can, as a government together, get those innovative businesses to come back and to invest and to grow in this place when they feel so let down. And that's not just by something that this place has done, it's something that has happened because of COVID. I'd also like the Minister to confirm what support will be provided to the North West, because it's not the only place that's going to have a local lockdown. What will the support be to any other area where localised COVID restrictions will force businesses to stop or reduce trading again? Those businesses were just starting back on the road and the plug has been pulled. And as Mr Middleton has said, there are wonderful people, amazing chambers of commerce out there who have amazing ideas, but when they get hit again with another mini lockdown, it really is impacting their health and well-being, and it's losing people jobs. Mr Deputy Speaker, while jobs and benefits is...
Member agree with me that if the Executive keep putting additional restrictions, which is understandable, on businesses and curtailing their opening and trading hours, even before an aforementioned lockdown that might be coming up, affecting staff hours and wages, that they must provide further additional funds and support to make up for this, especially for the hospitality and events sector, for example.
And the members, an extra minute.
Thank you very much. Yes, I absolutely agree. Especially if you imagine if you were a singer who got your employment, from a pub. That's it. Income's gone. Then they apply for universal credit. They 5 weeks wait, and all of a sudden their house is in danger because they can't pay their mortgage. So, Mr Deputy Speaker, while jobs and benefits is the remit of communities, I'm keen to hear what joined-up working there has been between the Minister for Economy and Minister for Communities to ensure those people being made redundant have the best possible opportunity to gain employment as soon as possible. I contacted the Jobs and Benefits offices and I was asking them, what direction are you giving people to, what types of new businesses could they go for, to get employment in? And I said, what sort of information do you get through from Economy? And they said they didn't, and I found that quite shocking. So what I would ask is, can we have that joined up working? I'm prepared to back you to the hilt, but I think that we need a wee bit more. And I know we're all tired and everybody's a bit grumpy. I don't know whether everybody's noticed. We've got October blues at the moment. But we need to identify those employment opportunities and to ensure the workforce is enabled to apply for those jobs. It's not just about training. We have jobs coming up. There's 900 jobs coming up in communities for universal credit for people to be able to apply to people. There are lots of things that are happening soon, and I believe that we can use the Kickstart scheme, the apprenticeship scheme, to get those people into employment. From catastrophe comes opportunity, and that can only be achieved together. I am supporting this motion, but it's not as something negative against you, Minister, because I believe that we need to help you. We all need to come together to support you in the short, medium and long term. Thank you.
And I call Rachel Woods, but with her intervention, there's now only 1 minute left in this debate.
Thank you again. Thank you, Mr Deputy Speaker. Very little time to speak, but that might be good for some people. But I'll go straight in. Mr Middleton referenced parties coming forward with ideas. Well, OK, here's mine. We're not in the executive, but I'll put some ideas down on paper for you. We don't need to look too far for opportunities presenting themselves for job creation and for dealing with recession, issues that we know we need to deal with. That will dealing with fuel poverty, with retrofitting of houses that's required is a perfect example of where this executive should be investing in, but that's not all. What about the Green New Deal at a local level, investing in new infrastructure that will be required to manage a sustainable economy? What about buildings that have low to zero carbon footprint? Why are we still building houses that they'll look like 20, 30, 40, 50 years ago? We can create long-term, well-paid employment to deliver this programme in literally every constituency in Northern Ireland. We can reform finances to make this possible. This will require changing in banking, cooperatives, community wealth building. I'm glad to be the Vice Chair of the All-Party Group with Mr Catney, and I look forward to this. We'll have a very, very big challenge on our hands. Members, I have a 5-minute speech here, but I'm more than happy to have a conversation with the Minister about our ideas, and I'll see you outside.
I now call on the Minister of the Economy, Diane Dawes, to respond to the debate.
Thank you, Mr Deputy Speaker, and I want to thank people for their contributions today. This House is right to be concerned by the impact of COVID-19 on the economy, the projected spike in unemployment and the danger to businesses and workers from restrictions. I want to start by saying how proud I am of the resilience and innovation displayed by the business community in Northern Ireland. There are many examples of businesses adapting to the new conditions and acting as exemplars of how to operate during difficult times. I want to pay tribute to the local heroes who have kept Northern Ireland operating during the most difficult of circumstances, those in the agri-food supply chain, those working in retail, those in construction and manufacturing, and of course our health workers. I read with interest today the comments made last night by Leo Varadkar, and of course he is right. Decisions taken by administrations, whether in Dublin, London or here in Belfast, need to consider the impact they will have on both the economy and people's lives. As I said in this House yesterday, the economy is not some nebulous term. It is every job, every paycheck, every bill, every dinner on the table. These decisions have never and can never be framed as a binary choice between health and the economy. We will not defeat COVID-19 by destroying the economy. The ability of someone to go to work, earn a wage, run a business, meet friends and family are all integral to a functioning society and healthy people. Decisions we take now will not only have an immediate impact on the economy, but long-lasting impacts that some sectors may never recover from, and equally long-lasting impacts on poor health and poor outcomes for our families and communities. No, I have a lot to get through today. Whereas the last few months have seen the gradual reopening of the economy, for some areas this is being reversed in accordance with health advice, resulting from localised restrictions. The impact on confidence that ongoing speculation surrounding circuit breaks or lockdowns cannot be underestimated. Whether it be business deferring investment, people cancelling hotel reservations, or the impact in footfall in our towns and cities, the cumulative effect is a severe blow to our economy. I have consistently warned of the long-term impact that the first lockdown had on our economy. And whilst we have witnessed some signs of recovery, I have been clear that this would be undone by any further lockdowns, localised or national. Economic modelling of losing up to 100,000 jobs was of course predicated on no further lockdowns and only minimal restrictions. If we are now facing a cycle of localised or national lockdowns, then that modelling will look to be at the more optimistic end of the spectrum. That's not a prospect that would fill any of us in this House with any great joy. At the beginning of the crisis, I moved quickly to support businesses right across Northern Ireland through the grant schemes, which were designed to help protect jobs, prevent business closures and promote economic recovery. To date, we have issued over 31,000 payments to businesses through 3 grant schemes, representing 340 million of support to all sectors of our economy. We have established the Tourism Recovery Steering Group to develop plans and initiatives that will help our tourism and hospitality sector back to its full potential. There have been national schemes that we have relied upon extensively, particularly the Job Retention Scheme and the Self-Employment Support Scheme. As of the 31st of July, the combination of these 2 wage subsidy schemes had supported approximately 330,000 workers in Northern Ireland. Business support on this level is unprecedented, and we will continue to look for strategic and targeted interventions as we plot our way through a challenging time. I note with interest in the debate today that both Sinn Féin and the SDLP want to see greater transfer of fiscal powers. Maybe they will be honest enough to say who will pay those extra taxes and where those extra taxes will be levied. The motion today also proposes that this Assembly should express regret that I have not produced a COVID-19 recovery strategy. And my, how we've got ourselves into an absolute twist over strategies today. The proposer of the motion makes a very long list of strategies that he wants to see. John Stewart got himself worked up into a lather over more strategies and strategies that he could wave about in the air. And Steve Aiken says now's not the time for more strategies and it's all management speak. It is absolutely the time for action, and that is what we have been doing, Mr. Deputy Speaker. And I would remind the members that significant support has been provided by my department to workers and businesses across Northern Ireland. I would also stress that this is a rapidly evolving situation, as demonstrated by the further restrictions announced last week for the Derry City and Strabane District Council area. I met with businesses in the North West last Friday. I heard about the impacts these new restrictions will have upon their businesses. These businesses want and need to be open and trading. A support package was discussed at Thursday's executive meeting and again yesterday, and we hope to have a mechanism in place within days to support those businesses that are impacted. and we will continue to work with our national government on further support mechanisms. The replacement to the Valuable Job Retention Scheme falls far short of what I've been calling for. I have also very grave concerns about how that scheme will work for those sectors still trading at a very low level. And of course, the self-employment scheme, now at 20%, will have a real impact on those people who are self-employed and face difficulties in earning a wage. But we must also start to look at the longer term regarding our economy and how we learn to coexist with the threat of COVID-19. As I mentioned earlier, rebuilding a strong economy is a framework that sets out how we can build a more competitive, inclusive and greener economy. It identifies key growth sectors that we need to promote, as well as the structural challenges we will face in building a stronger economy. And of course, again, the proposer of the motion today mentioned greater connectivity across Northern Ireland. And I'm glad to report excellent progress on Project Stratum, which of course will provide greater and faster broadband connectivity, not just providing greater economic connectivity, but also levelling up the regions in Northern Ireland, because 97% of it is targeted at rural areas. I have secured £17.2 million to deliver schemes which include supporting the return, retention and achievement of apprentices. And yesterday announced 3,000 free training places for people whose employment had been disrupted by the pandemic. This skills investment of £4.6 million will be delivered by colleges and universities with a focus on digital skill and women returners. Nobody should underestimate the challenge ahead of us, but we must remember decisions taken today have a long-lasting and potentially crippling impact on certain key sectors of our economy. Whilst, of course, we must be sensible and responsible in how we protect people across Northern Ireland, we must also recognise that decisions must be taken having considered both the impact on health and the economy. In finishing, Mr. Deputy Speaker, I would appeal to everyone to follow the clear message from the Executive, to wash your hands, socially distance, wear a mask. We all have a duty to exercise our own individual responsibility in order to keep our families and our communities safe and control the spread of the virus. That way, we will have healthier economy and better long-term prospects for Northern Ireland. And I know that you all want that. Thank you.
I now call on Matthew O'Toole to conclude and wind up the debate on the motion, and you'll have up to 10 minutes.
Thank you, Mr. Deputy Speaker. And first of all, I'd like to thank the Minister for responding and thank the various members from across the Chamber who have contributed to what has been a very fulsome debate. I agree with Steve Aiken that the debate has, generally speaking, been one of good tone. I think it's been productive. I'll try and reflect and respond to as many arguments as I possibly can. But Mr. Deputy Speaker, first of all, as I wind today's motion, I want to echo the sentiment in the motion itself and the words of my colleague Sinead McLaughlin in highlighting the urgency of the situation, highlighting the profound difficulty that our economy finds itself in, which reflects both the extreme and acute challenges presented by COVID-19, which, as we know, is not only not going away, but we are about to enter an even a more difficult phase, a more difficult second wave, which has made inevitable and essential both a coherent short-term economic response, but also a coherent longer-term response, which is what our motion calls for today, including around support for workers. Though I note that, and it's worth saying up front, that the Minister herself and indeed members from across the House are broadly speaking all in agreement that the furlough scheme should not come to an end in its current form in October. And I think one of the, if something positive and unified can come out from today's debate, is that all the parties in Northern Ireland and indeed parties in other other parties in the House of Commons and other parts of the devolved administrations are opposed to the furlough scheme coming to an end prematurely at the end of October. Just first to go through some of what was discussed, some of the points that were made in a very fulsome debate, Mr Deputy Speaker. Sinead McLaughlin, as I said, my colleague, talked about the disproportionate impact on micro businesses. That's true. She talked about the 4 principles that my party set out earlier on in the summer in relation to economic recovery. Indeed, other parties have talked about their own principles. Jemma Dolan talked about principles that her party had set out, and that's exactly right. I suppose the point is that political parties are right to set out clear strategic goals. We've been clear about what our goals are for the Northern Ireland economy. I'm afraid it's incumbent on the Economy Department to be slightly clearer about its goals, its strategic aims for the local economy. It shouldn't just be for political parties to put out papers and to suggest things. That should be translated into clear action from the Department. Christopher Stalford and others are right. We are in a 5-party executive, but we are political parties, and we're there to produce ideas that we want to see taken up by the executive. And I don't think there's anything inappropriate about that. Gordon Dunn talked about the very substantial support that has come from the Treasury. I'm an ex-Treasury official. I am under no illusions about the strengths or weaknesses of the UK Treasury. I could give you chapter and verse about the way that institution works. It has strengths and weaknesses. What I would say is that he also said that interventions must be strategic. Well, we agree, and that's what today's motion is calling for. Caoimhe Archibald, the chair of the Economy Committee, spoke in detail about the frustration that the furlough scheme is ending early. She also talked about the need to progress fiscal powers. That's something I'll come back to. I and my party strongly agree with that. Andrew Muir talked about it too. And just to respond to something the Minister said about fiscal powers, she said, would the Sinn Féin, the SDLP, well, I can't speak for Sinn Féin, would those proposing greater fiscal devolution, more fiscal powers, want to specify what taxes they're going to raise? I have a deal for you, Minister. Let's get the powers back here first, and then we'll have a serious discussion about how we prioritise our public policy aims, how we deliver a reformed economy and reformed public services for the long term. The ex-Treasury official in me is happy to sit down and have a serious conversation about revenue raising, but also about how we spend money. And I'll come back to another point, which is something that Christopher Stalford said about borrowing powers. Part of the suite of fiscal powers you want in this place are more fulsome borrowing powers. We are at the minute, and he talked about, I don't want to have a sort of economics 101 debate with my colleague from South Belfast, but he said that no, you can't borrow your way out of economic difficulty. Go and tell that to the International Monetary Fund, who yesterday said that governments around the world should be borrowing more to invest in their economies at a time like this. I'm happy to give way. Indeed, that's a fairly Jesuitical point from the member opposite, but I'm happy to. Anyway, so moving on. John Stewart spoke very powerfully about the need for this place to have a clear strategy. And the point about having a clear strategy is not that you get bogged down in management speak or that you waste time with papers. It's so you know what you're actually doing. You need to have a clear roadmap for how you recover your economy. And it's clear, and it's true, as Kelly Armstrong also said, that in other devolved institutions we have had a clearer roadmap. And with respect to the document that was produced in June towards an economic recovery, I, like others, have read the document. Lots of documents that are put before the Assembly you don't have time to read. Let's face it, not everyone in this room probably went through every single page of the monitoring rounds or the supplementary estimates. I hope most of us in the Finance Committee did, but not all of us go through every page of every document that's submitted. Well, I did go through every page of the Economic Recovery Plan. It was only 9 pages long. It didn't take very long. That's not to be dismissive about the length of it, but we need clear goals, strategies and timelines. Any document that's a serious strategy isn't descriptive, discursive and waffly, to be honest. It's about clear goals, and that's what we all want to see. This isn't about political point scoring. Andrew Muir covered several of the points I've talked about around fiscal devolution. He also talked around about excluded NI, the work that he and others in this chamber have done around supporting them, and I know he's a strong advocate of fiscal devolution too, as we are. Gary Middleton, he is still in the chamber, said we were politicking. Well, I think I've already answered that point. Yes, we're a five-party executive. The whole point of having an assembly is that five parties can come and debate. I'm afraid Rachel Woods is the only non-executive party member. She didn't get long enough to speak. But if we were going to I don't think we'd want to give her the whole debate to speak to herself if the other five parties in the executive aren't allowed to critique or talk about economic policy making. Rachel could have had the entire hour and a half. I'm sure she would have used it and had lots of things to say. But I think the idea that we can't, yes, I'm certainly happy to give way to.
Thanks for the invitation to interrupt. But I suppose I would have to make the point. Would the member not agree with me that whilst we face great economic uncertainty in the face of COVID, that we faced bigger economic, society and indeed existential challenges in the form of the climate crisis, and any long-term economic recovery plan or roadmap should adequately reflect this?
Yes, I agree to the utmost with what the member has just said, and that's something that we as collectively have got to get completely serious about and deliver for our society. Yes, we are a very small jurisdiction. Yes, our global impact on emissions is small, but that is not in any way a practical or moral answer to the greatest challenge that this generation faces, and it's not an answer for young people who are frankly frustrated with the inability of our institutions to act on climate change. Christopher Stalford briefly talked about not borrowing to deliver prosperity. We've talked about the IMF. Let me just come back to this point briefly. We're in an age now where COVID-19 has completely changed the rules of the game around fiscal and monetary policy. Governments around the world, of whatever hue, are understanding that conventional attitudes towards sovereign debt have to change. So we can't be having, I'm afraid, these tired old debates about spending money. We are not a sovereign government in this place. We rely on money on transfer from Westminster, so we need them to be serious about not getting back to kind of austerity era fiscal harshness. No, very briefly, because I'm running out of time.
Just of course that when we can be getting rates at negative 0.25, now indeed probably is the time to be borrowing.
Completely agree with the leader of the Ulster Unionist Party and the Finance Committee Chair. Now is exactly the time to borrowing. That's why we need to increase our fiscal powers and borrow here, because it's never been cheaper to do, and we need to invest. Emma Rogan also talked about fiscal powers. I hope her colleague, the Finance Minister, is hearing, and I know he agrees with it. So this is something where we can all find agreement, that we can get agreement in the Assembly behind the need for increased fiscal power. She also talked about regional balance. She talked a little bit about South Belfast. She's from, like me, she's from South Down, so I have a slight conflict of interest here. But we strongly agree on the need for greater regional balance in the SDLP, despite the fact that I also, of course, believe very much in the city of Belfast. I've just engaged with the chair of the Finance Committee on his points. He talked about the importance of SMEs. Clearly, that's true. Rachel Woods didn't get long enough to speak, but she made a very convincing point when she came in there around climate change. And I would just say to the Minister, just in closing, I welcome the fact that the Minister used her closing remarks to encourage everyone here to take seriously the message around social distancing. Could I reiterate finally to her that the purpose of this debate is not to score party political points over her or her party, but rather to demonstrate to her, I think, the extraordinary unity within this Assembly for a clear economic recovery plan from her department in conjunction with the Finance Minister, and I commend this motion to the Assembly.
Members, the question is that the motion standing on the order paper be agreed. All those in favour say aye. Aye. Contrary, no. I think the ayes have it. The ayes have it. The ayes have it. Ask members to take their ease just for a few moments.
Northern Ireland Assembly Plenary Programme Planning. This is the Northern Ireland Assembly.
Okay, members, ready to resume business. So the next item on the order paper is a motion on terminal illness. I will ask the clerk to read the motion.
That this Assembly welcomes the recommendation in the Walter Rader Independent Review of the Personal Independence Payment Assessment Process in Northern Ireland, that the 6-month life expectancy criteria be removed from the terminal illness rule, notes the work of the All-Party Parliamentary Group on Terminal Illness Inquiry, recognises that there is significant evidence and support for reforming the 6-month rule and all relevant welfare benefits among a wide range of local stakeholders, further welcomes the recent establishment of an Assembly all-party group on terminal illness, and calls on the Minister for Communities to bring forward immediately legislation to remove the 6-month rule, provide guidance to health professionals and adopt a fair definition of terminal illness.
Thank you, and I call Kelly Armstrong to move the motion.
So moved.
Thank you. The Business Committee has agreed to allow up to 1 hour 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose and 10 minutes to wind. All other speakers will have 5 minutes. Please open the debate on the motion.
Thank you very much, Mr. Speaker. Today I'm bringing forward a motion that is very difficult for me, so please forgive me if my voice shakes, and it may be difficult for some members in the chamber. Terminal illness is something that touches us through our friends and families, and for some who have had such diagnosis. It's a shocking diagnosis for the person who receives the news, for their loved ones and all who know them. It's also difficult for the consultants and the doctors, the people whose job is normally to save lives, to have to tell someone that their illness is terminal. It is emotionally draining. Today I'm asking for us to make life for people who have a life-limiting condition a little easier. I believe we have a Minister of Communities who gets this. I believe we have an Assembly who gets this. I believe that we together can help make life a little easier by taking forward a mitigation measure that will once and for all deal with a benefits process that is a cruel rule. It's hard to say. The current process confirms people living with a terminal illness can apply for a fast-track access to social security payments such as PIP, universal credit, employment and support allowance and attendance allowance under special rules for terminal illness. The current legal definition of terminal illness, the definition that is used to be able to give you access to the fast-track application process, is a progressive disease and death in consequence of that disease that can reasonably be expected within 6 months. To apply, the person must get a DS1500 form completed by their GP, consultant or specialist nurse to confirm their condition and treatment. That means that a consultant is confirming that you have 6 months or less left to live. That's tough and hard for any medical profession to predict. I feel it is so finite, it's a bit cold, and it's unnecessary. Imagine having to fill out a piece of paper telling someone they have 6 months left to live. Imagine the impact it has on that GP, the consultant or specialist nurse, to have to complete a piece of paper giving a timeline to a person who's fighting to stay with their family for as long as possible. Many life-limiting or terminal illnesses cannot be predicted in terms of numbers of months left to live. Marie Curie, who had been lobbying for a change to the special rules for terminal illness in society, or in social security law, confirm quantitative evidence reinforces how difficult it is for medical professionals to provide accurate predictions of life expectancy for dying patients. A study of over 8,000 palliative care patients in 2006 found that accuracy varied from 23% to 78%. Imagine being the person who is terminally ill, having to go to their consultant to ask them to confirm how much time they have left for a benefit. Imagine then being turned down for the benefit because your doctor cannot accurately predict when you will die. Why are we putting people through this? Is this the type of government we want to be? We should be helping the person to live as full a life as possible rather than giving them red tape to complete, just to be able to access a social security benefit support a little bit more quickly. The unfairness of this rule means that people are being turned away from being able to access social security benefits quickly because they are not close enough to death. At a time when they are more likely to be unable to work due to illness, undergoing treatment, and are worried about their family, we're subjecting them to the bureaucracy of the welfare system. And Mr Speaker, like others in this chamber, I know how convoluted and complicated the welfare system can be. Many of us in this chamber know how long delays to accessing welfare benefits can be. People with life-limiting illnesses face severe financial pressures at a time when they cannot afford to. Being unable to work due to illness and constant hospital visits, parking costs, a carer having to leave their paid employment to look after you, needing to pay for adaptations in the home, having the heating on more often, being ill is not cheap. Indeed, Marie Curie have confirmed that a terminal illness costs an additional £3,000 per patient per year. This means that social security support is a lifeline for terminally ill people and their families. I'm sure here today others will be able to share the devastating impact financial pressures and delays accessing support have had on people with terminal illnesses. The risk of losing your home, leaving mortgage arrears to your family. There is evidence in GB from the Department of Work and Pensions that an average of almost 10 people have died every day since 2018 while waiting for their eligibility for PIP to be decided. We don't hold evidence for this in Northern Ireland, but I dread to imagine what that average figure for here might be. Time is something people who are terminally ill sadly don't have. If the legal definition of terminal illness was changed to move to a more clinical judgment instead of a measurement of time left, it would open the fast-track social security access for people at a time when they need help. This is not something out of the blue. The Social Security Scotland Act 2018 already exists. There, medical professionals use their clinical judgment to determine when someone is terminally ill for the purpose of applying for benefits under the special rules for terminal illness. In Scotland, the definition for a terminal illness is an individual is to be regarded as having a terminal illness for the purposes of determining entitlement to disability assistance if it is the clinical judgment of a registered medical practitioner that the individual has a progressive disease that can reasonably be expected to cause the individual's death. Imagine the difference that makes. Instead of a consultant having to give someone a timeline to their death, they are helping the person to access financial support, one of the things that causes people with terminal illness the most stress. For someone who is terminally ill, the application becomes a step in the process and does not, as 60 clinicians, academics and other experts stated in an open letter, mean that they will continue to be subjected to the 6-month rule, as it is unfair and denies people the best quality of life during the time they have left. Walter Rader's independent review of PIP in 2018 also recommended the 6-month rule be replaced with the process used in Scotland. The all-party parliamentary group for terminal illness in Westminster's inquiry included the 6-month rule is not fit for purpose. It too recommended the clinical judgment model. On the same day this inquiry was published, in July 2019, DUP, Sinn Féin, SDLP, Alliance, the Green Party and People Before Profit issued a joint call for reform of the 6-month rule. We even have our own all-party group on terminal illness here in the Assembly. This year, on the 8th of July, Belfast High Court ruled that the difference in treatment for terminally ill welfare claimants who cannot reasonably meet the 6-month life expectancy under the special rules is discriminatory. Mr Justice McAlinden described the difference in treatment as manifestly without reasonable foundation. Mr Speaker, 25 health charities wrote to the Minister for Communities calling for the scrapping of the 6-month rule. I know the Minister for Communities is considering how to affect this process. I know the Minister is committed to reviewing the welfare mitigations to ensure that we have the right mix of support to help people. And I propose scrapping the 6-month rule is one measure that we can all support. It is shameful that the Department of Work and Pensions has not changed the special rule for terminal illness already, or the legal definition of terminal illness, especially in the face of such overwhelming evidence. Until they do the honourable thing, it is up to us to take forward a devolved solution, and it will cost money. It will be another draw on the limited amount of block grant we receive. But I believe that it is a better government who chooses to look after and to invest in people when they need it the most. And I ask the Minister for Communities to represent all of us in the Executive to change the legal definition of terminal illness, to scrap the 6-month rule and to proceed with her intended bid for money needed for us to pay to cover the cost of fast-tracking people with life-limiting conditions until such times as Westminster sees sense. I trust our Minister for Communities to do the right thing. I trust everyone here, each party here, to support her, and I support her to keep challenging Department of Work and Pensions to fix the system to mainstream a better and fairer access to support for people who are terminally ill. Finally, I'd like to pay tribute to all who have lobbied for this change, to the many families, to Craig Harris and Marie Curie, to the 25 charities, the 60 clinicians, academics and experts, and to all in this chamber who will support this motion. We together can send a clear message from this place that we will bring forward legislation to remove the 6-month rule. We will provide guidance to health professionals, and we will adopt a fair definition of terminal illness, unlocking fast-track access to benefits. Thank you for your time, and I commend this motion to the House.
Thank you, and I call Paula Bradley.
Thank you, Mr Speaker, and can I thank the members for bringing this very worthwhile motion to the House today, and say that we in the DUP Pensions will be supporting the motion. Mrs Armstrong had said in part of her opening remarks about a cruel rule, and it certainly is a very cruel rule, unnecessary, and the unnecessary assessments an added burden at a time of great concern, stress and anxiety, a time of not knowing what the future might look like, a time of maybe increased spending, and for some a reduction in income. And for many, this will be the first time that they will encounter the welfare system and the minefield of completing an application for PIP and attendance allowance. It used to amaze me when I was working in the hospital social work team the amount of people who had been living at home alone or with families who had a dementia diagnosis and had never claimed a benefit in their life. And it got to the stage of their life where they were now requiring private nursing home care. And as part of my role in the social work team, we would have had to have completed then the financial assessments. And when we looked through the financial assessments for someone who was self-funding, you automatically looked to see if they were getting attendance allowance. But for so many people out there, especially living with such illnesses and diseases as dementia, they don't think of those things at the time. And Kelly had also mentioned about the DS 1500. And how cold and unnecessary it was. And I also remember around that time that I would have completed numerous DS 1500s in my role. And they were all kept in a locked cupboard in the hospital social work team's room. And when you saw it in the medical notes that the consultant had written, social worker needs to bring over a DS 1500, it gave you a chill, because you knew that someone was near the end of their life. And I remember many times having to fill those in. And the bit you said about cruel and unnecessary, I remember those times sitting with families and sitting with patients and saying, I'm applying for a DLA or attendance allowance here on your behalf, and I just need to complete this form. And 9 times out of 10, they were, oh, that's good, that's great, thank you very much. But the odd one you would have got would have said, well, why is it only 1 page? Or why is it double-sided? Why is it not that big booklet that you have? And then you had to explain, well, this is called a DS 1500. This is for special rules. This is for people whose lives are limited. And it put us in the work that I did in a really uncomfortable position. It put the patient, it put the families in a really uncomfortable position. But it also put the consultants in a very uncomfortable position, because I would have remembered at that time we would have had ward rounds and ward meetings and discussed the patient's diagnosis and discussed their future. And for consultants to actually say, yes, absolutely, we need to complete that application was a very, very difficult decision for them to make, because they were unable to see into the future. They were unable to know if someone was going to live for 6 months, 6 years, whatever that might be with the diagnosis they had. But what we did know, that that diagnosis, whatever that might be, was going to cause that person life-limiting consequences. And I know certainly in my own personal experience, much of which I would have dealt with would have been working on the oncology ward. But there were occasions whenever we worked in general medical wards where you would add people with respiratory, maybe COPD, or with dementia, or with MND, or with other conditions that we knew were going to hit them and impact them straight away, impact their lives straight away. They couldn't afford to wait on those unnecessary assessments and the constant questioning as to why they require this money. So I just want to say that I think it's cruel. It's hard, it's difficult for the practitioners to have those conversations. It's difficult for that applicant to have that conversation, knowing that they're applying for this under special rules. And it adds an awful lot more burden and impact and stress and strain on whatever their diagnosis might be. And I just want to, in finishing, just say I was reading through the information pack, and in particular the report from Marie Curie on the cost of dying, and it certainly is beneficial for anyone in a decision-making role, whether that be us as legislators or whether that be those people that process those applications, to read the very real impact of a diagnosis of terminal illness. And that has been my belief, that if we can do something here as an Assembly to reduce that burden, to reduce that stress, then at the very least we must. I support the motion.
Thank you, and I call Colm Giller now.
I also rise to support the motion, and I would like to acknowledge the work and the long campaign that Marie Curie and motor neuron disease and others have taken around this campaign. I have some experience of working with families in this situation, similar to Paula in relation to my own social work role, and I was often struck by the very deep nature of how many things were going on at any given time with families. They were trying to plan for what was obviously a very difficult situation. They were trying to juggle finance. Carers were often ignoring their own appointments and their own care needs. And one of the things that they could not actually even sometimes get around to thinking about was the issue of benefits and trying to navigate their way through that system. I also think there is a lot of truth in the fact that many people do not want to know how long they have, and actually it's so inaccurate anyway, as mentioned, that it's, in some cases it's meaningless. And we all know cases where people have been told they have a particular amount of time to live and didn't see that, or else outlived that by much longer. So I think this is an area that we really could make a difference on. We have also seen the recent debates here in this chamber around dementia and a number of other conditions, and I think we are largely speaking with one voice in relation to many of these very difficult issues, and this is something that we could actually make a difference on. I know the Minister will be actively looking at how we can make things here. It's not straightforward. I understand that Scotland have been looking into how they approach it, and they haven't quite got there yet, but I'm sure we will take the advantage of all learning that comes from best practice from wherever that may be and seek to apply it here. I also know that, and I welcome the fact that recently we have seen an APG being set up in this Assembly. Joanne Bunting has steered that through, and I was very privileged to be included as part of the membership of that APG. I think this is an area that we need to give some real serious consideration to. I also know, Ceann Comhairle, that you yourself have worked with Marie Curie in relation to issues arising from that. It's in keeping with our party policy, and I would certainly be supportive of this motion today.
Thank you, and I call Pat Catney.
Thank you, Mr. Speaker. I also am rising in support of this important motion. I cannot imagine the fear and the despair and the sadness that follows from a diagnosis of terminal illness. However, I have seen firsthand what a terminal illness can do to a person, how much support a person needs in that situation, and how quickly things can go from bad to terminal. This is why we must make access to any support as simple, quick and easy as possible for anyone that finds themselves in this terrible situation. I have a massive concern about how a number of our benefits are assessed. To use PIP as one of the examples, you have assessment criteria that forces people with a life-threatening condition who have been doing their best to live their lives despite their health problems, who have adapted to all obstacles and all challenges in ways we can't imagine, The PIP process forces these people to throw that all out the window, to focus on a world of inabilities. I know we have to have assessment criteria, but this, for me, is the most degrading process. It is the same feeling I have about the 6-month rule. How can it not sicken anyone here that we ask those who, faced with despair of a diagnosis of terminal illness, who may be doing the best they can to live their lives despite the diagnosis of that terminal illness, to then prove that they will die within 6 months in order to access vital support? You cannot think this is okay in any sort of compassionate society. That is why I wholeheartedly welcome a move to the clinical judgment of our doctors. Moving to a clinical judgment will also assist those with more difficult medical diagnosis. We have all heard stories of the inability of benefit assessment criteria in general to deal with certain health conditions, so I hope this brings some certainty and help to those in this situation. Mr. Speaker, the focus of our benefit system is all wrong. They should be about support, to allow people to live their fullest lives, to aid them, to overcome barriers and to protect them from challenges that the average person does not face. This should not cause a person to be degraded or focus on what they cannot do. However, I know this is a wider argument. To get rid of the 6-month rule is a small technical change that can have a large impact. And as someone who's, there are older, who's approaching 70 years, I think life, Mr. Speaker, can throw most things at us. And by the time we're approaching our 70, we have done that circle and we've seen the joy and we've seen those sad parts of life. But to live or to see a family member in this situation and being diagnosed with that terminal illness, no matter how long you live, you'll never get used to it. And I commend the House to support the motion.
Thank you, and I call Robbie Butler.
Thank you, Mr. Speaker, and I rise to support the motion that has been brought by both Kelly and Paula. I thank them both for it, and the tone of the debate and the motion I don't think will change throughout. And I think they were right when they said we do have a minister who I do believe is compassionate for these issues and is person and people-centred. I also want to be on record and thank all the community stakeholders, voluntary and community groups who have lobbied for a number of years on these changes, and in particular Marie Curie, who have been relentless in pushing this message over this period. And indeed, we will probably all talk about the findings on the radar report, which outlined, I think it was maybe 16 sort of issues, but this one jumped out at all of us because of the personal nature of it and how it could affect the people around us and our constituents. And I'm just going to talk just briefly about something that my Lagan Valley colleague has just, and I'm not saying anything other than we do term this as welfare and benefits, and it's not. I really want to see it change the social security and the whole tone of what we're talking about and how we support people when they need the help that's there. And lots of us will have experiences. I had an experience, and my office dealt with a case last year, actually, and it's actually very sad. And I know Kelly was emotional when she was sharing something that's very personal to her. And this really was quite shocking last year because we had a case where the form had been used at the S1500 and the clinician had made a judgment where the person would live to be for 12 months, so then fell foul of the rule. And the reality was they lived for 3 months. And we worked with them to go through the process, and it may have been action retrospectively, but it's not good enough because that person lived with that fight for that time. And the discussions in and around the family of someone who's terminally ill aren't the normal discussions that we have because they are preparing for burial, they are preparing for funeral. And if you're in a home which has a low income, you're worrying about, some people are worrying about and having discussions, how can I get buried? And am I leaving a debt that my family are going to have to live with? And this is 2020, and I don't think those conversations should be being had. And I do agree that the DWP have failed on a number of issues, and this one in particular, where if they could have moved under the advice of the reports, then we wouldn't be having this discussion here. I would welcome to listen into the debate and to do it, but I hope that we can act here in Northern Ireland for the people that we support. The PIP process has many, many failings, but this one in particular, because time is a luxury for those that have a terminal diagnosis. Even with modern diagnostics, we know about comorbidities, and we've got increasing treatments and so on. And I think that makes it even harder for our clinicians and the burden on them to tie a time down. And I do believe the clinicians are even reluctant to give a time because there's evidence to prove that people live to the point of that diagnosis and perhaps could live further and that is obviously what everybody wants to do. But the time is precious and it should be time spent making memories. And that's what it should be concentrated on. There's been some conversation about the scale of the problem here in Northern Ireland, where we maybe don't know how many people are on that waiting list that are to be affected. But as has been brought out, the financial burden is somewhere in the region of £3,000 to £3,300 in terms of that cost, and it's picked out by the Marie Curie report. But there may be a benefit in if we can support those people, because if we can give those people that support to live at home, to get that support, well, maybe we're going to ease the burden somewhere else, maybe in the health system, maybe we're going to free up a bed, and maybe we're going to remove somebody from needing that care that could be cared for at home, which is where most people would want to be with their loved ones. The purpose of this debate, Mr. Speaker, is to relieve the burden on the terminally ill and their families at the very time that they need it most. We need to try and ensure that when people are dying, that they die with dignity. And that is a job for our Minister to certainly look at what she could do, and it's up to us to ensure that we support her in any way that we can. So, Mr. Speaker, we support the motion.
Thank you. And I call Jonathan Buckley.
Thank you, Mr. Speaker. There are many times I sit and listen to debates in this chamber and think to myself, what real relevance will they have on everyday people across the country? I'm sure there are many members that can testify to that fact. Thankfully, today is not one of those days, and I rise in support of the motion and thank the members for Strangford and indeed South Belfast for bringing it forward. The current special rule for terminal illness and benefits law is cruel, lacks compassion, and denies our most vulnerable and their families dignity in their final days. It is important that we highlight what access to social security payments actually look like for patients under the special rules for terminal illness. It means fast-track access to payments like personal independence payments, universal credit, employment support allowances and attendance allowances, claims which on average are processed more than 6 times faster than normal claims. Crucial to anybody that is suffering from a terminal illness. Access to these payments are critical for the welfare of terminally ill people across this country, allowing them to spend more time at home with those they love, rather than having to attend face-to-face appointments and jump through endless hurdles that are neither justified or necessary. I think we all agree with the merits of such access for those dealing with terminal illness, though what we cannot agree to in this House is the key criteria to being able to access this benefit, that being, as has been outlined, the legal definition of terminal illness used to determine eligibility for a special rules claim, which is, and I quote, a progressive disease and death in consequence of that disease that can reasonably be expected within 6 months. Mr. Speaker, now we can see the unjust nature of this rule, that being 6 months prognosis from a medical professional. It begs the question, what about the terminally ill patient or claimant with 7 months to live, 8 months, a year or longer? Or the terminally ill patient living with motor neuron disease, chronic heart failure, COPD, to name but a few, with a life expectancy? Absolutely.
Thank the member for giving way, and I want to obviously indicate my support for the motion. But I want to pick up on a word that the member has raised or used, and it is indeed in the very last line of the motion, where it says adopt a fairer definition of terminal illness. But really, isn't it, Mr. Speaker, that this definition of terminal illness and the measurement 6 months rule is unjust rather than unfair in the situation? And that in itself, playing on that unjustness, strengthens the hand of this Assembly in arguing the case for a change in the definition.
I thank the member for giving
well. Has an extra minute.
And I wholly agree with his comments. They are indeed unjust and unjustifiable, and I don't think anybody here would say otherwise. But all of these diseases, to name a few, with a life expectancy of 20 months or more from prognosis, with no treatment or cure. Members, there is no level playing field, and I think that's getting to the heart of what you have said, Mr Newton. For those with terminal illness, and we must address the injustice head-on, without delay, and I trust the Minister will respond accordingly in the House today, and I have no doubt, given the comments from her colleagues, that she will. The evidence is clearly there, as has been outlined by the Rater Independent Review of PIP at Recommendation 6, where it states that the clinical judgment of a medical practitioner indicating that the claimant has a terminal illness should be sufficient to apply the special rules. The 6-month life expectancy criteria should be removed. That's as clear as it is. We also see the precedent for such change contained within the relevant Scottish legislation, where an amendment was lodged and unanimously approved to ensure the definition was exactly this, based upon clinical judgment. In conclusion, Mr Speaker, I thank the members who have brought forward this motion today and the work of the all-party group led by my colleague Ms Bunting in championing the needs of those suffering with terminal illness. I urge the House and indeed the Minister to act with compassion and back this motion and bring some help to those whom, unfortunately, through no fault of their own, are dealing with circumstances that are going to have such serious consequences for them and their families for generations to come. I want to thank and put on record as well my thanks to those teams at Marie Curie and other organisations that go above and beyond the call of duty. And I think everybody here in this chamber can testify to the work of these miracle nurses who give of their time and so emotionally involved in each individual case, whether that be following them through the case, but as evident, attending the funerals thereafter, because they are so emotionally attached to the patients that they're dealing with. I think we must act with compassion, and I want to commit to those that are suffering from terminal illness and those involved in their care that please be assured of my support and indeed my party's support in the days ahead. Thank you, Mr Speaker.
Thank you, and I call Frew McCann.
I would like to begin by commending the proposers of this motion and make a special mention of thanks to Marie Curie and the Motor Neuron Disease Association, two wonderful organisations who provide such an essential service for people who face life-ending illnesses and their families who find it difficult coming to terms with the imminent loss of a family member or close friend. I have in my life spoke to many people who have told me that they would never have coped had it not been for the attentive and caring support these organisations brought on a daily basis to their loved ones, from diagnosis through to palliative care. I would also commend their success in bringing together so many political parties to speak with one voice on this important issue, and their ongoing campaign to reform.
Sorry for a wee second. Could members check if their mobile phones are on, please, and switch them off?
Probably mine, I don't know. I might drop a wall.
We'll try and struggle through this, Frew. Go right,
that's okay. I've struggled through worse, sure. Have in my life spoke to many people who have told me that they would never have coped had it not been for the attentive caring support these organisations brought on a daily basis to their loved ones, from diagnosis through to palliative care. I would also commend their success in bringing together so many political parties to speak with one voice on this important issue, and their ongoing campaign to reform the rules governing fast-tracked access to social security benefits for people with terminal illness. Sinn Féin support their view that the 6-month rule associated with prognosis should be scrapped and a fair definition based on the judgment of medical professionals introduced. This issue has also been brought to the fore recently by Lorraine Cox, who supported by the Law Centre took a High Court case to challenge this rule. We recognise that people with a terminal illness who access their entitlement to social security under special rules have a different experience than those who don't. It is much more than necessity to have your application fast-tracked. Special rules apply to PIP, attendance allowance, universal credit and ESA. They do not only ensure that your application is fast-tracked, they also remove the requirements to attend work capability assessments or carry out work-related activity. The 3-month qualifying period for PIP and the 6-month qualifying period for attendance allowance, as well as face-to-face assessment. It is wrong to restrict strict access to people who are terminally ill via the 6-month rule. This adds unnecessary stress and worry, and it needs to change. The issue is both complex and extremely sensitive. It is difficult to accurately predict life expectancy, and some people may not want to know their prognosis. This should not impact on their ability to access financial support quickly and compassionately. Removing the 6-month rule and replacing it with a fair definition is surely central to this. The special rules criterion are set by Britain's Department for Work and Pensions, which are over 30 years old. And despite repeated calls from across the sector, from clinicians, academics, politicians, and from recommendations including the all-party inquiry on terminal illness from MPs in Westminster, which is referred to in the motion, which found that the rules determining fast-tracked access to benefits for terminally ill people are not fit for purpose. They have still not, although they still not have made the necessary change. They have, however, initiated their own review. We continue to await the outcome of this. In the meantime, Scotland have brought forward legislation to remove the 6-month criteria and to bring forward a fair definition. They are to be commended for this. This motion calls on the Minister for Communities to bring forward legislation to do similar. I am confident that the Minister will be looking at all examples of best practice as well as what works specifically for the North to ensure that people get the help they need and when they need it. I wish to welcome the establishment of the All-Party Working Group on Terminal Illness. Colin Gildernew as our representative on this all-party group. Only last year at our RDH, a motion was brought to the conference which supported the campaign of the Marie Curie and the Motor Neuron Disease Association, which called for the scrapping of the 6-month rule and a fair definition based on the judgment of medical professionals introduced. It also called on the British Government and the Department for Communities to address this issue as a matter of urgency to ensure that people with terminal diagnosis do not have to face traumatic and unnecessary delays in assessing their entitlements. Also, my colleague Alec Maskey.
Members' time is up.
Okay, thank you, Jim.
Thank you very much. I call Joanne Bunting.
Thank you, Mr. Speaker. I'm grateful to Ms Armstrong and Ms Bradshaw for bringing forward this motion and declare that I'm the chairman of the APG on terminal illness. Call mistake. On the 8th of July 2020, the High Court in Belfast ruled the difference in treatment for terminally ill welfare claimants who cannot reasonably meet the 6-month life expectancy criteria under the special rules is discriminatory. Mr Justice McAleer described the difference in treatment as manifestly without reasonable foundation. All right-thinking people concur, certainly on an emotional and common sense level, even if they haven't studied the legal arguments. If the question is why things have to change, then the answers are because of exclusion, time left to live, and the best use of that time. We can all put ourselves and those we love in those shoes and think of the impact. By using a definition of terminal illness that is tied to a life expectancy of 6 months or less, many legitimate claimants are excluded from applying for welfare support under the special rules for terminal illness. For many terminal illnesses, particularly non-cancer conditions like motor neuron disease, chronic heart failure and COPD, accurate prognoses can be difficult because of the unpredictable trajectories of those conditions. Ms Armstrong and Mr Butler have already outlined the difficulties of variance in accuracy of life expectancy estimates. And so the current system is only really working for patients with a predictable disease trajectory, such as some types of cancer. While cancer accounts for less than a third of deaths every year in Northern Ireland, it represents 90% of the local PIP claims awarded under the special rules, while other condition types are significantly underrepresented in special rules awards relative to the number of deaths they account for. It follows then that many people with these conditions are being turned away from the special rules system because of the unpredictable nature of their illnesses. Those who are excluded from the special rules have to apply for welfare support under the normal process, with all the bureaucracy and assessment that entails, causing significant distress and robbing them of time that they should be spending making memories with their loved ones, getting their affairs in order, and doing the things they want to do before they die. The significant delays associated with standard welfare applications may also mean terminally ill people spending the end of their lives facing severe financial pressures. 2/3 of households affected by terminal illness experience financial strain. And as Ms Armstrong has pointed out, the extra costs have been calculated at around £3,300 per patient per year. In this context, the financial support provided by the social security system can be a godsend, but long delays to access welfare payments are compounding the financial difficulties. Time's a luxury that terminally ill people don't have. We've already heard that evidence in GB shows people are dying while waiting for their benefit payments because of the delays associated with the standard application process. It's bound to be a similar situation here in Northern Ireland, and we should do all we can to rectify it. Clinicians, Marie Curie in my constituency and with whom I work closely, and other charities who assist the terminally ill are calling for a fairer definition of terminal illness that is based on clinical judgment, not a time-restricted estimation of life expectancy. This would follow the approach in the Social Security Scotland Act 2018, wherein an individual is to be regarded as having a terminal illness for the purpose of determining entitlement to disability assistance if it is the clinical judgment of a registered medical practitioner that the individual has a progressive disease that can reasonably be expected to cause the individual's death. Adopting this approach in Northern Ireland would allow more dying people to access welfare payments quickly. This would support people to have a better quality of life during the time they have left and avoid the long delays, intrusive assessments and work requirements associated with many benefits. It's important to note that this policy change is not about widening the basic eligibility criteria for welfare payments. The overwhelming majority of dying claimants who are excluded from applying for benefits under SRTI will still be eligible for payments through the normal rules, and in many cases these payments will be backdated to the beginning of their claim. The issue is one of time, ensuring terminally ill people get the financial support they're entitled to quickly, and with as little distress and bureaucratic interference as possible. I will give way.
Thank you, Member for giving way, and I think the member raises a good point because we've all talked about who's impacted by this sort of failure within the system, carers, clinicians and family, but would the member agree with me that actually the assessors, who are much maligned at times, actually are doubly stressed, and that's compounded with them because they can see the need and they know that it's not going to happen with this system?
The member has an extra minute.
Thank you, Mr Speaker. I fundamentally agree with the member. And the other point is this: aside from the moral arguments, there are also a number of other potential benefits to changing the special rules system. Firstly, money will be saved by cutting down on the number of unnecessary face-to-face assessments for dying people, and by helping terminally ill people to access the financial support they need when they need it. We can also ensure that more patients are supported to stay at home comfortably, potentially reducing the avoidable use of public services. Legislative reform is required to deliver this much-needed change. Attempting to widen access to the special rules through changes to guidance or the DFC/capital application or assessment processes will not fix the fundamental issue. So as long as the 6-month rule is enshrined in law, healthcare professionals will stick to it and dying claimants will continue to miss out. Thank you, Mr Speaker.
Thank you. Can I call Harry Harvey?
Mr Speaker, I rise briefly this evening to support this motion, and I'm very glad to see it being brought to the floor today. I believe that one of the most important recommendations to come out of the Walter Radar Review was in relation to the abolition of the 6-month criteria placed on a terminal illness diagnosis. A terminal diagnosis impacts not just on an individual, but an entire family network. Few of us could even begin to imagine the impact such news has on those who receive it and their families. People who find themselves in this situation should be afforded the opportunity to live out their final days free from financial worries. Access to PIP is one of the fundamental ways in which society can practically provide support to those most in need. There are often few more needy than individuals who receive a terminal illness diagnosis. However, under the current criteria, many terminal patients are unable to benefit from this help due to the 6-month life expectancy rule. Surely it is inhumane to place a life expectancy time frame on such a tragic situation, especially one as meagre as 6 months. It is important that the terminally ill are not denied support simply because they are likely to live longer than the stipulated period. As the motion states, a fair definition is required that will be sensitive to the needs of those who are living with a terminal illness. I trust the Minister will move to reform the current legislative provisions and support people and families living in such difficult of circumstances. Thank you, Mr. Speaker.
Thank you. And I now call on the Minister for Communities, Caroline Cullen, to respond to the debate. And the Minister, of course, will have 15 minutes to respond.
Okay. I want to thank all the members who have spoken, and I'll thank Paula in advance when she's waiting. It is a very important motion for everyone. I don't know anyone who hasn't been impacted by cancer or someone who's been impacted by a terminal illness. Should it be our families, our constituents, our neighbours, and it's debilitating, even watching people and watching their carers, let alone having to look after loved ones who this is impacted upon. And this is a priority for me, so I want to give the House this assurance. I support this motion, by the way. I also, not so long ago, met with representatives from Marie Curie, Motor Neuron Disease Association, Advice NI, the Law Centre, and I've also spoken to families as well. And I spoke to actually some medical practitioners about this, and to say that the evidence and their testimony was compelling is an understatement. Recently, as recent as yesterday, I spoke with the Minister from DWP about this, and I just want to assure you all that my department have been really, really proactive in terms of the DWP review and what needs to happen. I also want to pay tribute to Marie Curie, Motor Neuron Disease Association, the hospice, the Law Centre, all the people who have been lobbying and campaigning for this for years. But more importantly, I want to pay tribute to the families who have made this an issue that's rare, that has united this House right across the board. And I do also share the frustration that some have articulated today that the review has not yet been published. I think to say it's well overdue is an understatement. So, a few people mentioned the McAleer case, and I don't want to avoid it in case people think I'm avoiding the issue. So, you will be aware that there wasn't a remedy for that case as such, other than the comments that the judge has said, which are very, very significant and very important. But I can't go into any potential of what that remedy may be, because the process is still been listed in court, so it's still going through the court system. But it's clear to me, if evidence was needed, that our Assembly, through all the parties here, are committed to helping people who are most vulnerable, and people who are dying and terminally ill are our most vulnerable. Our Assembly all-party group, which Joanne has chaired on terminal illness, is also a welcomed development because it raises the awareness of issues. And we've heard them before. I remember my own days on health, about car parking charges, about the debt incurred by families, about neighbours clubbing together. You know, I mean, for people who are already on poverty lines, when someone is down or terminally ill, it just is exacerbated. And it adds to the grief, because you're worried about other things and you can't, despite all your best efforts, put your focus where it needs to be. I also am acutely aware, and you'll all see this as part of your APG, the role of hospices and our social workers and our family support workers and our neighbourhood renewal workers who are often the last person that a family talks about that 2-page form. Okay, and they're the ones who are holding hands and are trying to, cushion the shock the families are getting that someone has only 6 months or less to live. So I have been in that situation both as an MLA and also as a daughter, and it's horrible. It's absolutely horrible. So I think the reference to Scotland has been really interesting, because it did, made the Scottish model, as people refer to it as, it should be based on a clinical judgment. But what Scotland hasn't done, which I have been looking for, wishing for, hoping for, is, what are they doing in terms of what they're replacing the rule with? So that is something we're all looking at. And, it's been said by, I think, everyone who has spoken, where there is good practice, so we all know what's not working. This rule isn't working. Where there is good practice and good recommendations, we all need to listen to them. So I want to let us know that's exactly what I'm doing. And Walter Radar's independent review of PIP, the assessment process, is sober reading for anyone. And it's sober reading for many reasons. But if anything it asks us to do is to work collectively together to change what the status quo is at the minute. I think the devolved social security legislation powers are now with us. So it is in my gift to look at this. And what I'm saying to you is I'm actively looking at it. And when it means that we have found a remedy, or the process of going through a remedy, I will inform my executive colleagues, I will form the Communities Committee, and then in turn this Assembly. And it will mean that you will need to change legislation and regulations, but that's what we're here for. So I think we're all up for that. I also want to put on record that some people have mentioned the assessment, and that Deirdre Hargey had already started a process of bringing that assessment in-house. But people who are doing the assessments too, so I think everyone who has spoken, most people who have spoken have mentioned that. And I want to thank Kelly for introducing the motion, Paula Bradley, I want to thank Colin Gildernew, I want to thank Pat Catney, I want to thank Robbie Butler, Jonathan Buckley, Robin Newton's intervention, Frew McCann, Joanne Bunting, Harry Harvey and Paula in advance, because I do think it is really important, because it would surprise you that, I think Jonathan made the point, that often enough, and I say this as a minister, not all your questions are relevant, so I'm just telling you now, right? Some of your questions are in 5 parts, but they're the same. But I mean, I've done that myself, so I understand. But these things are absolutely relevant, and people do read our questions, and they do read our debates, and they read our comments. And I think anyone who has nursed anyone, who has had to comfort anyone who is terminally ill, but more importantly, had to deliver the news to people, basically they need not apply, because you've got a year left rather than 6 months. They will be encouraged when they hear what we've all had to say. And let me repeat again, I am completely committed to continuing to improve the process to make a real change, because what we're talking about is end of life here, and it's very, very difficult for people. I, in particular, want to thank everyone who's contributed to the debate today. I want to thank the members, in particular, of the Communities Committee. I am biased, sorry about that, because I know too that even previous committees in DSD, and this is how long this goes back, previous committees on DSD, the Speaker will be more than aware of this, and it does become weary when you're seeing the same lobbyists, the same people coming up and asking us to make a difference. So hopefully today that this is the start of looking to see what we can do in terms of remedy, looking to see what DWP are going to do anyway. This will have an impact on budgets, but we already knew that, and I think this is something that any of us can, quite proudly stand over arguing for people. I think, I mean, that's why we're here. We're here to We're here as legislators. We're here to make legislation, to bring new laws, but we're also here to make a difference. And if we can get rid and change this rule and put terminally ill people and their families, give them a bit of hope, because to be quite frank, that they've all waited long enough. They've all waited long enough. And I, along with yourselves, I am committed to changing that for them. As an MLA, as a minister, you know, as a member of a community, you know, that's why we're here. So I want to thank you for bringing the motion today. I think it's been a really good experience, and hopefully people who are reading the Hansard will feel a bit more relieved, even if it's too late for them, but certainly for the many people that are coming behind them. So, Gormago.
Gormago, thank you. And I call Paula Bradshaw to conclude on this debate. And the member has 10 minutes.
Thank you, Mr. Speaker. I don't think I'll need the full 10 minutes, but I do want to reflect very much on the breadth of the issues that were raised here this evening. I just want to start off by thanking my party colleague Kelly Armstrong, who suggested this motion to our MLA group, and her work behind the scenes to get us to this stage today. She opened by reflecting very much on how terminal illness affects all of us, and how, you know, we have to recognise that it is cruel what we're putting people through, and that if we change the law, it will cost money, but we would see it as an investment when people need us most. Paula Bradley reflected on her experience of the DS 1500 form and how uncomfortable it was for everyone concerned in the completion of that. Colin paid tribute to the work of Marie Curie in the motor neuron disease, and others in the chamber as well. Jonathan, Frew and Robbie also, and many others then commended them on their campaign for legislative reform. Pat talked about access to benefits should be as quick and easy as possible, and that the current process is degrading and sickening. Robbie said that we should be about helping people. He talked about his work with a constituent who only lived for 12 months, and the struggle the constituent had in those last days of his life for financial support. Jonathan Buckley, I think he made a very good contribution when he opened to say that this motion had very great relevance, and I think we all tonight, we have sat in this chamber and talked about things that we feel it's very repetitious, but I very much concur with what you said there, and what this motion and any legislative change would be about, giving people dignity in their final days. The intervention from Robin Newton as well was very appropriate, in that he talked about how the rules are unjust as opposed to being unfair. Frew McCann, again, he talked about how if we change the rules, the fast-track application, how it would remove unnecessary hurdles to people. And he also commended the work that they've done in Scotland in bringing forward the changes. Joanne Bunting talked about, first of all, mentioned the new APG on terminal illness, and I sit on that too, and others in this chamber. And we've so many APGs in this assembly now, but this was one I was very, very keen to support Joanne in setting up. And she talked about then the High Court ruling in terms of its use of the word discriminatory, and I think we can all very much relate to that. Harry Harvey spoke about that people should be able to live out their final days free from stress, and how the current system is inhumane. And so terminal should not be. So people who are terminally ill should not be denied support just because they live longer than the 6-month period. So, Minister, just turning to you then, thank you very much for your confirmation supporting the motion, and your commitment to supporting your departmental officials to look at how you can take this forward. You also recognise the hard work of the stakeholders in the voluntary sector and the families affected, and your commitment then to, when you come up with a remedy, a prescribed remedy, you'll take it to the executive for approval. So listen, thank you very much, Mr. Speaker. I'll leave it here, but I very much thank everybody in this chamber for their contributions tonight.
Okay, members, thank you. And the question is that the motion standing on the order paper be agreed. All those in favour say aye. The contrary, no. The ayes have it. Clearly, the ayes have it. Thank you very, very much, members. I could ask members just to take your ease for a couple of moments. Okay, members. Item 5 in the order paper is the adjournment. The question is that the Assembly do now adjourn, and in conjunction with the Business Committee, I have given leave to Mr Doug Beattie to raise a matter of protecting the Iveagh historical and archaeological site. Now, owing to the location of this site, members from the South Down constituency will be given priority if wishing to speak in the debate. I will, of course, try to allow time for everyone wishing to make a contribution. The proposer of the topic will have 15 minutes, and I call Mr Doug Beattie.
Thank you, Mr Speaker. And I won't take 15 minutes, I hope, but I'll try and get the point across. And at the end, I'll maybe explain why I've expanded. Upper Ban into South Down, so we understand my rationale. This is my third adjournment debate in 3 weeks. Each time I cross my fingers that it won't be delayed. I guess my luck ran out tonight. But it's an important debate nevertheless when we talk about our historical heritage and the issues around it. And there are some issues around it, and I thank the Minister for being here. I know how busy you are. And I also know that we've also been in correspondence in regards to this, so it's nothing new to you. I would say in the debate is I'm not here to try and in any shape or form proportionate blame on anything in regards to this. What I'm trying to do is just discuss it so we get an understanding of the issues around Iveagh just outside Rathrisland. Iveagh Cairn sits on the summit of Iveagh Ridge just outside Rathrisland. The cairn is a scheduled historical monument pursuant to Historical Monuments and Archaeological Objects Northern Ireland Order 1995. Some limited excavation of the site in the 50s recorded it as being from the Neolithic period between 3000 and 4000 BC. It's a burial site. It is an inauguration site for Irish kings from that medieval period, the McGuinness family, I believe that is. It's a resource to understand the Neolithic period, the Bronze Age, and the Iron Age in Ireland. The Historical Environments Division, and you'll hear that come up a bit, the Historical Environments Division, if you don't know, is actually part of the Department for Communities, so they sit under them. But they said that it was of national importance for the understanding of the Neolithic period in Ireland. So everybody is quite clear that here we have an extremely important historical site just outside Rathrisland on the site of Iveagh. I think that's pretty clear. Yet as a national important and scheduled site, a wind turbine was given permission to be erected on the site about 100 metres from the cairn. And this was given in about 2013. This was done without an archaeological study or engagement with the Historical Environments Division, something that they should have done as part of the planning process, but they did not. They cut them out of this absolutely, completely. And there was no environmental impact assessment. In 2017, the Historical Monuments Council, which is a statutory advisor to the Historical Environments Division, bear with me, wrote to DFI to ask for the planning permission to be revoked. Yeah, of course, absolutely.
Thank the member for giving way. You'll forgive me for laughing when he started to talk about prehistoric and medieval. The honourable member, Mr. Wales, walked through the door. But on a more serious point, could the member maybe elaborate as to, and I maybe didn't pick this up, in relation to timescales, was this decision for the procedure of a wind turbine passed under the old council structure or under the ABC structure?
Yeah, and I would probably get into that. And let's be absolutely clear, this was done in the old structure. So this was when it was the DOE and not DFI. And there's probably a few other name changes. But everything that happened afterwards happened as we went into the new structure. And it's probably one of the reasons why I'm here talking about it today. And I'll elaborate that slightly. And therefore, it'd be absolutely wrong of me to point the finger at any minister and say, you got this wrong. It's just a long-term issue that we have to deal with. And I'll explain at the end that Iveagh is not alone. So thanks for that intervention, Johnny, but I've now lost where I was. So in 2017, the Historical Monuments Council advised the DFI that they should revoke that planning permission. But they didn't. And since 2017, there's been further digging on the site. Further earthworks, about 2 kilometres, I think, of earthworks on the site. There's an access road been put onto the site. The wind turbine has been built onto the site. I believe there's also a transmitting mast on there and a number of boxes which service the 2 of these. So as you can see, that even though this is a historical site, a site of regional importance, and importance to Ireland as a whole, for us to understand our history to the Neolithic period, to the Bronze Age, to the Medieval Age, our planning process failed it. And it failed it seriously, to the stage that we have now built a wind turbine on top of this site. So instead of looking at somewhere where we could take our young people, somewhere we could go and look and view and understand, what we have is a development which destroys the site. And that's where the difficulty arises, because we're now caught between 2 departments and a council. Because having given the permission as part of the DOE in the planning permissions part, and I apologise, this sounds like a planning sort of seminar thing, but having given permission as part of the DOE for it to be placed there, having DFC's Historical Environments Division say, no, it shouldn't have been, you would think it would be really quite simple, because all the HED has to do is say, no, you can't, revoke, take it away, before it was ever erected. But nobody did. Nobody enforced anything. And I guess that is a failure, I suppose, within 2 departments. And not a deliberate failure, but it is a failure within those 2 departments. And we've been fighting for this ever since. And I have to say, standing here, that if it wasn't for the Friends of Iveagh, and I know a lot of you will have engaged with them, and Anne Harper as part of that group, this probably would not have come to light, certainly to me. But she brought it to light, and she's been fighting a long campaign to have this decision reversed. So this is South Down and not Upper Bann. So why my interest? Well, my interest comes in 2 forms, if I may. First of all, decisions like this are not unusual. The destruction of our heritage is not unusual. I just need to look to Warringstown, Rath and Grange, destroyed 20 years ago through a flawed planning application and permission. And although everybody has said that they got it wrong, nothing has been done to replace that. So that's another example. Likewise, and maybe people won't have even heard of these, but the Ballinataggart megalith, which is known as the Giant Graves in County Armagh. Lifted up, removed from site, went to the Ulster Museum, were set up in the Ulster Museum. Then they wanted more space, so they took them up, and they're now lying in a heap in storage somewhere, and it's our heritage being lost. So I have a genuine interest in our heritage, our Irish heritage. It's important. It's important to me. And therefore, we need to fix what we got wrong. Simple as that. Fix what we got wrong. The other issue that I have, and I informed the other MLAs from Upper Bann, is this. If at the end of this month, the Department for Infrastructure say they're going to put in enforcement action, there's likely to be a cost. And that cost will be to Armagh City, Banbridge and Craigavon Borough Council. Therefore, it will be to all of my constituents. And having spoken to the planners at the ABC Council, we could be talking about hundreds of thousands of pounds, if not in the million. And it will be my constituents who foot the bill. And people say, well, they won't really, it'll come from somewhere else. Well, not directly won't foot the bill, but possibly indirectly they will foot the bill. And I think that would be unfair. It was a mistake made by the Department for Infrastructure, the DOE. It was compounded by the Historical Environments Division at DFC. I'm not blaming anybody. It happened, but it needs to be fixed. And it could have been fixed, because DFI could have fixed it under Section 75 of the planning regulations. They could have said, no, just get it back to the way it was. But they didn't, and it's rolled on. So what's the debate about? Well, the debate is talking about what should be important to us, and that is understanding our history. We often talk about a shared history. And I can tell you, if you go back to Neolithic times, to the Bronze Age, if you go back to medieval times, we were one people, and that is our history. And it is being destroyed systematically. I'm in no doubt whatsoever that Iveagh should be returned to the way it was. The bill for that should be picked up by those who made the mistake. Those parliaments just pick up the bill and get it back to the way it was. No sleight of hand, no telling tales, no saying we can't do this. Just get it back to the way it was. And I'm hoping that a report that comes out at the end of this month by the planners at ABC Council will make that recommendation. But certainly what we need to do, and what I hope the Minister will do, and I'll just so everybody knows, I was due to meet the Minister on the site. She has shown a real interest in this, but the weather was pretty awful, so we didn't manage it. So the Minister has shown an interest in this. But what I do hope is that the Minister can put some sort of pressure on to make sure that we get the outcome we want, because it's our shared history, our shared heritage. It's a shared site. And although it might be in County Down, it's as much mine as it is anybody else's. Thank you, Mr. Speaker.
Thank you. And members, we have 5 members on the list for speaking in this debate. So these members will have 6 minutes each, with an additional minute if there is an intervention. Now, it's not compulsory to make an intervention, nor to take an extra minute, but I now call on Jim Wells.
Mr. Speaker, first of all, can I thank the member for Upper Bann for bringing this subject to the Chamber in the form of an adjournment debate. I think it's a very, very important issue, one that I've been involved in since its inception, in an area I know very well. Members maybe are not aware of the area. Iveagh is a hill just as you're approaching Riff Island from the Bann Bridge area. It's a very prominent feature in the landscape. And as we knew at the time that the original application went in, and now know even more about as a result of the work of the Friends of Iveagh, it is an extremely important historical site. In fact, the more research that's done, the more important it becomes. Now, we need to go back to 2013, when planning, of course, was the responsibility of the Department of the Environment Planning Service, and they made an absolutely fundamental error. Now, I could understand the error if they hadn't made exactly the same mistake a few years earlier with Finnebrogue. Finnebrogue is an important historic domain near Downpatrick. A planning application came in for a deer abattoir, known affectionately by the locals as Bambi Belson. And this abattoir was built in an area, and it was then discovered, unfortunately, that the planning service had not consulted the relevant branch of what was then the Department of the Environment to establish the historical context of the estate. So it was approved, and then they discovered they'd made this fundamental mistake. And indeed, when it went to a planning appeal, the planners noted the major gaffe that the department had made. And they were totally open about it, said, we omitted to consult a part of our department who would have recommended refusal. Roll on to 2013, and of course, we've an identical situation has arisen. I have no doubt whatsoever that had proper procedure been followed, then we would have been in a position whereby this application would have been refused. But it wasn't. And therefore, what is now on top of that hill, which makes it look more of an industrial site rather than a very important archaeological site, would not have happened. I do resent the fact that the ink was hardly dry in the permissions and the developer moved in to erect various artefacts, various structures on the hill. But on top of that, there have been a series of developments that have occurred since, including a roadway, which do not have planning permission. Now, when the department accept that they've made a fundamental mistake, it shouldn't be the District Council, Armagh, Banbridge and Craigavon, that have to pick up the bill for that. It should be the department. Now, this is where it gets difficult because the responsibility has moved now from the Department of the Environment, which of course is now part of DERA, to the Department of Communities, and therefore that makes it a bit more difficult. But one of the reasons why the Council has not been able to take action, that they realise that there will be compensation will have to be paid, or legal action will be taken if enforcement action is taken. And that puts them in a difficult position because it's coming from ratepayers when they weren't actually responsible for the decision in the first place. Now, there is precedent for this. Ballinahome Bog in South Londonderry, a major example of a raised bog. Planning approval was given about 25 years ago for peat extraction. Friends of the Earth took a judicial review against the then DOE Department of the Environment's decision. That was successful. The decision was overturned and compensation was paid to the developer, who was Bulrush Peat. And Ballinahome Bog to this day remains as it was centuries ago. So having done that, and it wasn't expensive, we have to accept it was expensive. But equally, I see exactly the same parallel with Iveagh. This is such an important archaeological site that the only way that I can see out of this particular difficulty is to Armagh, Banbridge and Craigavon Council to revoke planning permission and for the Department of Communities to pay any form of compensation that's required. Because this site is simply far too important to allow this to continue, this very unfortunate position to continue. I know that the Minister was due to come out to the site because I got an invitation. I was surprised, but I got an invitation, and I would have been there. But I then got a note to say that because of the weather, and it was appalling weather, that it couldn't go ahead. But I do hope, even after this debate, that the Minister will appraise herself of the site. Not too many people in North Belfast would know where Iveagh was, but I hope there'll be one more before Christmas. Now, why this is so important is that the only thing that is driving what's going on in Iveagh is the ROCs payments, the subsidies paid for turbine generation and for transmitters. So we as taxpayers are paying for the destruction of Iveagh. So therefore we, as an Assembly, paying out that money through the ROCs payments, have every right to take action to undo the damage, because this development would not have occurred without these subsidies. So therefore I call upon the Minister on this particularly special occasion, because I know that revocation is a very, very blunt instrument and should only be considered as an absolutely last resort. But I think, as the member for Upper Bann has quite rightly pointed out, this is too important to allow this problem to fester any longer. Action has to be taken, and I'd like to think in a couple of years' time you'll drive past Iveagh and think, isn't that wonderful? It has been restored to its natural context.
Thank the member, and I call Sinead Ennis.
I want to thank Doug Biddy for bringing this adjournment debate to the Assembly this evening, and for the Minister for her time as well. And I think it's good that we have this collaborative approach across constituencies, this two-pronged approach to come at this issue and try and find a resolution between South Down and Upper Bann. And, you know, unlike any other time, I have to say I'm not happy to be speaking on this subject, because it fills me with such desperate sadness that, you know, when I have to think about what's been allowed to happen at Iveagh, and of course the surrounding site itself. Like Mr Beattie, I want to pay a huge thank you to the Friends of Iveagh and to Anne Harper particularly as well, and to the whole campaign group, because they've worked tirelessly over the last number of years, and it's been a real quest for them to right the wrongs at Iveagh, to reverse the damage and protect and preserve the site and the surrounding landscape from further destruction. I've been only too happy to work with them over the last number of years, and I try and help them in any way I can. And, you know, I want to pledge my support tonight to continue to do that on an ongoing basis. I think before I get into the specifics of the issues relating to Iveagh, I want to make this point, because I believe wholeheartedly that the thinking and the attitudes behind the shocking
planning decisions relating to Iveagh and other decisions like this point to a massive collective problem we have right across this island in our attitude to our history and our heritage. And we've seen this demonstrated recently with the demolition of the home place of the O'Rahilly in Dublin and the abject failure of the Dublin Government to protect the battlefield site around Muir Street. The historic, ritual and archaeological importance of these sites pales into insignificance compared to their potential economic value, and therein lies the problem. Mr. Speaker, what's happened at Iveagh really is nothing short of a disgrace. Iveagh was the power hill of the tribal lords of the area of County Down for millennia, and leading experts now believe that it was the site of rituals, including inauguration of the Lords of Iveagh. It is also the location of an ancient burial cairn, which is a scheduled monument protected by law. Investigations into Iveagh and the surrounding area show a series of linked sites of a significant historical importance, each one a clue hidden in plain sight that leads to a deeper understanding of our local history and the history of the McGuinness clan, as Doug Beattie has pointed out. Archaeologists also believe that the lands at Iveagh may well contain additional important structures. Given the huge importance of Iveagh and the surrounding sites, and the fact that it is a scheduled monument protected by law, it is unfathomable that any statutory body would give permission for any work at the site which would cause it to be damaged. But unfortunately, that is the reality of what we are dealing with. Iveagh hillside was damaged by the erection of a broadband mast built without planning permission or retrospective planning permission from ABC Council. And Minister, I do want to acknowledge the role that your department has subsequently played in ensuring that that unlawful mast was removed. The Council stated in its refusal that the development would have an adverse impact on the integrity of the monument setting, which is a site of regional significance. Despite this, planning permission was granted by the then DOE in 2013 to erect a wind turbine more than twice the size of the broadband mast. How was this allowed to happen? Why did no one tasked with the protection of this site step in and stop the unlawful destruction of a scheduled monument? Despite the multitude of failures at Iveagh, it is still not too late to act. It is not good enough to simply say, let's learn from this and move on. So, like Doug Beattie, I'm calling for all those with responsibility, and to paraphrase you, get it back to the way it was. Let's undo the mistakes made at Iveagh, assess the damage already caused and commit to protecting this and other sites for generations to come.
Thank you, Caoimhe. And I call Sinead Bradley.
Thank you, Mr. Speaker. I too want to thank the member for Upperban for bringing this to the House today. At the outset, I think we couldn't overstate the critical importance of this site, and it is a Neolithic mound which predates the pyramids and Stonehenge, and may be less well known than Navan Fort, Newgrange or the Hill of Tara, but it is no less significant. The burial site and inauguration site does refer back to, it is of national importance, and associations with McGuinness and the McGuinness clan, which continue to be celebrated at Moore Point, are not lost on many. It's a 5,000-year-old cairn, and it was subject to an archaeological dig, has been referred to, in 1957, which revealed the hillside covered in layers of bone and ash. And as has already been mentioned, the Friends of Iveagh, and in particular Anne Harper, who I also met with, so diligently revealed to all of us further information with further investigations as to the sensitivity and cultural significance of this site. It is our shared inheritance. It predates many of the divisions that ever existed on this land, and we're right all to share and be passionate about its future. It was disturbing to see some of the reports coming out from media that suggested government departments realising their error and making an absolute deliberate decision to create another error rather than face up to the hardships of the first one. And that may well be, as Mr Wells alludes to, because of the financial impact of facing up to what went wrong. The story of Iveagh, sadly now, has a chapter within it for our generation that we should be ashamed of. We genuinely have to ask ourselves, how did this happen? And I do welcome the Minister for Communities for coming here this evening, because it is that shared responsibility that we have all with her in the defence of our heritage and archaeology. I don't lay blame. I won't spend this evening to do that, because this is too critical of an opportunity to say what can we do about it. I could list ministers, I could list dates, and I could list events. And it's absolutely right to say that there are so many questions about how and why did that happen. Process, policies, procedures have been set aside on numerous occasions, layering the whole confusion and impact of the devastation that has happened on this site. I personally, Mr. Speaker, am on public record as one of the objectors to the planning application for the retention of the mast on the site. And like many, my situation is clear. It is obvious to all to see the harm that has been done there. What I am less clear about is, how can this be restored? Can it truly be restored in a way that is archaeologically satisfactory? The damage has been done, let us make no mistake. But it is on us to find a way. How can we best preserve it or fix what has happened for generations to come? Minister, I will repeat the title because I think it is an appropriate one, and I know it is the one that probably brings you here this evening, and it is that Defender of our Heritage and Archaeology. On that basis, I look forward to working with you and stepping forward as this House unite and finding a resolution to the problem, the unforgivable problem that exists at Iveagh. Thank you, Mr. Speaker.
Thank you, and I call Andrew Muir.
Thank you very much, Mr. Speaker, and I thank Mr. Beattie for bringing this issue to the Assembly here tonight as Alliance Party spokesperson on finance and infrastructure, and also from North Down, so there's a lot of constituency interest in this. In Northern Ireland, we are blessed with a stunning natural environment and great wealth of ancient historical sites. The landmarks around Iveagh date back to the Neolithic period. It is crucial that we seek to preserve and protect sites such as this. These sites are across Northern Ireland, and I would like to, at this point, express my thanks to HED and other bodies for the work that they have done in preserving them. There's much been done, but there's a lot more to do. One of the sites I have a particular interest in, and they're all over Northern Ireland, and some of them are lesser known, is one right down beside the border, is at Killinassaggart. There is a pillar stone there, and it's reported as the earliest historically dated inscribed stone in Ireland. Right on the border is actually preserved. I visited it once. I was coming up from Dublin, decided to go and visit it. There was an electric fence around it. I found out that it was switched on, but it was worth it because the history around these sites is fantastic, and the work that's done in preserving that is to be appreciated. But not all of them are the same or electrified in the same manner. It is clear that the issue with regards to the wind turbine and the mast at Iveagh date back to 2012 or 2013, and other concerns from the Friends of Iveagh go back even further than that. It is also clear that the Department of the Environment made mistakes concerning the original planning application. It is also clear from subsequent developments this is not an isolated incident. Since then, the Planning Act, implemented in 2015, has fundamentally changed the planning system in Northern Ireland. In the first instance, the power for determining local applications now resides with councils, and I would declare at this point I was formerly a member of Ards and North Down Borough Council. I would agree with the point from Mr Beattie that now that the power is with the councils, to ask Armagh, Banbridge and Craigavon Council to rectify this and to take the financial cost with that would be unfair and unburdensome because this is one example of planning applications and duties that transferred to councils. And in the particular financial situation at the moment for local councils, they just couldn't burden or take that cost. The power in relation to local planning applications should actually now be with local councils. It means that local representatives, accountable to local people and armed with the local knowledge, can make decisions in order to protect local sites of historical interest. The new system also includes a safeguard whereby the Minister for Infrastructure can call in an application which is deemed to be regionally significant or otherwise. It I understand from my colleagues on Armagh, Banbridge and Craigavon Borough Council that Knock-Ivy remains a live issue and they are regularly contacted by campaigners. That's why Mr Beattie has obviously brought this issue to the Chamber. In the first instance, and for the reasons I have outlined above, it should be for the local council to provide clarity on this matter with financial support as required. An application process that is still disputed more than 8 years after the original decision serves nobody's interest, but is sadly all too common in Northern Ireland. The Infrastructure Committee recently considered the terms of reference for a planned review of the 2011 Planning Act. This review will seek to determine whether the Act meets its objectives. Our current system remains far too slow and ineffective, particularly with regard to the applications such as the one at Knock-Ivy. We must use this review as a genuine opportunity to make the system better. In closing, Mr Speaker, it is of crucial importance that we protect historical sites such as Knock-Ivy, and the 2011 Planning Act gives councils the power and the ability to do that. This must be done on the basis of planning policy, which also recognises the importance of our ancient heritage. Many people come to Northern Ireland, they come to Ireland, they come to the British Isles to see what we've got on offer, and one of the main things is these sites. And what we have to do over the time ahead is ensure that we're protecting them, and if there's issues that have occurred in the past, we seek to rectify them. Because I remember visiting Newgrange a number of years ago, and I was probably the only person from the island of Ireland there, because everyone else was from across the world. And hopefully one day we can get back to a situation where we can have visitors and we can protect these sites as one of our jewels in the crown. Thank you.
Okay, thank you. And I now invite the Minister for Communities, Carol Ní Cullen. Minister will have 10 minutes, but we have additional time because we're early in the debate. Thank you.
Thank you very much, Mr Speaker, and thank you, Doug, for bringing the adjournment debate here. I also want to thank Doug and Jonathan Buckley, Jim Wells, Sinead Ennis, Sinead Bradley and Andrew. Andrew's comments about, it was worth being electrocuted to see Kilnasaggart will be forever Hansarded. I'm also going to check Hansard for other comments that were made just for accuracy. But, look, I'm happy to be here. I'm not getting dragged here. I'm happy to go to this debate. And I'm also happy to visit Knock-Ivy when the weather is a bit better, when you can actually see it. I don't mind, getting caught up or getting soaked in the rain. It doesn't bother me, but I would like to see it. And the significance of the burial monument, has been mentioned by everybody who spoke here this evening. So just to be clear, my department legally protects the ancient burial cairn on Knock-Ivy Hill, and it does that under Schedule of Historic Monument on the provisions of the Monuments and Archaeological Objects Order NI Order 1995. So this statutory designation recognises the regional significance and indeed the national significance of this historic and very important site. And these legal protections have been in place from 1996, with the site being included on the Sites and Monuments record for a considerable time before that. So there's history of Knock-Ivy in the departments, let alone within the community. So as a result of that scheduling, my department undertakes regular inspections of the cairn and provides management advice to the site owner and must consent to any works affecting it. So there are two main impacts from what everyone has said this evening, which have been the focus of recent detention at Knock-Ivy. So an unauthorised broadband mast and a wind turbine. So as a statutory planning consultee, my department's Historic Environment Division has provided advice to the Council Planning Authority, which has led to the successful removal of the broadband mast from the hill. Related impacts to the top of the hill and the cairn setting have been repaired through planning enforcement. So there's an example of when we use our power to best effect. An intrusion into the scheduled area surrounding the cairn, where a shallow depth of sod and topsoil was removed, occurred at the time the broadband mast was erected. This has now been resolved through a legally agreed scheduled monument consent process commensurate with the level of impact involved in this breach. The wind turbine and related planning matters are ongoing for consideration by ABC Council, who are the planning authority in this case. So planning permission for this turbine was granted in 2013 by a former Department of the Environment prior to RPA and the transfer of planning responsibilities to councils. And Doug, to be fair to him, clarified that at the start of the debate. However, departmental archaeologists were not consulted, and they should have been. And that is a fundamental mistake, certainly.
Would the Minister accept from me, had they been consulted, they would have made a very strong recommendation that the application would be refused and we wouldn't be sitting here tonight having this debate?
I imagine that would have been the case, but I can't retrospectively, say that would have been the decision. But given the way in which this division within my department made sure that that wrong was put right, I would have imagined they would have been very proactively and very aggressively putting up an argument about the historic importance of this site. And I do believe the council planning application in this instance was flawed, and that's my opinion. It is important to note that the wind turbine and associated works, regardless how many metres they are away, it is unsettling, and it has been a consistent concern. That is why we're looking at the impact of unsettling the cairn and that historical area. The council continues to consider requests to revoke planning permission for the turbine and indeed to discontinue the use of land for wind energy generation and removal of the turbine development. My departmental officials have provided substantial expert advice on the archaeological impacts of the turbine to inform this consideration for the past 3 years. However, and I'm not passing the buck, I'm just stating the obvious, I don't have any legal powers with respect to discontinue this or the revocation of planning permission. This is a planning matter, and any associated compensation is something that does need to be considered. So I hear what people have said. Certainly.
The Minister is absolutely correct. She does not have the power to revoke planning approval. But what she does have is the power to consult with Land Bridge and Givan Council to offer funding to enable them to pay any compensation that would be required in order to revoke.
And I hear what the member has had to say. So what I'm saying is that while that's the planning authority, and we are still talking to the planning authority regarding this application, and certainly for them to reconsider this application, I'm not saying it's not my responsibility to ABC's. I'm not saying that. But I will say for the record that this department has supported local government from the start of this pandemic, prior to it, and will support the councils afterwards. And the member is well versed in conventions, but there is a convention required. The Valletta Convention includes that statutory schedule and protection undertaken by the department around heritage and archaeological protections is required under that convention. So it is, in my opinion, unbelievable that we weren't involved as a consultee. So what are DFC going to do? Well, without repeating what I've just said, my officials are playing a key role in addressing a number of issues at Iveagh, as we say in North Belfast, as you say in South Down, Iveagh. So that says it all for me. But the issue is, do I understand the importance? I absolutely do. I absolutely do. And my officials will continue to monitor the situation there and ensure that the relevant and statutory policy protections for this site are respected and, more importantly, are upheld. Surely.
Minister, for giving way, and again, I think it's probably coming home to a lot of us, this seriousness in which this archaeological vandalism has been allowed to happen on a site. But Mr Beattie mentioned a number of other sites potentially that come to mind to members in relation to our own constituencies, and he did mention one being the Giant's Grave, which is particularly in my own constituency. Again, this causes me concern. I realise you won't have it to hand, but would it be possible for your department to look at where that stands in relation to, we're told by the champion by Richmount Rural Community Association about how these ancient artefacts and stones are now lingering in a museum, not even on display. So perhaps maybe she could come back to me at a later point with that. Thank you.
So the member has very cleverly got his constituency weaved into 2 other people's constituencies, and he has my commitment. I'll come back. My official Ian Greenway, as I'm sure many of us know, is nodding, so we'll come back. And it is disgraceful that some of these artefacts are withering away in storage. I've always found it disturbing that that's the case, and what's more, the public are paying through the nose for that storage. Doesn't make any sense whatsoever. So anyway, we will continue to provide advice to the ABC Council, and as well as that, we'll continue to ensure, even through the development of the local development plan process, that there needs to be appropriate protection of Iveagh and its historic landscape and the setting around it, because the whole setting is important and it shouldn't be disturbed any more than it needs to be. And I would like to conclude by appealing to people, particularly in ABC Council as a planning authority, to read the Hansard of this debate and to ensure that not only are our considerations taken on board as much as possible, but indeed we've all a role to play in the preservation of a historic society, historic communities, and indeed the artefacts that we need to protect and cherish for generations in the future. So thank you, Doug, and the members who have spoken in this debate.
Okay, members, I'd like to thank everyone for their contribution and the good conduct and the substance of all of the contributions. On that basis, then, the Assembly is adjourned. Assembly is adjourned. Thank you.
Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is